Are you ready for it? I'm a real tough kid. I can handle my shit. They said fake it, gotta fake it till you make it, and I did.
I'm just a terrible person, I guess.
Lights, camera, bitch. Even when you wanna die. Breaking down, I hit the floor. All the pieces of me shattered as the crowd was chanting more. With a broken heart.
Who's afraid of little old me?
And good evening, ladies and gentlemen. Welcome back. I am Sarah the Raging Tomato, bringing to you live another Throwdown Thursday. RTP just couldn't get enough of the tomato time. He's not burnt out yet in this place, and we're gonna run you dry. We're gonna run you to the point where you won't even be able to eat ketchup without thinking of this place.
It's devastating.
We are still working on, I forgot to ask you backstage, actually, we are still working on a debate with you and Rob Noor. But I think the last time I left it off was whether we wanted to turn it into a 2v2 or leave it as a 1v1. And that would determine if we put it on a Monday night or not.
Oh, I thought we left it off where he was gone. I thought that we were just going to schedule it, but he was gone.
It was weekends, and then I said I can turn it into a Mod Monday, but we'd have to do 2v2 for that because then we could get it in sooner.
Oh, let's just do 1v1. We'll wait. That's fine.
That's fine.
Wait.
We have to make them wait. Are you not entertained? But this evening, oh God, I got to bring up the whole freaking question because it was too big to actually put the full title in place. It was crazy. What was the
compensating?
Yeah. Okay, let me pull this up here. The entirety of your prompt. I want to make sure I say this all and say it all correctly. Medicare for all is the best possible solution to stabilize healthcare and give power back to the American people. So when you say that, in my mind, I was presuming universal healthcare to that degree. Is it something similar to that?
It is a form of universal health care. Medicare for all essentially is insurance. It's just basically putting all citizens under one insurance plan, and that is through the government.
Is it free? Is it like one charge suits all?
So in Bernie Sanders' Medicare for All bill, which is or I guess proposal, which is what I'm going off of here, there would be no copay, no deductible, but it would be paid for through a bunch of different taxes.
Okay, and so, but you think that everybody within American society should have access to that?
Yep.
Okay. Now, the taxes that go into it, where is that? Is that based off of some kind of formula?
Yeah. So it kind of depends on how you want to pay for it. There's a lot of different ways that you can pay for it. The first way would be like a 2.2% premium, which would be paid by households, and that would come out of like income, 2.2% of income tax. You would also have to have a progressive income tax rates, so higher tax rates for individuals with families with incomes over $500,000. You would take capital gains and dividends and tax those the same as your income rate. You would change the estate tax. I know we just moved it to 15 million, but you'd have the estate tax over 3.5. Like the exception would be limited at $3.5 million, and then you pay a 1%. Or excuse me, a 0.3% tax on speculation, like Wall Street speculation. So there would be a tax there as well, and then that pays for everything.
What is Wall Street speculation?
It's a tax for speculative traders. So just the 0.3% or 0.03% on every trade on speculative trades.
Okay, that's fair. All right. So then, with the tax bracket in place, like, because it does sound kind of like it's a bracket, right? It's a percent based off of essentially based off of what you're making that you would pay in as a premium. Now,
It would be the
uh,
normal income tax brackets, like whatever the income tax brackets are. Then you would have a 2.2% increase
based
on your
off
taxes. Yep.
based off of that. Now, where does that stand then with like the difference between private insurance, where you can get competitive pricing, or let's say maybe I'm just one person and maybe I make $500,000 a year and I'm like, I don't know, 30 and perfectly healthy and I just happen to do very well financially and I would be paying this higher premium, but I'm not really utilizing that insurance to the degree that per se like a family of 5 uh, on like a 80,000 household income would be utilizing.
Sure. I mean, we already do this with all social spending. Not everybody has a car. Not everybody uses the roads a lot. Not everybody uses public libraries or public pools. Most people are never going to use the fire department. Most people aren't ever going to use the police. We already do this, and law-abiding citizens and wealthier citizens already cover most of this bill anyway. So it's normal for taxes. We don't always use what our taxes go into, but this would be a
Mhm.
way to make sure that everybody in the United States has health care.
Okay. And then now would this knock out the competitive private insurance? Like would that knock out that whole market?
I mean, it would exist, but it would exist much smaller. So you would still have private insurance for people who wanted elective care or things that aren't covered by universal health care. So you could still get elective private insurance. But the thing about having private insurance on top of this is that would actually act as a free market, because then it would actually be a market. It would be only people who are willing to pay for it. You're not going to be able to overprice people, and you can't price people out of that. And so it makes even the private insurance markets act more like normal free markets, but they would be substantially lost. I mean, you're going to lose a lot of jobs out of the private insurance market.
I mean, is it and you're saying it's a net gain to American people, but it would still be a net negative to the private insurance market.
For the employees, the industry as a whole would go away. I mean,
Mhm.
as it operates now, yeah, which is a predatory industry. I think it's ridiculous that there are people that make $50 million a year when all their
Mhm.
business does is pay a bill. That's it. That's what we have to remember. That's all health insurance companies do, is they pay our
Mhm.
bill. We give them money, then they write a check to pay for the bill. And there's people making $50 million to run a company where they just pay bills.
Mhm. Do you do you think that would drive medical charges down?
Medical. What do you mean by medical
Like,
charges?
let's say I go to the ER, and I'm on your plan. If this plan encompasses all of American, structure for health insurance, and even though we still have some private health insurance, would like I get that medical bill. I mean, we see them they charge for a tissue,
Mhm.
at this point. Do you think that that would drive the prices down for doctor's appointments, ER, uh, you know, uh, like,
Are you saying
your
like the amount that
regular.
the doctor would take in? Is that what you're asking?
Mhm.
Yeah,
Yeah.
so it would. The amount per visit, Medicare already pays about 40% less than private insurance. I've seen between 20 and 40%, but I'm giving you the high number. I
Mhm.
think the number's closer to 25%. But when you include everybody that's in, and they've done these studies, like the CBO did a study, and essentially they found that almost just on average, this would increase the revenue of doctors and hospitals because of the amount of people that are coming through, and then the reduced regulatory burden of dealing with these private insurance companies, because now you're dealing with one insurance company at all. So the regulatory burdens are, many of them removed. A lot of the red tape is removed. And when you see a CBO score, I think it's I have it here. I want to say on average like an extra $1,900 a month. I'd have to find that number, but yeah, when you look at the scoring, they will actually be seeing more patients and making more revenue.
Okay. And then now would that kind of mess up though, in terms of, let's say I have my healthcare physician that I use. And let's say we all now suddenly more people can get on health insurance, and more people can make physicals, more people can, have doctor's appointments, so on and so forth. And we're all under one umbrella plan. Would that kind of flood the gates of the doctor's appointments, your ER, your urgent care, all of these things? Would that essentially kind of flood the gates to getting an appointment at that point? Because now there's no selective ability of choosing, based on healthcare, in network, out of network, all of these different factors.
Yeah. So basically, like right now, do you have health insurance through your employer?
Yes.
Okay, and you have a network that you have to find a doctor within, right?
Yeah, I can still go out. I think I know I have a PPO, and I can go anywhere
Right.
essentially.
But then you have to pull from that PPO, right? And a lot of people have an insurance where if they go out of network, there's extra associated costs. There is no network anymore. Everybody is on the same health insurance plan, so there's no in-network, out-of-network. But like, this is already a massive problem in this country because because not everybody has health insurance, but because we also have an obligation to care for people who show up at the emergency room. This is already happening. People are putting off long-term just basic checkups and preventative care until the point that they show up in an emergency room. And so this would probably lower the amount of people showing up at emergency rooms. It would increase the amount of people going to see doctors. But in Bernie Sanders' plan, this rolls out over 10 years. And so basically what you have is you take the Medicare structure as it is now, and then you take everybody 50 and up and you add them into Medicare. And then 3 years later, you're going to do another 10 years. And you're going to do that until everybody is on Medicare for all. So you have a ramp up period. And this will probably give us a much bigger demand for doctors. It'll make medical schools more competitive. And if we can do something about, on top of that, with student loans, if we can subsidize college, then we could easily fill those roles.
Well, I mean, you said you'd start at the higher age. Wouldn't you want to start at the child level? I would think that would be the most important level to get on health insurance.
So most states already have some sort of health insurance for children that's already included
like
through
WIC.
like WIC, so through Medicaid. You could add a structure where you add the children in there already, but it's really about paying for it. And right now, what we have budgeted for is people that already qualify for Medicare. And so when you increase these taxes, that's going to take some time to build up that money. And so you don't run deficits. And so that insurance companies can kind of slowly roll back. And a lot of these people that are going to get fired from insurance companies are going to wind up working for the government instead. So you have to roll it out slowly. You can't do it overnight.
Well, I mean, do you think our government is kind of filled enough with handling a lot of things? I mean, I feel like we should almost be minimalizing what we put in the hands of the government. I mean, what if the government decides to amp up all of the prices, and then, whereas maybe a private market might have been able to maintain
the price of what?
Like that percentage, or maybe even hitting that next tax bracket, because then the more money you make, right? Obviously, the more money you make, but then that percentage begins to increase, and maybe you're not prepared for that each time. And then I feel like you can't get ahead. Whereas if I work for an employer, my insurance stays the same rate. I get, it's like what, $30 every 2 weeks I pay out.
Sure.
For
Well,
my premium.
Your rate changes usually every year. Sometimes every 6 months with your employer, and sometimes they have to raise that price. But what you're including in that is like 12% of what you're paying into, just off the top, 12% of what you pay into insurance is going for overhead costs and that's on top of just like the infrastructure. We're talking about CEO pay, salespeople pay, infrastructure pay, bonus pay. 12% off the top, you're already losing out of the money that you set aside for healthcare. So we eliminate that immediately. The fluctuations that you see in the market are twofold. One, you have a bunch of these private health insurance companies that have private equity investors, and they have to give those people a return on investment. So by definition, the price has to go up every year. They're going to have to create revenue every single year. So your prices are always going to rise. But two, you lose the ability to collectively bargain as a whole. The one great thing about Medicare for All, and the reason that literally no other country on earth copies what we do Everybody else does it different. It does some sort of universal health care because the general principle of collective bargaining, we can take 330 million Americans and we get to bargain with the pharmaceutical companies for fair pricing. That is as free market as it gets. That is every American negotiating together for the lowest possible price. That is a true free market, and that's why our prices come down. We pay double what almost everybody else does in the world, and they're all providing medical care for everybody in their country.
Don't we have like top notch? Aren't we? Are we like at the top of the creme de la creme in terms of the medical world, though?
Not even
Or is
remotely.
there somebody else is doing it better?
Yeah, we're horrific at it. So if you look at, let's see if let me pull this up real quick. When you look at outcomes, countries with single payers, so Canada, the UK, Australia, they have lower infant mortality, longer life expectancy, higher patient satisfaction in the United States. They have on average lower wait times. The longest wait times in the world out of all the rich countries is Canada, and then we're number 2. So every other country below us has shorter wait times, and they have universal health care. Now, Canada's system, I don't like. I don't think anybody's trying to replicate Canada's system, but doing it this way allows us to collectively bargain. It allows our libertarians to still feel like we're in a free market, but it would improve our outcomes. Just the access to preventative care alone would save us billions of dollars every year in treating diseases that we could have caught early and treated early for a minimal cost. Rather than and I mean, this also takes people off of disability. We have less people getting on disability, and it removes the number one reason people go bankrupt in this country. Medical bankruptcy is the number one driver of bankruptcy. It's like, I think something like 40% of bankruptcies are medical bankruptcy. This eliminates that overnight. No more medical bankruptcies.
That's fair. Now, what about for doctors? I mean, would their salaries you kind of mentioned earlier that it would actually drive up the numbers, right? Because more people are seeing the doctors, but that would also at the same pace that would kind of cram up their calendars to a point where maybe they're not giving it's quality versus quantity. That's
our quality is already lower than theirs. Like when you look at outcomes, when you look at like our life expectancy is down. Like we're down to 76.4 years. That's the lowest number it's been since 1997. Like we already have really shitty care. There is this weird thing about the fear of socialism has led us to have the world's worst medical system. It's horrific. Our outcomes are bad. People talk about the VA and Medicare. Medicare and the VA, who we shit on all the time, they both have better overall satisfaction and better health outcomes than private health insurance, and they are at a fraction of the cost.
I would when I had the VA medical stuff, I was like, fuck this. I'm so done with these people. It was so like I couldn't get an appointment for like 4 months. It was terrible. And then, even like women's healthcare was even worse. I was just like, this is horrendous. I couldn't wait to get off of that insurance plan. I couldn't wait.
But if you compare their outcomes and you compare just on average, I know everybody has an anecdotal story for it, but if you look at outcomes and patient satisfaction, it's actually higher with both Medicare and the VA. And that's on top of like 60 million Americans don't even have insurance. So they don't even have the option of the worst insurance that we have. They have no insurance.
Well, a lot of states provide, I mean, I think don't we have Obamacare now, right? I mean, that's a thing where you can kind of purchase through a private, I think it's kind of semi-private.
What Obamacare is government subsidized private health care. So you can go on and you can buy insurance from, let's say, Aetna, and depending on your income, the government may subsidize some of that. You may get a discount, you may get it covered, but that's still hard to qualify for. And this leaves out like there's this gap of people, especially self-employed people. If you want to be self-employed, I'm self-employed. It is for me to have health insurance is virtually impossible. I can't afford health insurance for my family without like significantly cutting out other bills. There's other ways to go around it, like cost sharing programs, which is what I do. But it is unattainable for people who want to be self-employed. Sometimes it's crippling to small businesses. We talk about the expansion of corporations and the attack on small business. I don't know that there's a bigger attack on small business than saying you have to provide healthcare. Even these medium-sized businesses, if you take that away, if you take away the obligation for businesses to pay for health insurance, one, they can invest that money other places. But two, the people who hate their fucking job, but they stay there because their kid has a condition and they can't afford insurance on their own, those people can go start their own business. They are no longer limited to work for somebody who offers the best benefits. It really does open this up into a truly more free market. I don't think people realize how much health insurance limits you and your options of where you want to go in life.
I would agree with that. I mean, even now I'm kind of between a rock and a hard place because I do have my 9 to 5, and then also I have my 9 to 3 a.m. With streaming with you fine people. Though, like now that the channel's kind of at a point where I could afford to stop working, but I'm like that healthcare insurance, and because my daughter does have, like a terminal thing, like it would be retarded for me to try to purchase private insurance on my own. It would be
very cost
absolutely,
ineffective.
and I'm like, why would I do that? So I just lose sleep to keep my health insurance. It's just it's worth it to me. Like I said, it's like $30, $40 maybe every 2 weeks. Like that's really hard to beat. Um, and you mentioned the small business, like the attack on small businesses. I think you got a piece there. I would be very agreeable to that because I don't know if, uh, like, because we are capitalism based and all of those fun things, like, I don't know if small business is really set to, like, we don't necessarily cater to it as a whole. And even if you are a small business going from small to big, there's that big risk jump, and it's a make or break point, but the system doesn't really allow you to do it unless you already have a lot of capital put in to
Right.
like save you through that back end, where that gap is going to sit. So
Yeah, the fear of socialism stops us from doing so many things in this country, just because everybody uses the stupid slippery slope fallacy and says like, oh well, if we do this, then we're socialist. But I'm just looking at this. I don't have an ideology in that way. I think a mixed economy is the way to go. I'm just looking at the outcomes, and I'm looking at every other country, and I'm saying if we're going to look at this honestly and objectively, do we have a good healthcare system? No. Are there others that do it better? Yes. Are we even close? Not even close. We're in like the 30s for health outcome. For maternal mortality, we're in like the low 40s. For infant mortality, we're in the 40s. We are, for the richest nation in the world, it is embarrassing how much better other countries with a smaller pool of people, meaning that they can't spread the risk out as much, are providing much better outcomes than we are. And we could do it. We just choose not to because of the fear of socialism.
Well, I mean, don't we kind of essentially already have some socialist pieces in place overall?
Yeah.
I mean, even just I correct me if I'm wrong, but I think even just sending your kid to public school is a socialist aspect, right?
Yeah.
And we all pay taxes into that. It's communal feeding into it. So even
And like,
like
why don't we do private school for everybody? Why do we have public school?
well, and I think that that's where we differ with other countries is, or maybe that's kind of our staple piece is, if you can afford it, you can have it. If you can't, you're on your own. You
Right. And that's
know.
why we don't do that with school, right? Because it disadvantages people who can't afford to send their kids to private school. And it
Mhm.
disadvantages kids through no fault of their own, right?
Yeah, I could see
I
that.
don't I don't know why we would view healthcare any differently. Like it's important to educate kids. It's more important to keep them alive and healthy.
No, I agree. I think, I mean, for me personally, I think the United States has a lot of things backwards, but my number one pet peeve is that we don't have children first.
Yeah.
I think we should be dumping all of our money into our future, and our future is our children, and they should be the number one, the creme de la creme, the first priority of any and everything. And unfortunately, they are the last little tidbits and pieces, and that's where I think we fail a lot of things because I mean, like even if you look at other countries, like even Japan, like their schools, like they go to school year round with like these short little built-in breaks and all of these different concepts. And I've never heard, I mean, again, correct me if I'm wrong, but I've never heard of any schools in Japan that are crappy and don't have AC units. And, you know, like they take their education very seriously. And I think that the United States, we do bare minimum for our children. And I can agree with the healthcare concept. I think children should be our number, because the healthier our children are, the more educated they are, then now we're guaranteeing a better future for us and their children, and so on and so forth. You got to start at the bottom and work your way up. We go backwards. We take care of like the heavier hitters at the top and then work our way down. It's like scraps being passed down. And I just, anytime I've gotten into a political conversation, that's where I go, is the kids.
Yeah. Yeah, no, I 100% agree. I think that in America, the number one thing, you mentioned it, the first thing we focus on is taking care of rich people and making sure that they're happy. And I think that we do that out of fear that if they don't exist, then we won't exist, that our jobs won't exist. And I think that that's been like conditioning by those people. Like there's a reason that rich people give so much money to politicians. There's a reason they want to shape policy so badly. And that reason is because they want to keep their money. I've never, I mean, even like you look at somebody like Bill Gates, who he does all this philanthropy now, but like, where was all that philanthropy when he was building his company? Where was all that? Where was all that? Like, I want to share the wealth then. A lot of people are just going to take care of themselves first, and then they'll give what they have left. But we don't focus on children. We're far more invested in having the most billionaires than we are having the most educated, healthy, and well-adjusted children. Like our idea of like the American dream is make as much money as you can and somehow that fixes it. Which I honestly think I do want to ask this. Like, I've always found this interesting from like a religious perspective, or like the religious right, whatever you want to call it. That like this seems like something that the Christian right would agree with, that we should focus on this, but we focus so much. It seems the Christian right always wants to focus on like cutting taxes. Why aren't we doing something for children? Why aren't we investing in healthcare?
I think I might have the answer to that, and
Sure.
and somebody could also come up and correct me. But I believe the belief in that system is your church and community should be the ones doing that. So for like, and I think that if you look backwards, that's where the care, nurturing, taking care of the poor, so on and so forth, helping each other out as a community, kind of a little bit of a socialist concept, but well, more like maybe communistic, like communal. But so if let's say I, go to church on Sunday, and my, the church that I'm a part of, let's say somebody is in there, one of the community is in there, and their grandfather or their father, whatever, is sick in the hospital. He had a stroke this weekend, and they are already anticipating a high medical bill because he doesn't have insurance, or so on and so forth. Like the church will come together as a whole, and we'll all pitch in money and send meals to the family's house, and ask what we can do. Do you need a ride to the hospital? Do we need to help with this or help with that? And you do it as a community to help that one person of your community. So essentially, if you're part of a strong church community, you don't need to necessarily rely on the government for all of this extra shit, because you as a community figure it out together, and you all pitch in when you need to.
My concern with that is it doesn't work. Like I understand the principle behind that, but like a good example just barely happened with Ben Askren. I don't know if you're a UFC fan. He's a UFC fighter. He's made millions of dollars, and he got a staph infection. That staph infection got into his blood and ruined his lungs, and he went into a coma. This is a guy who just fought Jake Paul like 2 years ago. He's working out every day. He goes into a coma, and he has to have a double lung transplant. Multimillionaire, has insurance, can't afford it. He had to do a GoFundMe. Dana White had to donate money. Like it was like tens of millions of dollars. Like even the rich among us, sometimes these medical bills are catastrophic. What I wonder about these, like I grew up Mormon in Utah. So like my congregation was literally 1 square mile. Every house on a 1 square mile, and in Utah, everything's built on a grid system. Literally every house was Mormon. So we had
Mhm.
very tight-knit communities, and we stepped up and helped each other. But if somebody were to get cancer and need to go have chemotherapy, like, we probably didn't have enough money in our square block to help them. What I would say, though, is if that person didn't have to worry about those medical bills, look at all that could free up for these churches to do to actually do good. We wouldn't be
Mhm.
spending, like, think of all that money you spend in medical bills. How much of that is going to the profit for the CEO of
Mhm.
the hospital, for the surgeon, for the CEO of the healthcare company, for the sales rep who sold the health insurance to that company, for the advertisements that they played at the Super Bowl to advertise that stuff? If we freed up all of that money with a small tax, we would be free. Churches would be free to do a lot more good that, like, I think substantially could help communities. Because if you pay one person's medical bills, you could bankrupt a church. But if we never have to worry
Yeah.
about that anymore, it'd free you guys up to do a whole lot more.
Yeah, no, I agree with that. You were asking in terms of,
The ideology.
yeah.
Yeah.
And I think that that's kind of a built-in factor. I mean, sometimes you just can't do everything, right? But, well, and then they think about that fighter, right? So if he needed, I think you said a double lung transplant.
Double
Was
lung
that what it is?
transplant. Yeah.
Double lung transplant. How
Yeah.
do you do that? But put a couple of balloons in there and call it a day. But
That
I
sounds
mean,
like
that's
the American
terrible,
medical system.
right?
That sounds
Like
right.
we got
And it
this. We
costs
got
like,
some duct tape. you
it still
know?
costs $3 million somehow. Yeah.
Right. But that's that to me, I look at that and I say, we're all paying into this program and he's kind of draining the system for something that uh, but maybe there's a list now of people who need this expensive thing and now it's a long list and now they just are draining the communal bag at the bank of what we use to pay for these medical bills.
Yeah.
So, so I mean, I'm not saying that it's necessarily a fair or unfair thing, but I look at it as, what if we were all on this whole system and this one dude comes in and needs 2 new lungs and now the rest of us are kind of shit out of luck for the next 3 months because the system had to pay for him to get 2 lungs.
Yeah, that's not really possible, though, because we'd have 330 million people, 185 million working, paying into it. That's the whole
Are
point
they
of getting.
all paying into it? I mean, is this like
Well, the
uh
185 is people that are working. So like
mhm.
that. Yeah, that's and that have an income. So you have a 2% income tax, and it'll be higher for people in higher tax brackets, but a minimum 2%. Yeah.
Well, I mean, then now you have people who aren't like the more here's where I fetch my system from, right? The more freebies we hand out, the less incentive people have to work. Now, I understand the other side of it, right? For a small business or a self-employed, people in our position where it would, trying to get insurance plan without paying big amounts of money. But then you also have a lot of people that will take an advantage of that system and say, well, I don't need to work. The state gives me like food stamps and they give me money for rent and then I've got free healthcare insurance. Like, why should I do anything? To me,
Well,
you're adding even more incentive to not have to do anything.
yeah, but that's a talking point that just doesn't bear out in the data. We've never paid out as much as we're paying out now in entitlement spending, and we have record low unemployment. It's just not
Mhm.
true. Like, somebody getting free medical care doesn't pay their bills. Now, again, you could say, like, if they're on SNAP, or if they're on Medicaid, or if they're on unemployment or Social Security, then
Mhm.
yeah, they may not work. But, like, I'm not opposed to work requirements anyways. I'm not opposed to making sure that the right people are on these programs. I think we should be auditing programs like Social Security and Medicaid and Medicare. But doing this is, again, it would actually be cheaper. So the average American household pays about $13,000 a year
Mhm.
for Medicare, or for healthcare. This would, depending on the estimate, you're looking at between $8,000 and $12,000 a person in America, or per household in America, 8 to 12,000. So a savings of between $5,000 and $1,000 a year, and there is no copay and there is
Mhm.
no deductible. The thing about Medicare for all, and the reason that I want to discuss this, is because
Mhm.
I don't think this is a hyper partisan issue. I've never once seen anybody talk to Bernie Sanders about his Medicare for all plan and have them leave that conversation and go, no. Like, Joe Rogan's done it twice. He's like, we have to do this. Yeah, Andrew Santino, he went on his podcast, like, we have to do this. Just like there's really there's nothing that the private insurance market offers that Medicare for all doesn't offer, and
Mhm.
Medicare for all offers it for everybody. There's literally not a downside to it other than like some rich people might pay a little bit more in taxes.
Yeah, no, I mean, I think I would be highly agreeable. I think overall, if we can make it work to where healthcare is either significantly cheaper or to some degree of free, not necessarily free, but to some degree significantly cheaper. If we can get the prices to be driven back down and not be paying for a box of tissues every time you go to see the doctor, um, I would be highly agreeable to that if
Well,
it
let
works.
me
Mhm.
explain how that works, though. The
Okay.
reason that those tissue prices are insane is because you get your bill and you're like, a box of tissues was $50. What the fuck? So you
Mhm.
call the insurance company and you're like, what the fuck? And you get somebody in their customer service and they're like, yeah, this is what we do. And you're like, all right, can I talk to your manager? They're like, sure. And then you talk to the manager and you go, what the fuck? And they go, this is what we do. The whole
Mhm.
point of being all on one Medicare or medical program is that we collectively bargain. So now we have one person who's going to negotiate that for us. Now, these are going to be people that work for the government and they're going to be funded by Congress. Congress's incentive now, they have two incentives.
Mhm.
One, provide the best possible care, and two, at the lowest possible price. There's no healthcare executive sliding some money in their pocket with a bunch of talking points to scare people away from it. There's no lobbyists coming and hitting them up. They're negotiating directly with the pharmaceutical companies. And that gives us way more power. That gives you and I a fighting chance of saying, like, hey, this shit is stupid. It's $50. We actually have a representative who is no longer incentivized to listen to the lobbyists. They're incentivized to listen to their people. It incentivizes them to have correct behavior.
How do you know they're not getting their pockets lined, though? I mean, if
Who would
it's
line their
the
pockets?
the pharmacy companies alone, I would imagine, would be ensuring that that bargaining works to their advantage.
Well, they would. The pharmaceutical companies would. I also am a fan of ending Citizens United. I don't think that lobbying should be legal at all. I would, if I was in charge, literally the two things I would run on if I was running for office is universal health care and ending Citizens United. There's no reason that we should rule that because you're a billionaire and you have freedom of speech, you can spend as much money as you want paying off politicians. So I would
Mm.
also end Citizens United, but in this case, to answer your question, without Citizens United, right now you have the pharmaceutical companies lining the pockets of
The lobbyists.
the lobbyists, and the lobbyists are lining it to Congress, and then you also have big pharma. So at the very least, we're eliminating one of those groups. We're
Mhm.
eliminating the healthcare group. There's no reason for them to lobby anymore. So now we're just negotiating 1v1 against the pharmaceutical companies, and I think that. I think that in and of itself would give us more power. But then if we ended Citizens United on top of that, then we don't have to worry about that anymore.
I mean, is there a safety gauge built into that to ensure that that's getting audited? Like, are we truly getting the best? Couldn't they just kind of drive the market and say, well, it's unreasonable to bargain at this reasonable market cost because the market skyrocketed and now this is the price range because
Give me a more
uh
specific
I
example. I'm
mean
not sure what
think
you're
think
saying.
about it this way, like the if you're uh house marketing, right? I could sell my house now and make X amount, or I could wait 5 years and see what the market does, right? And I can drive that pricing based on the market. Could the pharmacy companies essentially put in drivers to kick the market level up? So when you're going into collective bargaining, they're like, well, this is the reasonable marketing price, because that's what the government does with bids, right? They go to the
Yeah,
reasonable market price, so on and so forth. But if they drive the whole market up, and we know the pharmaceutical companies run a lot of shit, wouldn't that essentially kind of we lose our bargaining power if they drive the market up? And
yeah.
and
So
then go ahead.
yeah, there's two options for that. There's the option that I prefer, which I think your audience won't prefer, and I think that is caps on revenue, like saying that you can only make 40% on top of your cost to create the pharmaceutical product. So you can do it that way,
Mhm.
or with your audience that's going to be more libertarian, if they truly are like free market libertarians, they're going to say this is a truly free market. This is a one-to-one. These people have something that they need to sell to these people. These people are all negotiating together as one. Whatever the price is, the price will be. That would be the free market principle. That because
Mhm.
you legitimately just have two forces working against or negotiating against each other, they want lower prices, they want higher prices, that the free market will take care of itself. I don't know if I trust in the free market. I'm open to the idea without caps on the revenue they can make, but I would
Mhm.
probably be more in favor of saying you can make 40% or 30% on top of what your costs are. And because we have all that leverage and there's 330 million people here, where else are the pharmaceutical companies going to go? It's not like they can just go to a different country. They have to sell to us or they die.
Uh, I mean, I guess the motivation would be supply and demand, right? The more we all, if there's 100 people that are buying something versus 1,000 people that are buying something, like your revenue is going to be significantly higher if 1,000 people buy it versus only 100. So wouldn't that essentially drive the prices down anyways? Because you were kind of pinpointing that earlier. So I
Yeah,
would think that
there's more demand.
yes.
Yeah, it's still going to work on supply and demand principles for sure.
Mhm.
So if you had a drug that was difficult to manufacture, and it has a heavy demand, you're probably going to have a higher price for that. But yeah, I think that would at least, at the very least, let it operate in like true free market, in a free market realm. Because right now there's no free market when it comes to healthcare. Like, how much are you going to? You said your daughter has some sort of condition. What's the price tag before you say just let my daughter die? There's no number, right?
Mhm.
So there really truly is no free market. The health insurance companies are going to get literally as much as they can out of you, and the pharmaceutical companies want to get as much as they can out of you as well. So the insurance and the pharmaceutical companies are working against you to charge you as much as they possibly can, right? And
Mhm.
then it's just you. Like, nobody's looking out for your needs. Your insurance company is looking out for them, and the pharmaceutical company is looking out for them. The only way for
Mhm.
you to get any representation here is to have your elected representatives be your representation.
Now, would this work on a state to state basis and then, come up to a federal level? How would that kind of pinhead there?
It's all federal. It's Medicare, so it's a federal program. Everybody in the United States is under the same program.
What would be the risk factor with the federal kind of taking an overhaul of that? Wouldn't you want the state to have kind of maybe the federal like kind of runs it, but then the state manages the administrative portion of it?
Well, yeah, so that already happens. The state already manages like part of the administrative part as far as the state would probably be involved in paying some bills, and the states are also the way that this is written, states are still going to have the rights to determine like what is covered and what is not,
Mhm.
at least in some levels. So there's still going to be probably different abortion laws in different states, and they'll be allowed
Mhm.
to outlaw it that way. But the funding itself, the best way to do that is to have it centralized, and so it's going to be a federal income tax.
Now, so then what would happen to the people like that MMA fighter, right? Who needs two brand new lungs and it's millions and millions of dollars to do so. I mean, do those people just kind of get written off? How does that work? How do we
Oh, he
know
would get
that's going to
care.
be?
I mean, this is the stuff you're looking at. So now when you want to compare our like the only way to tell is like who else is doing it differently. So if you compare the United States healthcare program to like Denmark, for example, are the wait times to see a specialist are higher here. The
Mhm.
wait times for a transplant are higher here. There could still be wait times. There's still going to be times when we don't have enough specialists. There's still going to be market adjustments that we're always going to have to make. But
Mhm.
this wouldn't change that at all. Like at the end of the day, like whatever that cost him, let's say it cost $5 million. That $5 million came from somewhere,
Mhm.
and this $5 million is also coming from somewhere. But in this case, everybody collectively is paying into it, and that spreads the risk out.
Mhm.
That's why insurance companies want as many customers as they can to spread out that risk, so that when they have one person have a double lung transplant, it doesn't break them.
Well, it sounds like they weren't going to cover it.
Yeah, there was something about I can't remember what it was. They haven't been real specific about it. I think it was something about like a pre-existing condition from before he had signed up with that particular
That
insurance.
sounds like bullshit.
Yeah, because they're allowed to
They'll
do that.
find anything. They
Yeah.
will 110% find anything. Okay, this is where I can 110% be agreeable with you because it's stuff like that where it's like, oh, well, this is experimental and it's like in the final stages of experimental. Or this is pre-existing condition because you fell and scraped your knee once when you were 5 and that inevitably caused this
Yeah.
like 30-year decay in your knee, so we're not going to give you a new knee, right? Like
Yeah.
I feel like they poke and prod and there's a lot of portions where I think you have to advocate. I remember having to get on the phone with the insurance company for my daughter, and I had to push hard to make them do something that the doctor needed them to do. And they're like, this is vital. This has to happen.
Yeah.
And I actually had to call and advocate for that. And it took me a full week of phone call after phone call after phone call, this person, that person, this person, that person. And it was the biggest irritating, most self-destructive thing I'd ever seen in my life. And I'm like, this is so simple and it's fairly routine for people like my daughter. Like it shouldn't have even been that crazy of a thought.
Right.
And yeah, and I feel
But
like even
they're incentivized to have margins, right? And they need to deny a certain amount of stuff. So their incentive when looking at her record is to try and deny whatever they can. Anywhere they can find a denial, they do it. And it's because they're incentivized from a top down, and the people that are giving them incentives are saying, look, we've got stockholders and we got to keep them happy, because if our stock drops, if we don't show revenues like we did last quarter, they're going to be pissed at us. They might drop our stock. So they're always beholden to people who aren't getting the actual care. I win.
That part actually breaks my heart. Yeah, no, I
terrible.
could be on those pieces. I think I could be 110% agreeable. I think the fear factor, I think we see a lot happening in Canada. We actually did a debate about this, and it was not necessarily about this, but it was about assisted unaliving. Was it euthanasia?
Yeah.
And in Canada has like basically a streamline if you want to do that. It's you make one phone call, they run you through this process, and it's like streamlined. And it was almost kind of sad, but when the video that we watched prior to this debate was based on people who were like had disabilities, they were on disability, they were on like the social healthcare plan and social kind of like a welfare system, so on and so
I'm
forth.
looking at it's called MAID, MAID, which is medical assistance in dying. Okay.
Yes.
I'd never
And
heard of this before.
It's a phone call. It's a phone call, and they will streamline you to your grave.
5% of their deaths in 2023. That's crazy.
Yeah. But a lot of it, the video we watched for it specifically, one of the things that they were saying was like, I can't get the medicine I need. I can't get the appointments I need. Like I can barely afford to live because of all this other stuff. But the biggest factor that was built into their decisions was the healthcare plan, because they're like at the back of the line because they have a disability and all these it was crazy. But I've never heard anyone talk positively about Canada, and I think that that's where our American fear factor is built in, to see our brethren up north have a failing system, and then we're like, we don't want that, you know.
Yeah, look, Canada's system isn't good. I think one of the things that we sometimes confuse is that like all universal healthcare would be good. All universal healthcare, I think, is preferable because it gives everybody healthcare. But if you don't have a mindful system, and if you don't set it up in a way where it's paid for, then you run into the problems like Canada has. And I think the UK, I think where most of these countries fuck up is, instead of just being the health insurance provider, the people that are writing the checks, they start getting involved in the medical decisions. They start getting involved in owning the doctors and paying the doctors. And then when you have shortfalls with your budget, you cut the pay of the doctors, and then they get jerked around. You know, that's a high stress position. You don't want to be questioning every year if you're a doctor, like, it's a stressful year. I hope the government doesn't cut my check this year. And I think that's one of the issues that Canada definitely runs into. I am looking at this. It looks like 96% of the people that used MAID in Canada were over 77 and had death that was reasonably foreseeable. So I'm sure there's stories like you were talking about, but it seems like most of them were terminally ill. But even then, Canada has problems, and they also have problems because they're so spread out. And so doctors that you want to be a doctor, if you can't be in rural Canada, you got 8 neighbors within 60 miles. And so Canada has all sorts of problems. And I wouldn't recommend copying what they do. But I've watched this debated a million times. I've never heard a better plan than Medicaid for all. I'm open to it, but I've never heard anything better than Medicare for all. I think it's the best plan. And I think the only reason we don't do it is because people are afraid of socialism.
Yeah, I mean, and you're right. Like we still do have a lot of socialism already kind of built around us. Like we, talked about the education, and I think there's a lot of other things out there that are, um, I mean, I think of even getting a driver's license sometimes in that aspect. It just drives me nuts. But we have so many systems and systems and systems and systems in place of things that we pay into that we may not get everything out of, right?
Yeah.
Like the roads, the fire trucks. Um, but I mean, you could even if that's the case, then make it to where everything is built off of, your income and you pay per certain percent here, certain percent there, or like how much am I going to use it? Or I don't know. You could go all over the
Well, we
place.
kind of
But
already do that, like with property taxes for schools.
Mhm.
Not everybody pays into that. The other thing that I think that we don't talk enough about, and is the most compelling, is no more GoFundMe medical fundraisers on your social media. Those are just gone. Wouldn't that be nice to not feel guilty just to be scrolling through and seeing something funny, and then not the next one be like, "Fuck, now I gotta feel bad." Wouldn't that be nice?
We got the Sarah McLachlan in the
Yeah, that's right.
background.
That's right.
I mean, yeah, I think that would and that would probably make me feel better about okay, well, what about scams? Like, I would in my mind, I would think of pharmaceuticals, specifically people going to their doctor, oh, my back aches, and then they get the pain pills and things like that, and then they go
Hmm.
and they sell them, outside of that.
Yeah,
Um, would the doctors feel more inclined to just write the script and say, "Have a good day," without worrying about that concept? Because what do they care? Like, that person's get it they pay
sure.
into their healthcare just the same. The doctor's like, "Oh, your back hurts. Here's some meds." I mean, we already know we have that problem to begin with.
Yeah.
Would this amplify that to be worse?
Well, here's I think it makes it much better, and here's why is there will always be problems with the fact that there are medications that are addictive. Like I have ADHD, so I take a stimulant, right? And if anybody's ever taken it for like the first time you're like, God damn. But what happens a lot in this country is that people wind up getting injured at work and they get hooked on some sort of substance, a painkiller, and
Mhm,
then that becomes their entire life. And eventually they get cut off by the doctor, and then they start buying it, and then they're so addicted that they lose their job. And what happens
mhm,
when they lose their job? They lose their health insurance. That's where we get these black markets for things like fentanyl, for things like heroin, for things like methamphetamines. But with Medicare for All, this also helps cover mental health.
mhm,
And it helps with addiction recovery. And so no longer are we going to have these instances where somebody gets addicted to a drug, that drug causes them to lose their job, that them losing their job means they lose their health insurance. They lose their health insurance, they lose their house. They lose their house, they're on the streets. They're on the streets without a job and no home, and they turn to crime, sometimes violent crime, and they turn to more dangerous drugs, which increases the need and the want for illicit drugs on the black market. And then that's when you see people start bringing drugs over the border, sneaking them in cars, however they're bringing them over. It doesn't solve any problem completely, but it alleviates a lot of our problems along the way. And I think those are the parts that maybe don't get touched on as much. That it frees up small business, it frees up entrepreneurs, it even frees up. I know, like with the way that your ideology works, like I know that like the preference would be that there's a man working a woman in the home. That may free up enough money that some people are paying in healthcare to allow a mom to stay home and they don't have to worry. Or it's maybe the mom has a better job or better insurance, and so she says, like, my best friend's mom was a bus driver her whole life because of the insurance. His dad was self-employed, she was a bus driver just for the insurance. But if they didn't need the money at all, she could have stayed at home. Then that
mhm.
job could have went to somebody else who needed it. But there's all these other like secondary reasons why universal health care is helpful. It's not perfect. No system ever will be. But when you compare it to what we have, I can't think of a metric where private healthcare is better than what Medicare for All would be.
I don't know where to go from that. I mean, it doesn't sound like the worst plan in the world.
It's not.
I know there's probably dynamics of it I just wouldn't understand at the most. Um, my biggest issue, and I'll get into that here in just a second. I'm going to go ahead and drop the link to the backstage for open panel dumpster fire. Open panel dumpster fire. And you guys are welcome to start hopping on. All of you shit talkers in the chat, feel free to hop in and speak your piece. But my thought process would be the foul play, people taking advantage of a system or utilizing it in the wrong direction, or um, the government not keeping up with it,
Mhm.
right? We've and I could tell you my own personal experience, my father's personal experience with the VA and the whole medical system with TRICARE and everything fucking sucks, and that is
Mhm.
government run. It's
Yeah.
terrible. Just trying to figure out which place you're supposed to go to, getting an appointment, who am I supposed to call? Oh, you need this paperwork, or who has that paperwork? Well, that person has that paperwork. You call that person says, no, 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 this person has that paper. It's the biggest mousetrap shit show you've ever seen, and that is government run. And that's my big fear factor. Now
But
you're
don't you
taking
know just as many people who have had those exact same problems with private healthcare insurance though? Like
uh
my dad had terminal cancer. It will eventually take his life. It took 6 weeks for him to start chemotherapy. 5 weeks for him to start chemotherapy as a
mhm,
stage 4 cancer victim, because not because they couldn't get him into a specialist, but because they were arguing with the insurance company for 5 weeks.
now
That's 5
that's
weeks
sad.
that, yeah, and that happens all the time. So like
Mhm,
these same stories do happen, or people that go in and they think something's covered and they come back and they have a $13,000 bill and there's nothing that they can do about it. So
mhm,
I do agree, but I think the problem with Medicare and the VA is that they are underfunded because there's not as much being paid into it. And it's also like when you think about who uses the VA and who uses Medicare,
mhm,
these are mostly people who are seeing a doctor a lot. What
mhm.
you don't have is a subsidized group of people who aren't seeing the doctor that are
Right,
limiting the amount that each person has to pay, right? And so
right.
you're dealing with a very sick clientele, and so it is. But even then, if you just look at the statistics, overall satisfaction and outcomes are better with the VA and Medicare than private insurance. So even then,
Okay.
when they're limited, they're better.
That's fair. I'm curious why the backstage is I've got two back there, and I know way more of you were talking shit in the chat.
They don't like it when I'm not defining harm. This is a
Y'all,
tough one to
yeah,
argue.
define harm,
Yeah.
RTP. That was hilarious. And did you like how I threw that one back
I
at you?
did. I
Define,
did.
define. And you're like, ah,
That was
what
the end
can
of
I
that.
do
Yeah.
with that? Yeah, yeah. Well, and I think that semantics, and I'm going to sit here and I'm going to hold the panel until more of y'all little shit talkers jump back there. I see you all in there. Trust me, I see
Fuck
you.
you guys. Where are
Fuck
you?
you all. Fuck all of you. And I know we're full of a lot of Canadians, so unacceptable that you're not up here representing or saying, "Oh, you pop in, but it's late." Get the fuck over it. Be a man.
I've beef with Canadians actually already. I'd be happy to
Yeah.
talk about it. Yeah. Why don't you guys take control of your fucking geese? Because every winter they fly to my state and shit all over everything. You guys can't even control your geese. I don't want to hear
I
it from the
I have a
Canadians
problem
anymore.
with their I mean it's terrible, right? They have these forest fires that are horrific, and we actually get the the cloud of dustiness and
What
smoke.
state are you in?
I'm in Maryland. I'm that
Oh,
far
okay.
down, and we still get
Crab
hit
cakes
when
and football.
they that's right. That's right. But we still get hit with like, I mean, you'll walk outside and it's just you're just like you're sitting in front of a barbecue or something, and just inhaling all of the smoke off of it. It's terrible.
Usually, I'm a
Um,
fan of inhaling smoke, but it's usually the skunk,
not
like
that kind.
the skunkier version. Yeah.
Yeah, but the whole everything's just hazy. You could it's like it hurts your eyeballs to look, and I remember when they had that huge forest fire, and I feel bad, like I'm complaining, right? Like, "Oh, you guys fucking had
Yeah,
a big
yeah.
fire."
Their country's on fire. You're like, you fuckers, keep your
Like,
smoke out of here.
yeah. But I remember walking outside thinking like, "Oh my god, is something on fire nearby? Like something's going wrong." And I had to like look this up and figure out what was going on. And now we're just kind of like, now that I know that that's what that is, it's coming from north or northwest every time.
Are they not raking the floors up there? So they got to talk to Trump. Trump will tell them they got to rake those floors, the
Right?
forest floors. It's very important.
Get on them. Get on
That's right.
them. All right. Well, I'll go ahead and kick off the open panel. There's two people back there, and like, I don't know. I want to know why not everybody's bringing the heat with you right now. We might
because
have
this one's untouchable. I'm when you let me choose, of all the debates that I ever have, this is always the one that no matter who I debate it with, it's calm and there's not a lot to say. Like it's
hard
just a good
to
idea.
argue. It's hard to argue, and even I had a hard time trying to like piece around like what would be bad. But my biggest thing would be the state handling all of this administratively. I could see maybe pop up private contractors working for the government, maybe handling stuff, maybe sanctioning that out. That way, all of those insurance employees that are about to lose their jobs now have somewhere where they can go.
Well, we could just tell the government that if they fuck this up, we'll release the Epstein list, since that's not coming out anyways. We'll hold that over their heads, and they'll do a good job with it.
Well done. All right, we'll take the two jumping on, and maybe we'll switch gears. Maybe we'll go down the road of that trad wife topic that you were bitching about earlier. We can play that game. Let's do it. All right. And let me get through. This is even more weird. So low on the super chats. Nobody's upset. Nobody's mad. Nobody's
Fuck
like,
you guys. Fuck you, all of you. Eat shit.
We just turned this into a sip and stream. Fuck it. Like, if we're going to come in and not have a lot of crazy, then I'm about to drink. Plumpy enjoying their new membership. Welcome back, my friend. Nuke says with the big 8, Australian. I think that's Australian, right? With the A? Or is it? I don't know, but says, hi, everyone. Remember to hit that like. And yes, I mean, at the very least, there's 140 of you watching and only 70 likes. If you're going to be cheap fuckers, at least hit the free button, please. Thank you. I appreciate it. And Michael Kimball enjoying his new membership. Welcome, Michael. Kokomo says with a big 10, yeah, it is Australia. Australia's Medicare system has a levy of 2% for incomes above 30K single. And once your income goes above 90K, there's a surcharge if you don't have private health insurance. So you would still have the option for private insurance, correct?
Yeah.
And now would that be supplementary?
Yep.
So you could always default back to whatever the original pays. And now what would that extra private insurance benefit then?
Maybe. I mean, I think that then the private insurance would be for more like elective type stuff. I think that Republicans would probably argue a lot of like gender affirming care type stuff would maybe not be. You would have an argument of what's going to be covered, but I think that the stuff that people don't want covered probably wouldn't be covered under. I mean, we'd have to decide what's going to be covered and what's not. But for anything that's not, if I wanted to get some like a new fresh rack, that probably wouldn't be covered. Probably
well, that wouldn't be covered anyways, right?
Yeah, like, but you could get like an insurance that could, or whatever you wanted to do, or like insurance companies could do that if they wanted.
Could essentially doctors' offices, whether specialists or physicians, regular normal care, pediatricians, could they essentially close their doors to public insurance and only do private?
I don't think they'd make any money. I would probably not be opposed to that, but it would make no sense for them to do it. I don't think there wouldn't be that many people scrambling to get on private insurance. It would be kind of a luxury item.
Right, but I mean, because essentially having the lower price range, right? Because we would be collective bargaining, right? And so they can choose to have that lower price range, or they could say, you know what, we're elite over here. We'll only take on the big payers and the bigger spenders, and we'll charge whatever prices we want. Therefore, we'll only accept private insurance. But
Sure.
could,
I just don't think
what
that
if,
that would be.
well,
I
what
don't
if
think
they all did that?
I don't think there's not enough people to pay for it. Like there's not enough people with money to pay for their own insurance. That's the problem. It's already unaffordable. Like think about it. If you had health insurance with no deductible and no copay, and you could go to any doctor in any network, and these doctors, they're going to make more money by having more customers and a more consistent customer base. Like, what would be the incentive to go do private insurance?
Well, let me backtrack that. Are the doctors lacking for clientele?
Some are, especially in rural areas. Yeah, especially if you're in a rural area and you have like self-employed people, farmers. A lot of these people just don't carry health insurance, so they're only really showing up for something catastrophic. And so those like rural hospitals, they rely entirely on Medicare and for people and Medicaid with lower income or people on disability. And so this actually would increase revenues to them. You're starting to see farmers go and they get preventative care. This also weirdly like helps catch a lot of things, like historically pesticides or like the black lung, like stuff that we have found that has created chronic disease
care.
that then and then it leads to class action. We would catch these things quicker because of preventative care.
Okay. I mean, I feel like I live in a fairly, I'm like suburbia / rural, just depends on like 10 minutes in any direction. And I mean, some doctors' offices don't even take on new clientele. I think the only reason me and my kids got taken in on one was because my husband at the time was already kind of locked in. So it was like, you take one, you take them all. But they weren't even accepting new clients after that. It was just kind of, we got lucky.
Yeah, if you're busy, you're busy. You don't have
yeah.
to take everybody. There's still, I mean, doctors are still going to be able to set their own schedule. And some doctors might make less because they feel like they just don't want to see more clients. But it's steady and they know they're going to get paid. So some the average pay for doctors based on the CBO analysis say that most doctors will make a little bit more money.
I mean, what about like, you're talking like inner cities where they're, even the kind of what I would say freebie or in less, stop typing, whoever's typing. Who's typing?
Oh, my mic is way too sensitive. Sorry.
So even like the freebie hospitals and stuff like that, where they do aid to people with lower incomes and so on and so forth, they're already slam packed. So what would that look like for the inner cities where they are high population, like already slammed? Like what would that look like for them then? Are you going to see more pop-up centers popping up? Like how would that turn?
I think that's kind of impossible to answer. Like if there's a place where there is an increased demand and they can't fit that demand, then there will be a need for more supply, and then you'll have more doctors. I do think that
you can't increase the supply.
I do think,
you have to raise the price.
What?
Like in certain like inner cities, like sometimes there's no places to expand, so you have to go way beyond. And that'd be impractical for most people to go out.
Could you give me an example of like an inner city where you couldn't add more doctors?
I'll be right back.
I'm just saying. I just know, like in just speaking, like in the theoretical, like for a lot of inner city land is very expensive. So to go and open up more hospitals or more centers, they need to like establish themselves. So training doctors will not be the problem. It will be finding places that would be practical for the inner city to go and have access to the hospitals instead of having to go to the outside into like the rural areas.
Yeah, I mean, look,
that's the only place they can build.
Commercial real estate is dying right now in almost every major city. There's an abundance of commercial real estate. I just don't think that I think I understand what you're saying. Like hypothetically, this could exist. I don't think it's a reality where we exist in now. Like brick and mortar is becoming less and less popular, and doctors are some of those people that need brick and mortar. But this also opens up telehealth. Like I don't need to go see a doctor. When I had my doctor's appointment a few days ago, I have a little machine because I take Adderall, so I have to in Arizona I have to show my blood pressure. I have a little machine. I do my blood pressure right on the call. Every year I have to go and get blood work done. I never see my doctor. So for like preventative care and regular checkups, this opens up telehealth. But there would be a demand for more doctors, which is why we have to roll it out in stages, because it's not like it's quick to go to medical school.
Right.
Okay.
Like the idea
That would
sounds
actually
good.
be another question of mine. Would we have more grants to produce more doctors? Because I think the demand would obviously go. You might have just answered that while I stepped away, but the demand would go up. Therefore, we would need more doctors. But going to medical school is very expensive, and not all people find it to be incentivizing, knowing that they're paying hundreds of thousands of dollars for their education.
Yeah.
And then they have to pay that back. So would you? I mean, I know teachers have like a special, did you like pricing and stuff tax wise? Are you a teacher, so on and so forth? Are you still paying on student loans to be an educator? Would you have like a built-in system to incentivize more doctors?
So we have that already, especially in rural areas. Like I have a friend who went to PA school and he lives in Hobbs, New Mexico. And the reason he lives in Hobbs, New Mexico is because coming out of PA school, they said, we'll pay off your student loans if you come live here for 12 years. So we do that. There's a lot of rural places that do that. But I don't exactly know what's going to happen. What I do know is that having universal Medicare for all will force the hand. So it's going to force the hand to do something about college tuition, and it's going to force us to do one of two things. And I think this is one of those places where you can find like bipartisan agreement, because our options are we either subsidize this and we pay into medical schools, or we reform the way that our specifically like state colleges operate and we make them less for profit. It would force our hand, and I don't know what the outcome would be there. I don't know. I don't have the pulse on the American people, but we'd have to do one of two things. We'd either have to subsidize it, or we would have to do something about our state-run schools, and maybe they don't have to make as much in profit.
That's fair. Kay, you're getting 5 minutes in the back for so rudely not knowing how to mute your mic, particularly while typing. I feel like this is a standard procedure for anyone jumping on a panel.
Yep.
I'll set a timer for you. And then Jay Metal asks, with the big five, I definitely hear what you're saying when it comes to healthcare, but what do you think is more real, Bigfoot or aliens?
I had a friend with a size 17 foot. We called him the Nate Foot Giant. But I do believe in aliens. So I would say Bigfoot's a tough one for me.
Personally, I would say Bigfoot, because I don't think alien life is theoretically possible. Like, I think that we're ahead in terms of like the Earth is just so perfect for life, and I don't think it's available anywhere else.
Did we confirm it?
I would go with
I was gonna say, didn't we just do this, but like nobody cared because there was so much other things going on that we're like, okay, aliens, we all knew that already. Let's get back to this shit.
Yeah, I think we confirmed it, didn't we?
Yeah.
Yeah.
Wait, we did?
Yeah.
Yeah.
Like
the government came out with something.
I don't know that they've confirmed like alien life, but they confirmed UAPs, and then it gets back to like, what is the creator? maybe God has UAPs. I don't know. Maybe he was sending them. Who knows?
Yeah, I'm not sure. It's but I don't know. Bigfoot. I mean, we could probably have a more fun panel if we start talking about aliens at this point.
Yeah.
Okay, so
I've been waiting for you in terms so I can kind of jump in a little bit more.
Oh, go ahead, Dragon. My apologies.
Oh, no worries. You were kind of rattling off some of the stuff, and then the typing happened, and just kind of everything went that way. So I have a quick kind of question regarding what would be the limitations on coverage if we went to Medicare for all? What type of coverage determinations would we go? LCD, local coverage determinations, national coverage determinations, what medical policies?
It would be you have to have some there's going to be nationalized standards and then there's local standards just because of state rights and what we've already decided to do with the state's ability to determine what is medically necessary and not. So it's going to be a combination of both. But if you implemented it now, you basically would take the state laws that are in place now, and if you had restrictions on what you could pay for through Medicaid, those restrictions would still exist.
Okay.
RTP, when it comes to like who can be covered, do you think that it's a smart idea to cover those who are born with deformities, who are infertile, and will go and like die in like the early 30s, if not sooner? Because I personally think that, like with a lot of those cases, it's just a drain on the system for no real benefit. And those who typically take care of them tend to pay more money taking care of like their offspring than like the average person would.
Yeah, look,
So they
I'm
have
pro.
the money for it.
Yeah. I think if you're alive, I don't think I'm not. I don't think we should just tell people that if they are born infertile or with deformities or mental conditions that they can die. It would still be funded. But that's already factored into the numbers.
When we go back to that point of like it's theoretically easy to increase supply of medical assistance, medical services, the RTP talks brought up. You said it's theoretically hard to increase supply of like medical services, right? But it's like you made it seem like it's pretty simple to do, right? This is simple supply and demand. Do you understand how fucking retarded that is? Like if that was true, medical
I don't think I said any of that.
No, you did. We were
Did I say that? Did I say that it was theoretically possible to include like it increase?
No, Evan said that it's theoretically hard to increase supply, and you said
for
no.
Buildings.
He's talking about buildings.
Okay, but in general, we're talking about medical services. It's not just buildings that is the cost of medical services, right? It's a lot more complicated than that.
Yeah,
And
it's very complicated. Do you have a specific question?
But it was a general point of supply and demand.
No, it was about building. It was about specifically commercial real estate.
Yeah, he was on the real estate part of it, not the actual physician part or the medical services. But RTP brought up the thing about the virtual healthcare, telehealth, as an alternative in that situation. Well,
I guess then my question would be like bigger picture. Do you think it's but no, you guys are fucking lying, because you're talking about training doctors. That's not offices. I'm talking more broadly about the supply and demand issue that you guys are talking about.
Okay, what would be your claim then?
My claim is that it's fucking retarded to say that it's just easy to increase supply of like medical services. If it was, that was your point in general. Don't try.
It's not my point in general. It's not.
Yeah,
my
just
point...
acting like it's easy to fucking train doctors.
All right.
Like that.
Do you want an answer to this, or do you just want to keep telling me the same shit over and over?
Like, no. But
I don't know what you're so fucking emotional about right now, but you want to let me get a fucking answer out at some point?
Because you're so fucking retarded.
This is the thing. Yeah, just keep saying the same dumb fucking. You've said that 5 times already.
All right, Mr. Hold on.
Yeah, you're too dumb for this conversation.
Hold on, Mr. Woof. Okay, so you're saying that it would be difficult theoretically to build up.
What do you think, Sarah, the Raging Tomato? Do you think it's really easy to increase supply of medical services?
Well,
what are medical services? What are you talking about?
Stop for a second. Stop. Why are you so aggressive?
Because people like RTP,
because he's a bitch,
deported out of this country. You should not be able to vote. You are so stupid. You are that stupid.
Okay,
I don't think you should
I don't think anybody up here thinks that. Like everybody up here, I think if we took a poll on who's the dumbass, I think almost everybody would vote for you.
Yeah, because you all are fucking retards.
I think nobody up here thinks that you're intelligent right now. You rolled up your sleeves. Great job going to the gym. You're a fucking dipshit. You can't even.
But cool okay. Who has
cool ass dipshit? Ask a fucking question that somebody can answer. You're too fucking stupid to frame a question.
Okay, get to the point. I've been talking only about.
You haven't given me a question.
I've only talked about points. You were talking about muscles and shit.
No, hold on. Stop for a second, Mr. Wolf. Pardon me for just a moment, please. Thank you. All right. So far, all you've done is come up and say that's retarded. That's stupid. Why would you think that? You're retarded. That's stupid. That's what I would like to hear is the actual claim. Thank you.
Okay, but I just want to clarify that the claim was that it's pretty feasible to increase medical services to match demand, to increase demand from whatever this conversation is about.
I don't think you know what this conversation is. I think you should drop back down.
I just joined like 5 minutes ago.
Yeah, that it shows. I discussed this for an hour.
How about you don't interrupt me?
I want. Are you going to get to the point at some point?
You interrupt.
This message is sponsored in part by...
Thank you, K2, for the brief interruption. And I'm going to continue to interrupt for just a moment and read off the super chat so that Mr. Wolf can figure out what the fuck he wants to say. Josh says with the big 5, this is what RTP gets for saying this topic doesn't get
That's fair.
contentious.
That's fair.
What you get.
That's fair.
And then Coco says with the 10, here we go, Jerry. Yeah, sometimes I feel like this is a Jerry Springer episode, and I should do like an ode to Jerry one day, and just put highlights of all of these dumb moments like this in it, and it's just an ode to Jerry. Okay.
Okay,
Mr.
well, I have a
Wolf,
limited amount of
make the
time. I'm
claim.
not like these nerds that have figurine collections up here. So
Why don't you put on 5 more fucking bracelets? Why
I'd
don't you
like
do
to get my point across. I could criticize like all of you fucking nerds endlessly.
that? You for nerds and virgins.
So far,
your
so
fucking
far,
point.
I'm
But
just
I'd
waiting
actually
for
like
you
to
to
get to my
actually
fucking
get to it.
point. I'd
Get
like to
to
get
it.
to my point, actually.
We'd like that too.
Okay, so well, just to clarify, you think it's easily feasible to like increase supply to match demand for Medicare for all? I think.
Let me
that's
ask you a question. How long
this
did I
topic
say
is
this?
about.
How long did I say this plan would take to roll out?
I think I think I only listened for a couple minutes, but you think you said it would roll out in phases. I don't know exactly.
How many years?
How many years? Tell me.
Yeah,
Why don't you
this is the
fucking tell me?
problem. See, this is the problem. You didn't listen to anything. You just come up here with all the answers. Let me give you the answer. Let me give you the answer. Yeah, the answer is that this would increase the supply that we need for doctors, which is why it's a 10-year rollout, which is why phase 1 is we roll
10 years? Okay, so that's your answer. 10
Yeah.
years. It took you that long just to say 10 fucking years.
I said it 12 times in this conversation,
Well,
but
to be fair,
you came up like
fair,
the bat out of hell angry,
Mr.
and you didn't
Wolf
fucking
Wolf,
listen.
he had a whole kind of prescription earlier of like first we do the age, we drop it 10 years, and then we drop it another 10 years later, and then we drop it another, like he definitely had a whole wave system built out for it. So what would be your handy dandy plan, Mr. Wolf Wolf?
I mean, I'm not saying you have a plan, but I think it's retarded to think that supply.
I don't know.
You guys
I
are
just
children.
know that I'm mad.
First of all,
You're the reason
let's
women
get
are
this
afraid
straight.
to say
First of
no,
all,
you
you're talking about
fucking
taxing
psycho.
people- You're talking about taxing people like me to pay for medical services like this
Yeah,
fucking
you don't know, bro. Shut the fuck up. You don't know how much money I have. You don't know how
I
much
can
money
tell
I
by the
make.
background you don't make that much money.
What, you
I
can tell by
easily.
my door that I don't make money?
Darn
Shut
that.
the fuck
Fuck
up.
that
You're
door.
too stupid to make an argument. So now you're like, I make money. That's how I bought all
I
three
can tell
of these
by
bracelets.
one look at you. I can tell by one look at you.
Let's stop
Yeah, I
making
know, bro.
stupid
I know.
assumptions.
I know, bro.
Mr.
I know
Wolf
that.
Wolf,
I know that
I
you're
know this is your
so
first
sensitive.
time
Let me get
here.
It's not
but
your
I-
fault that you're dumb.
We're already
Pardon me
taxing,
for
we're already taxing the middle class to death. You
This
wanna
isn't a
increase
tax on the
taxes
middle class.
to the
This
middle
lowers their tax
to
obligation.
pay for it. That's actually idiotic.
Actually, I covered this already, dipshit.
I didn't listen
covered
to
it
it. Like I
already.
mentioned
It
10 times.
lowers the amount that they're paying out of pocket. You're too stupid for this
That's retarded.
conversation.
That's dumb.
Can we get somebody else up here who has
I don't
two
know
brain
who
cells
this
to rub
is.
together? You're the dumbest fucking person I've talked to on this stream, and
Oh,
that's
you're
saying
very
something.
intellectual.
Everybody
You're
up
super
here is
intellectual.
laughing at you right now because you're that fucking
I
dumb.
think you all are fake.
I
That's
think,
what I think.
Mr. Wolf Wolf, where do you come from? What corner of the YouTube streets do you come from? Where do you normally hang out?
That's not what I came up here to talk about. But,
Well, now I'm asking you questions.
Came up here to show off
You've
my bracelets.
made such a wave on the panel. Who do you normally hang out with in terms of panels?
Who's one of the most toxic people you've interacted with?
You.
You're pretty high on the list.
Yep.
And I've dealt with the
Eat a dick, dog.
Hormaxer, so
Take
that says
that.
a lot. At least the Hormaxer comes on and actually has something to say that's devoted to the conversation, and he can back it up with some things as well. Evan pops up the big-
I can't be here anymore. I gotta go do some more
and
push-ups.
he left.
What a bitch. What a bitch.
I want to know. I really want to know what corner he hangs in, because that would tell me why he thinks that he could get away with that. Because there are panels where you can just get on and start saying random stupid shit and not actually make any sense.
Oh,
and
he's
feel
got
like
fresh.
that's a
He's got
conversation.
fresh and fit written all over him. He has 3 subscriptions to fucking fresh and fit. He's got a poster of Myron in his bathroom that he beats off to every morning.
Oh, awkward.
Maybe he
That was
just calls Cormaxer. I mean, come on.
I'm telling you, Hormaxer is grody and
I've been on panels with him.
But he can actually formulate a structured argument, okay? And that says a lot coming from the Hormaxer. When he's not talking about sex shit, he can actually talk about political or religion and like actually formulate a structured conversation and back it up. As weird as he is, I still have my heart sits with the Hormaxer. He's one of my most toxic panelists I've ever interacted with.
Somebody in
guy,
the chat said I met him on Grindr. I don't know if that's true or not, but that's what somebody in the chat said.
Awkward. Evan Lord says K.O. Dave is subtly flexing with nearly $10,000 worth of Warhammer minis. Oh, what are those little things behind you?
They're they're Transformers.
Bring one up. Can you
bring one up?
Yeah, I want to see one. Up front and personal, please.
Good Lord.
I didn't even notice that.
Yep.
Oh.
What's old boy right behind your right shoulder? What? That thing's awesome.
The big one.
Yeah, I don't know much about Transformers. Sorry.
See, we're going all over the place with this conversation. Oh, did I? Yeah, I pinned the.
Yeah.
All right.
Welcome to Scorponok. He is large. He's
Scorponok.
He's like, this is how big he is compared to me.
Looks like
I have to hide under his gun.
I like this. Maybe that's why he called us nerds. It's all your fault, Kay. And I'm ending the poll now. Woof, of course, was 63%, the biggest asshole on panel. RTP came in with a very far second at 35%. Kay came in at 1%. And Evan, of course, 0% because
Evan's
you are a panel sweetheart.
That makes
and
sense.
you voted for me there.
I think that's the correct ranking. If we're being honest, I do think that was fair. I think I'm too.
I think Kay got the asshole vote for typing while being mic'd up. That is asshole. And we've got the yoga video sponsored by K2.
This message is sponsored in part by.
Dun, dun, dun.
Okay, now let's see if I can get my brain back after that one. No.
My mom is watching this. My poor mom.
My mom and my dad are watching this. So yeah, usually the thirst trap videos don't come out until a little later. But K2's making the requests, and at this point, they're spending money. Why not? Okay. Dragon Rage, you had it last. Did you have any more to add on that you wanted to go back into? If not, I'll hand it over to Cave.
Yeah, I was kind of trying to get down to the kind of a little bit of the logic of determining who would be making the coverage determinations, because as it is, like right now with Medicare, they make their national coverage, which of course I'm pretty sure you're aware of it, and the local coverage. But there's also situations like with the federal employee plans where those are set up by Congress specifically, not by Medicare in situations. And so
those are through private, aren't they? Those
that's a federal employee government.
Okay, which one are you talking about?
So I'm kind of alluding to the fact that there's Medicare, which makes its own rules, but then what happens now if we do to one payer? Would then Congress get involved in the situation to then make any more determinations of what's covered, what's not covered, what type of spending, what limitations, how experimental of coverage is, so on and so forth? Because like with the federal employee, essentially you have to go to Congress to say, hey, what's going to be covered?
Yes, you would still that would be determined, like coverage is going to be determined because it's got to be authorized by Congress. So yeah, and they'll have oversight on that.
Okay, so we wouldn't be able to do more experimental stuff where like private insurance companies are able to do more I have a really bad
are you like talking about paying for experimental treatments? No, I think you could still do that, but it would be that would be through Congress because they're funding it. I think that I do think that there's potentially like some experimental stuff, and that's where private insurance would have to kick in, just because of the risks associated with that.
Okay. Go ahead, Evan.
Something that I was kind of like thinking of, which kind of came up from this, is we're in such a huge demand for organs and stuff like that, and if we go and cover that, because some people need new organs to go and live, if we go and we have that be available nationally, then the demand would further increase. And I don't think that it'd be to such a point where you would have to go and have it ordered in such a way where otherwise there wouldn't be enough for nearly everyone.
So I'd have
Or
to look
for
at
even a
I'd have to
portion
look
of people.
I'd have to look at the availability there. It's true that you would put more people on healthcare, and I do think that this would be maybe more true early on. But a lot of these people who wind up with organ failure, this could be prevented with preventative care. Specifically, those 60 million Americans who don't ever get any preventative care and then wind up on an organ transplant list. So it's going to potentially that those numbers could be unsustainable. But I don't know that they are. I'd have to look at those numbers. Even if they are, it's already a problem, right? There's just 60 million people that don't have access to that. So it's already a problem. And we're selecting that like, oh, if you're poor, you don't have an opportunity to get an organ transplant. This is only for people with good insurance, right? So potentially that could happen. I'd have to look at the numbers. I don't know. I don't know what those lists look like. I've never looked at them.
The only issue that I could potentially see is that besides ruining the American market, it could ruin the global market, and that could cause all sorts of issues that could sort of happen. Also,
global market for what?
Organs for medical purposes.
Why would that ruin the global market?
Because the American demand would rapidly increase, and since Americans have more money on average, it could go and take away from other parts of the world like Asia or Europe, especially Europe when their GDPs have stagnated and started to decline a bit, especially with the fall of like their productive populations.
I'd have to look at the numbers. I do also think that now with those 60 million more people on insurance, more likely to probably be organ donors, more likely to die in a way where their organs are actually salvageable, more people with healthy organs. I don't know the answer to that question, to be honest. But even if that was the case, even if I granted you that this would cause a shortage for organs, I still think the benefits far outweigh the negative there.
It's just something that I see in this is I don't see how you can go and apply it to everyone, but not have a rigorous system on who deserves it more than other people. Because like I would imagine like those who are younger, those who don't have many conditions, those who are like would live longer and whose life would be in theory would be more beneficial to keep around for society.
That already exists, and that would continue to exist. Like there's already a hierarchy when it comes. It's not just like first come first serve. That already exists. If you're in late stages of your life or terminal cancer, the likelihood of you getting an organ transplant are not very good.
Yeah, the list is quite extensive in terms of what parameters they look at, and then there's a committee that actually forms to decide whether or not the patient that's there, if one comes available, if they're able to get it right away or not, and how close it is, because there's only so many hours that certain organs are able to be transported. So realistically, global market wise, it would be very, very scarce in terms of how many organs could go from one continent to the other continent in situations. So that part of it is kind of not hugely, but you kind of walked me into a nice little conversation point here with the preventative care. Doesn't the ACA already cover preventative services?
The ACA does say that, like, if you're on a plan that you have access to preventative care, but not everybody's on the ACA. Like, we still have 60 million people that aren't insured, and so the ACA guarantees it through private insurance. But there's still a lot of people who don't have insurance, and there's copays and there's deductibles. There's other
not on preventative. If it
on
is
preventative care, I thought it was
100% coverage.
It's 100%. Okay, cool.
Yep. So it's 100% coverage, and the only ones that are excluded from having to follow the ACA guidelines are the grandfather plans, which are really old plans in terms. I think haven't renewed. So you were talking insurance plans that are like 30 years old that never have made any modifications.
Yeah, the thing is with the ACA, like if preventative care is covered, which is I believe you when you say that that's already covered, that's at a higher cost anyways. Like we're already paying more for our healthcare, so without the 60 million people, so
so
it makes much of a difference.
I'll say this part right now is I in theory love to have Medicare for all, but at the same point, feasibly, I don't know if it would actually roll out properly and if it would work out properly. in terms. I could see a lot of manipulation that could happen. So I agree that it should be something that we can kind of do, get rid of a lot of extra barriers, because like I said in previous conversations with you, I work for insurance and situation.
Could I ask you a question about that, by the way?
Yes.
Because are there any of those concerns you have that don't exist in the private market?
My concerns in the private market is
no, the concerns that you have. Sorry, let me ask. Maybe I didn't answer it or ask it very well. The concerns that you have about doing Medicare for all, and you say like I have a bunch of concerns about how it would roll out, how it would operate. Are any of those concerns alleviated through the private market, or do those concerns still exist in our current market where we have private health insurance?
So I will say in the private market right now, there's a little bit more. What ends up happening, and this is an unfortunate side, is when there's more government regulations that come into play, more things get having to be twisted around, and we have to manipulate certain situations that are already being covered, and we have to be very stringent in situations, and then we can get into a lot of fights with those regulatories that are we are already covering something, but now they want it in this strict way of being done. One of the things I'll kind of say is the in-home healthcare type situations. That situation, when they changed up their billing practices that came through, that was an absolute nightmare.
When they changed their healthcare, are you talking about reimbursements like Medicare reimbursements, or what are you talking about?
Medicare set new rules that all private insurance companies had to follow. So they set a rule.
Can you explain what those are? I'm not sure exactly what you're saying.
The billing types and how it was supposed to be billed and what type of prerequisites were needing to be done, and so what the billing guidelines were, how much time they had.
Can you help me explain how the government is determining billing guidelines for a private insurance company if they're not billing if they're not billing Medicare or Medicaid or the VA?
Well, here's the thing: is if you're a private insurance company that does and sells for Medicare, you're required to follow their guidelines for other things.
Okay, so because they're in the market and because they sell the Medicaid that's like private insurance, because you're in that market, you have to live by their rules. Is that what you're saying?
Well, the companies that I worked with, it's
Gotcha.
Medicaid, Medicare, the Medicare, so Part C, so the Advantage, the Supplemental Medigap, so everything I've kind of.
So most of that would go away because now, all of those programs you're talking about, they would be rolled up into simply Medicare for all, and you would have one set of rules that would be standardized across the board. So you'd have less regulation.
Yes, but you asked me what would be the situation if comparatively to what I have right now, the concerns that I have in that situation. Realistically, more governmental creates more of an issue in terms than the state that I'm in covers a lot of stuff.
So maybe help me understand that then, because what I'm hearing you say is that like the government, because it's multifaceted and there's different ways that you have to bill for different programs, it causes a headache on your end. What I'm saying is your end wouldn't exist anymore. Like the private health insurance working within these different systems wouldn't exist anymore. Those systems wouldn't exist anymore. There would be one system, which would be Medicare for all. It seems like that would reduce.
I'm still looking at it from the point of if the private insurance was still in the game at that point.
Oh, I wouldn't want them in the game. With my plan, they wouldn't be in the game anymore. They'd be out.
Well, then that kind of does a contradiction of you saying that they could still be there in the terms of it.
They wouldn't, but they wouldn't be regulated by the federal government because this would be private insurance would be optional, and so they would be more free to pick and choose what they do and do not cover because the basic needs would be met by Medicare for all, and so you don't have these restrictions coming in on these private healthcare insurance like you must cover this because they're not taking government subsidies, so the government really doesn't have that leverage over them.
I would really venture to say that they would not be completely out of that private insurance company's life at all, that there would be those regulatories that they would still apply in terms because of the way that would work out.
No, because you guys wouldn't be able to bill any of those programs. All those programs you're talking about, private insurance wouldn't be able to bill those programs. That would cease to exist.
I'm still saying the stuff that they would deem would be close enough to it that they would end up, what they would say would be a potential coverage, and then the other insurance comes in and picks it up.
I know it's hypothetical, but could you give me an example of a time when like this would actually come up where they're not billing a government program, but the government still steps in and says, this is how you have to bill?
So Medicare doesn't cover preventative eye care.
Medicare for all would cover eye care though.
Right now it doesn't. And
I know, but under my program that wouldn't exist anymore, right? So we're talking about with my program was in place.
Mm-hmm.
So well, all that regulatory stuff would go away.
Mm-hmm. And that's what I asked the question of who would make that determination in terms of it.
Because so that would be written into the bill that eye care is covered.
Okay, so then that's where you'd have to have all those nuances of every single thing that would needing to be covered in terms of it. Yep. And so then that gets back to that local coverage determination versus national coverage determination. So would then the Congress would deem everybody has to cover this across the board and limiting how much that the locals would be able to regulate out or in?
They would be limited in the same way that they are now, that states have rights, and the Supreme Court has kind of been like the arbiter of what rights are states and what rights are federal. And so doing Medicare for all, like this, the rights that states have now would still be granted. You would have,
but
you'd have to
I'm not talking the things like
we're talking about stuff that they cover. Some states could choose not to cover certain things. So the federal mandates would only go as far as they don't infringe on states' rights.
Okay, what I was kind of alluding towards is in the terms of the situation of what levels of care for, like, we'll say MS, because I watched your one video talking about this for Medicare for all with your friend. So I did watch that whole thing.
Okay.
So what levels of care would be allowed under the Medicare for all for people with MS? Because
when you say levels of care, I'm not 100% sure what you're talking about.
So what type of medications, what type of services would we allow for stem cell services, and so on and so forth?
It's the same as it is now. Like right now, we're pretty limited on what we allow for stem cell. Like there's a lot of people that have to go to different countries for different stem cell procedures. The federal government, yes, would still, just like they are now, would be regulating that. But basically, if we rolled out Medicare, let's just say we could roll out Medicare for all right now. Everything that is in place now would stay in place, except for all of this billing stuff that you're talking about, where you have private insurers billing the government and different departments within the government to try and get their money.
Well, some of the private insurances cover more than what Medicare does cover in that terms.
I understand that, but the private insurers would not be able to bill Medicare anymore. There's no billing; they can't bill Medicare.
That's what my argument against it is that right now private insurers allow a lot more than what Medicare does, and Medicare restricts on some of the stuff. So, like me, I just recently went through a form of chemo dosing because I bring up MS because I have MS as well.
Okay.
So this is something that I'm kind of have the golden handcuffs to is insurance. I need to stay on my insurance in terms because of it, because of the fact that, again, I'm like Sarah, like $36 a month is what not a month, every 2 weeks I pay for my premium, but it's a very low out of pocket. But the medication that I was just on, Medicare would never allow, but my private insurance did.
Yeah, that happens. I mean, that happens all the time, and that may still have to exist. I don't know. Like, I don't want to get too much into privacy, but this would still exist. None of this changes, right? This thing that you're talking about now, it already exists, and private insurance could still exist, and private insurance could still fill in an instance where you're talking about. I don't know these coverages, or like in an ideal world, the government would negotiate, and because we have more healthy people paying in to the system, I think that we could expand care, and a lot of the stuff that we talk about does expand care, like the expansion into dental and the expansion into vision, the expansion into reproductive care. Like there are a lot of things that I would expand, and I think you could probably talk a lot of people into expanding stuff for MS, but in those places where Medicare doesn't happen to cover it, that's where private insurance would come in. But that other part of it where they're billing Medicare still would not exist. You would be paying them, they would be paying your bills. There would be no like all that other stuff you're talking about billing the government in different ways that wouldn't exist anymore because they wouldn't be able to bill the government.
Do you think there's some potential foul play that could come into that? I mean, we already kind of see stuff happening with other things, but for instance, the doctor's office could be making up people and just sending extra stuff that maybe never happened. How do you?
Yeah, this is how Rick Scott became a billionaire. Yeah, I know you guys might like Rick Scott, but that's what he did. He defrauded the state of Florida from Medicare funds. This does happen. There will always be fraudsters. They will never stop. They defraud private insurance. They defraud government-run insurance. That will still happen for sure. And we still have to be vigilant to make sure that people aren't abusing it. There's not a system that isn't abused, but switching from government run to private run, like if somebody scams a private insurance company, we pay that. Our premiums go up. If they lose millions of dollars, our premiums go up.
But they have a bigger capacity to be able to, because they push back on everything, right? Just as you said before, with the having to kind of advocate for yourself, and they reject a lot of stuff, and somebody had to sit on waiting for a procedure for 5 to 6 weeks because the insurance company kept rejecting it. We see that happening where they don't give the benefit of the doubt, they just say no. Whereas if we switch over to the Medicare for everyone portion of it, it's just, approved. So could we potentially lose that safety net of preventing scam and fraud, or do you think there would be some kind of net built into that?
You said safety net, but it sounds to me like what you were talking about is the criminality of the insurance companies and trying to cheat you out of coverage.
Yes. So of course they have a built-in rejection system where they just reject left and right. Whereas if Medicare says, yeah, we won't reject anything, who's to say that those doctors aren't going to take advantage of that, or the medical billing, so on and so forth, where they're like, well, if they're not going to reject it, we just start pumping shit out.
Some will, and that's why you have to have compliance. You have to have OIGs. You have to have a strong auditing process. Congress is going to have to do their job with oversight, and this is one of the things that kind of sucks about our current state of politics, where we believe that the government doesn't audit anything and that they're terrible at everything. But like we just saw Doge come in, we just saw the private market come in and audit all these programs, and they saved us about $30 billion. And the OIGs that they fired the year before saved us $90 billion. We just saw a real instance where the government was 3 times more effective than the private market. I don't think the private market is very good at this stuff. So yes, all this stuff will exist. But again, having the government be the ones responsible for it gives you a voice, a limited voice, but more of a voice than you have now. And if the government's really fucking things up, you can vote people out. You can't vote anybody out. Luigi Mangione tried. He did it a different way, but you can't vote people out of your healthcare. They're going to stay there. And the way they keep their job is if they make as much money as they possibly can for their investors. So I do think this is a way to give some of that power back to us.
What about, and K.O. Dave and K2, I'll give it back to you guys if you want to jump in a minute. But what about the employers who offer health insurance programs? I mean, some people see that as a benefit. Would you say that could turn in a way where we would see that flip over into a salary instead of having to pay out for, be included in your salary as a benefit? Or do you think that they'd end up just pocketing that difference and not paying out more in salary?
Well, the employer, there's still a tax on the employers of, I think, between 4% and 6%. But yeah, ultimately it does 2 things. If that is a massive cost to the employers, they may pocket it. They may pass those savings down. I would much rather see an incentive. I like a tax structure that tells an employer who makes a bunch of money, hey, you can keep all this money, but you get taxed at a higher rate, or you can pass that along your company. You can spread that out, and then you'll get a tax break. That could happen. But the thing that I like is that it gives you more control over your individual labor. You're not going to be tied to a job that you fucking hate just because they have good insurance. It incentivizes employers to treat you well and give you good things and not hold you hostage with insurance.
Isn't that the way the cookie crumbles, though? That's how we have single-handedly set our system up to where we have to work at a corporate job in order to pay the man, and then in order like we can't go venture off and do our own thing, like you were saying earlier, to do the small business because, well, you got to pay out more for health insurance, this or that. But if I work for this guy and I pay, make money
Yeah.
for him, I get all of these built-in things that are kind of a necessity. I swear there's a whole funnel system. Everything's run by pharmaceutical companies, and we just drive it.
Yeah.
We just drive it home.
Yeah, this is an increase of freedom for people to work where they want, how they want, to try a new job, to take risks, and they don't have to worry about I took a risk and it failed, and so like now my kid can't get their medication.
Now, why is this plan not pushing through? Where was the pushback and why?
Well, so you look back, if you look back to Obamacare, Obama wanted to do single payer. It's kind of similar to this. I don't think as good of a plan. And the pushback came when Obama won and he had this mandate to do universal health care. They got in there and they started negotiating it. And moderate Democrats and all the Republicans said, who had just gotten a bunch of money from Big Pharma, and then Big Pharma bribed Obama too. They said, wait, keep us in this. Keep this in this. Instead of taking that money and paying the medical bills yourself, just subsidize us. We already have this structure in place. And I think we saw that like that type of system doesn't work at all. I may have forgotten your question actually when I said that. What was your question again?
Why did this not already pass? Like why was this proposed and not pushed through? Where was the pushback and why?
What's the first word do you think that people think of, moderates and conservatives? If I say Bernie Sanders or AOC, what's the first word?
Socialism.
I think that's why. I honestly think that's why. There's not very many good arguments against this. It's of all the things we talk about in politics, this is by far the hardest one to come up with an argument against. And the argument is that people legitimately are afraid of the word socialism. And I think it's just a fundamental misunderstanding of our economic structure. We are a mixed economy. We have elements of capitalism, and it works in places, and in other places it doesn't. But there's been 120-year war on the word socialism in this country that was perpetrated by the rich. They've been funding it forever. They want to keep all their money.
Well, and maybe here's some pushback so if we do essentially not free but kind of free healthcare, right? Mm-hmm. Why not do free food too? Have just a percentage of your income tax, come out and pay for specific meal plan, and you get so many coupons for the grocery store for whatever, and kind of built in like that. Like, why not just do that to make sure everybody can eat too?
I just don't think there's a demand for that. I think that when you see something like this where it starts to make sense, and this is why I like mixed economy, is because, and I think that some of your audience is frustrated with me often because I don't seem to have like a set of principles that I work within. When you're saying like food, I think that there are people in this country who are food insecure, and I think that we have programs to take care of them, and there's things we constantly need to do, but there's not like this massive need. Like even those that are living paycheck to paycheck generally have enough money to buy food, and so there's not this massive need. But like health insurance works for almost nobody. Nobody actually likes their health insurance. Nobody likes paying the premiums. Nobody likes having to stay in network. Nobody likes a deductible. Nobody likes copays. Nobody likes the customer service. There's a massive need for this. There's 60 million people in this country who don't have access to it. There's another, 30 or 40% of this country who has it and they can barely afford it. There's a lot of people that have insurance and still never go see the doctor because they don't have money. They're afraid to get a procedure. They're afraid to have to pay their deductible. And so I think that like when we look at socialism, and we look at social programs, we need to look at them in terms of like, is this actually going to solve a massive problem? Is this actually needed? Is there a better solution? I don't know of a better solution for healthcare. So, but with food, I just think that we're not at that same point. And if we ever get to that point, maybe we do have to start talking about like making food guaranteed, but hopefully we don't get to that point.
That's fair. K.O. Dave, would you like to jump in?
Yes. RTP, I kind of would like to hear a bit about, as you can see, I said that I'm Canadian. I'd like to hear a bit about how this whole plan you're proposing, what's it like compared to the Canadian health system, and how does it differ? In what ways might it be better?
To be honest, like I'm not super well versed on the Canadian healthcare system. What I do know about them is that they are more involved in the doctors and the hospital, like in the finances of the doctors and hospitals, than I think I would want our federal government to be in. I also know that the provinces in Canada more like have more broad rights, and so you see kind of a mix in the more conservative areas. You're seeing a bigger push for private insurance, and you're seeing even taking subsidies that historically might have been meant for government-funded insurance going towards private insurance. But Canada just has a lot of problems. You don't have that many people, but you have a huge fucking piece of land. And so you're always dealing with supply and demand issues. You're always going to have problems in rural areas finding doctors just because you're more spread out. But the main difference between what I'm suggesting and maybe what the UK does and what Canada does is that I'm only suggesting that we become a health insurance provider. We simply pay the bills. I don't want us involved in doctors, in paying doctors and paying hospitals and in running every aspect of the healthcare. I do think that there are private market principles that operate a little bit better than government market principles. So I want to see us just funding the health insurance side of it.
Okay.
K2?
Yeah, there's a couple things that one, I do like my insurance. My union runs it, and it's pretty good. I get full coverage. Everything's taken care of. Eyesight, dental, and compared to everyone else that has their own private insurance through their company, it's way cheaper.
What's your deductible like in your?
I don't have a deductible.
No deductible. Any copays?
Nope.
And then
only a $10 copay.
And then what do you pay for your premiums?
My prescriptions, the only one that costs me money is $5 for Adderall. I don't pay any premiums.
Well, your company does, right?
Premiums.
No.
Do you know what they pay? What their contribution is?
Like they give it to my union, and then five other companies also pay into it, so it keeps their costs low too. Then so Teamsters decide and negotiate everything
bargaining
too. So
yeah,
it's
exactly. Sarah's ahead of me. Sarah's way ahead of me. Yeah,
I'm just saying.
No, wait, hold on. This is the benefit of collective bargaining. The reason that you guys have negotiated such a good deal is collective bargaining. Imagine if we collectively bargained with the whole country. That's fucking great.
I just wanted to come in angry at you. I wanted to come in angry at you.
Sorry.
Because one, you kind of pissed me off at this one thing that you said. Bigfoot not real. Who's making all those blogs then, dude?
It's a fair point. I didn't think about that.
Yeah. All right. I said my piece right there.
That's fair. And just to say, Nuke had the goal. He helped complete the goal. He did number 9 and then also number 10 and said, yes, Australian dollars do exist. Or does it exist? I guess it does in YouTube land. So, hey, we're all fantasy characters here. Evan Lord with the Big 5 says, good night, everyone. Of course, as you saw, he exited the panel. His mom was calling. And Josh says, so K2 has a very good insurance plan negotiated by collective bargaining power.
Love it. You love to see it.
What if we unionized all, maybe not as a government portion, but what if we unionized, even state to state or something unionized for our health insurance? Maybe in order to sell insurance in Maryland, we have a union that says, all right, we'll bargain on behalf of Maryland. What if you gave it to the states to handle that? Because health insurance, you have to have certain licensing, I think, to sell in the state, don't you?
They've largely removed a lot of that. Like this idea that states, that insurance companies didn't want to cross state lines or couldn't cross state lines isn't true. We've largely eliminated that. But what you're saying is correct. Every state has different rules for their insurance company, so it's really difficult and not very cost effective. But what you're saying, what if we just did that? I think that the only reason we would unionize on a state level is because we can't get total agreement. I mean, this is what Massachusetts did when Romney was governor. They decided to do single payer healthcare, and it was funded. They had a balanced budget. But I think this is just adding layers that are unnecessary. Like the more people you have to collectively bargain with, the more leverage you have in negotiating and the less hoops you're jumping through. So if we didn't get Medicare for all, I think that we will start to see blue states, if we don't get Medicare for all, do exactly what you're talking about, to try and collectively bargain. I do think there are people there's already some states that do it. So I don't think that.
I mean, I think that would be beneficial. I mean, if you want it, I mean, even in Maryland, we have Johns Hopkins, right? So we're flying pretty nice in terms of hospital systems and healthcare and all of those things. And I would think that we would use that. That would be incentive for us to boost our healthcare plans, because then we want the insurance companies to want to sell their shit here, right? And then I think that would actually feed itself.
It would, but
trying to hire the best doctors, have the best care system, have the best, so in terms of supply and demand, have the most availability, and then we look pretty to the healthcare system or the health insurance companies, and then therefore we can say, all right, well, if you want to sell to us,
but the problem is
even what you got.
Even if you negotiate that way, you will never out negotiate let's just say that we as American citizens decided collectively to come together and collectively bargain with these private insurance companies, and we leave the government out of it. We still couldn't negotiate a better deal, because all of these private insurance companies have profit built into their margins, and their profit is on average between 12 and 15%. Those are numbers we can never touch. And I just don't give a fuck about their profit. I don't think they need to profit off of paying our bills. So I want to remove the profit incentive from health insurance. I think that is the number one problem. And we can only do that by removing the people who demand profit.
Not all the insurance companies.
Yeah, you have are you talking about the cost share type stuff?
No.
Co-ops? And
no.
You talk, what insurance companies are you talking about?
Blue Shield of Minnesota. Health Partners.
They don't make profit? Blue Cross Blue Shield?
They're not for profit.
Who is it?
Blue Cross Blue Shield of Minnesota. There's actually several in the state of Minnesota. And to kind of go on K2's thing, I do know how much his employer, the union, pays per person in monthly amounts.
So they're registered as a nonprofit, meaning there's resources used to serve its members. I'd be interested. I'll have to look into Minnesota. I would love to see what their margins are, with their nonprofit status. It'd be interesting. You can get around that shit.
Can still have very high salaries for everyone. You know what I mean? It just goes into another pocket, essentially.
In the situation of that, actually doing research on it, every 90 cents of every dollar pays out in claims. So only 10% is for actually running costs. And that's actually
that's really fucking good. That's honestly so good.
It's almost actually better than government.
Yeah, government is 80-20, 80%. Private healthcare insurance is 30%. But that beats Medicare and the VA at 90% for Blue Cross Blue Shield Minnesota. Shout out Tim Walz, huh? Shout out Tim Walz? No, shout out Tim Walz? Okay.
No, Tim Walz unfortunately murdered that. No, I'm sorry.
Okay.
But in the situation, and there are plans like Anthem, Blue Cross and Blue Shield that are absolutely, they spread across 14 different states.
Look, I've been looking at this. I don't know how they do this. Their CEO of Blue Cross Blue Shield Minnesota made $4.3 million. So that's money we could save.
That's actually of all the companies that are aligned with Blue Cross Blue Shield.
It said the highest paid employee at Blue Cross Blue Shield of Minnesota is CEO Dana Erickson.
But she is not. Blue Cross and Blue Shield of Minnesota is not the parent company.
That's what it says here.
No, it's
not. Are you sure about that?
100%.
Who's the CEO of Blue Cross Blue Shield Minnesota?
She is the CEO of it, but she's not the CEO of just Minnesota, Blue Cross and Blue Shield of Minnesota. She's CEO of multiple different companies under.
But this is This is what she got paid from Blue Cross Blue Shield Minnesota.
Mm-hmm.
Does she? Is it like a shared CEO?
Yep.
There you go. That's why.
Yep.
So she probably is the CEO
that
of the one in Minnesota, and then maybe the one in Ohio, one in Illinois.
Minnesota is by itself. Ohio is owned by Anthem.
No, this is saying that this was her. She has a salary paid by Blue Cross and Blue Shield of Minnesota of $1.3 million, and then she got a $2.6 million bonus and $350,000 in other compensation, and that's according to her state filing.
Yeah. So that
And
is
that's where the not for profit goes to, is into their salaries. So we're not profiting, we're paying salaries.
Yeah, because the CEO of Blue Cross is someone named Kim Keck. That's a different person. I do think she got 4.3 million from, again, but even if she got that and they're still paying out 90%, that's incredible. Good on them.
Yeah, because what was it? Last year, I think it was, they paid out, I think it was like $15.8 billion in claims. So, yeah, they definitely pay out, but yeah, they're not, like I said, they're singular. It's one of those situations. But like I said, Health Partners is also another not-for-profit. There are several companies in Minnesota that are not-for-profit for insurance.
Yeah, but and if that was across the board, we'd be in a much better place. But again, I still think Medicare for All is a better choice than that.
Yep. But here's the situation to kind of lean into that is looking at the state insurance. This is where we kind of get back into that Medicaid part that you and I had a conversation previously, is in the terms of it, the state can't operate all of the Medicaid people. They have to outsource it to the individual insurance companies, the private insurance companies. So it gets back to what Sarah was saying, is realistically, can the government actually handle that load?
Yes, they will hire lots more people, and luckily for them, they'll have a bunch of people experienced who no longer have jobs at the insurance companies that they can hire.
I mean,
I wonder if the government could still employ it to the states to do what's best for that state, because we do have all of those different variations. I feel like
states will still have to. States will hire these people. They'll be federal jobs and state jobs. It'll be both. Okay.
I just feel like the states should have more of a say and more of a power in this instance, because that's the power of the states, is that they could do what's best for their people, and so on and so forth. And I feel like the government maybe should offer the platform and then let the states do their bargaining power as needed, but the federal government kind of lays an umbrella to it, maybe like.
Well, that's what I'm saying. So those laws already exist, right?
Mm-hmm.
The states are already they can pick and choose. Like there's ways that they can spend federal dollars, and they can kind of make those determinations. Those laws that exist now would still exist. This wouldn't change any of that. So the states' rights to distribute that money, in some instances how they wish, that would all still exist. That wouldn't change.
Okay, that's fair.
Would the this Medicare for All insurance, would it cover like all medical costs for a person?
It would depend. Like that stuff is all going to be up to like how Congress writes it in the bill. I can tell you like what I would prefer, and what Bernie Sanders has proposed. But again, then they're going to go and they're going to negotiate the bill. And I think that there's going to be a lot of people like Sarah, especially conservatives, who are going to say, hey, we want as little control by the federal government as possible. So it's going to be a negotiated agreement. So I don't know where we would land on that. But I would want no copay, no deductible, no pre-existing conditions. And then you would also cover mental health, dental, and vision.
Mental health, dental, and vision. Okay. So like would you like, okay, because that, I think that would be even more than is covered here in Canada by our private healthcare.
That's more than most of our private health
insurances. Yeah.
Yeah. There's some good ones, but that's better than most of ours too.
Like in Canada, right? Any Canadian can walk into a hospital, get any treatment that they need, and then just walk out and not have to pay a single dime.
Yeah.
So how close to that do you think Medicare for All could get?
They would be the same. There would be no copay, you would go into a doctor's office, you would get care, and they would bill the government.
What happens if it's rejected?
If what's rejected?
What if the service that the person walked in and had done, Medicare for All says that it wasn't necessary and then rejects, who's responsible?
Then it would be the consumer still.
Okay, well, would it
Okay,
follow
well,
the Medicare or would it follow the Medicaid rule?
What do you mean? Which
Because
rule?
right now, technically, Medicaid, anybody that goes in and it's denied for any reason, it falls to the actual providers as a contractual obligation. Members cannot
The
be billed out.
providers of that provided the medical care.
Yeah, for
Yeah,
Medicaid.
and then they submit usually reimbursement to the state, right? They try and collect back from the state.
No, they can't. It's flat out actually rejected. So they have to write it off on their taxes.
Isn't this what they were just talking about in the bill, that like the states were manipulating this and that they were rebilling the states?
Not in this situation. I'm talking about once the provider has done the service, it's been rejected, it follows a contractual obligation, they can't rebill it back to the state because the state has already rejected it. Technically.
So even though it's the federal government that's footing the bill, the Medicare for All insurance could still theoretically reject the treatment.
Well, that's
yeah. But this
well,
is,
wait, wouldn't
this
the potential? But because even with insurance, they still run the stuff first before they implement, right? Unless it's emergency, that's a totally different world. But I go into doctor's office, I say X, Y, and Z hurts. Okay, here we're gonna do D, E, and F. Okay, and then before they do D, E, and F, the little medical assistant back there's running it through the insurance company and it's pumping out whether it's with the codes. This is where the medical coding is very important. It says rejected or accepted, and they do that before you go into the procedure because you have to be able to agree if you're going to pay the extra dime or not, right? So
but
I think you could operate the same way.
Like that already exists.
It's not at all like the Canadian system, because the Canadian system, there is no rejection. You whatever it is you need in the hospital, you get, and you walk out and you don't pay a buck.
Well, that makes, you're saying hospital. Are you saying like in an emergency
hospital
care, or are you saying like
just whatever, whether you're going in for some sort of X-ray or you're going in for a surgery? Like
Canada, I'm reading Canada's rules. For public health care, claims can be rejected if they're deemed if they're not deemed medically necessary, or if the service is not covered by the specific provincial or territorial plan.
That would be for
public health care.
For public health, yeah. So, like, for instance, dental health care is not covered, right? So you wouldn't get covered. You wouldn't be able to walk into a dentist office and walk out without having to pay, right? But like quite literally, you walk into a hospital, and if the hospital, your doctor makes files a recommendation that says basically, my patient needs X treatment or X whatever. And as long as that is approved, right?
Yeah, but what if it's not approved?
If it's not approved,
so I think we're all saying the same thing. Like there are things that can be rejected in Canada as well. I'm reading through it. It looks like if it's not medically necessary, if the service isn't covered, if you are failure to comply with the terms of specific health insurance plan, if the province that you're in doesn't cover that. And it seems like each province and territory have different rules. So it looks like stuff can be rejected
so normally your family doctor, your doctor, whom you can like book appointments with at no charge, this person will know all those rules and will know like what you can and cannot get. So normally it goes through without a hitch. You don't normally run into issues where you get rejected like this.
Yeah, I think that would be the case here too. I think the standard, like what Dragon Rage is saying, like it could happen. That could happen now. That could happen in every system. I don't think that would be unique to any system.
Yeah, but my questioning on that is who foots the bill then at the end of the point when it's rejected?
Well,
if it's a situation
then
that
you don't.
Emergency.
I'm giving my
Well, if
opinion
it's an
there, but
emergency,
I don't know if I
it's
know the answer to that. To
yeah,
be
if it's
honest,
an
let me look into it.
emergency and your life depends on it, it's going to be accepted because they literally have to do these things to
Yeah,
save your life.
Yeah, in
Now,
Canada, that's definitely that's never rejected. I
right.
don't know about the
But
US.
if it's something where it's like, I don't know, having a back surgery, for instance, like you don't necessarily have to have it, but you can choose to have it, right? So maybe something like that, and that would be plugged in prior to that, and that happens anyways, right? Like they decide what they
cite back to the fighter though.
Yeah,
that's the situation.
I've got your answer, Dragon. I looked it up because I wanted to make sure what. So it would go by the Medicare rule, which means it would go back. The cost would fall back on the beneficiary.
Okay, so then in the situation is it could still cause people to go into massive medical debt in the situation of, say, that fighter that had to have the double lung transplant being rejected for not being medical necessity.
Well, so that would be a medical necessity because he has to have a double lung transplant.
That's what they're rejecting it on, though, is the fact of not meeting medical necessity.
But that would meet medical necessity, I think.
Yes.
Like if you need 2 lungs to live, that's probably a medical necessity.
That's the
Hold
situation.
on just a second. Let me do voice Spicoli, is that you?
It's me.
Oh,
Yes.
your name was different on the other thing. Okay, just making sure. Sorry, go ahead, Dragon and RTP. My apologies.
So what I was saying is they denied it, saying it's not medically necessary in the situation. I did a little bit of looking. Granted, they don't have a whole lot out there, but the saying that it's not medically necessary, it wasn't from a pre-existing condition situation. They're saying it doesn't meet medical necessity by their medical policy guidelines, and therefore
that policy there would be no pre-existing condition provision that would make something medically not necessary in Medicare for all.
That's not why he was rejected. Was from a pre-existing condition. It's not meeting medical necessity.
No,
so
I think his was pre-existing condition. I'm pretty sure it was from a staph infection.
And pre-existing.
But the medical necessity, medical policies part of it is you have to do X, Y, Z before you can actually do that. There are certain scenarios, so like a knee replacement surgery.
Listen, in that scenario, he was not denied by medical necessity. He was denied because of the high cost and specific policy limitations. They specifically came out and said he was not denied coverage for lack of medical necessity.
Because everything that I find when I search for it flat out said that it was denied for medical policy.
Are you two looking at two different things and not realizing?
I'm reading this from Fortune magazine. It says Ben Askren's insurance company initially denied coverage for his double lung transplant, not due to a lack of medical necessity, but potentially because of the high cost of the procedure and specific policy limitations.
Can you link it just so I can see it? Because you may be right in the situation, but what I found in terms of looking, I didn't see that. I looked through everything that I could find. But that's my point is,
okay. So
I asked the question specifically on who would determine the medical policies and what would fall into that situation. So like in terms of Medicaid right now, it falls to the provider, which if we were to do that process,
but this is Medicare, not Medicaid. So it's you're gonna work within the framework of current Medicare.
Yes, but here's the situation. I'm going to just kind of play with you a little bit, how you can never be nailed down to one actual strict point. I'm just going to kind of play with this a little bit. Like you can, that's what a lot of people argue with you about is you never take 100% stance on one specific thing. You kind of shift around. But if they all of a sudden negotiated that to be in that place now, rather than falling to the actual beneficiary, would that be something that you'd support? Because then it would 100%
no, I would not support that. No, I would not support that.
Okay, well then it could in theory still cause somebody to go into medical debt.
Everything in theory could, but I'm basing it on the current conditions. So yeah, if they decided to change the rules entirely from the bill as it is proposed, then yes, theoretically, if they change what I am proposing, that could happen. But based on what I'm proposing, that would not happen.
Would you
allow me to interrupt for just a moment for logistics? To the chat, you've got 15 minutes to finish that goal. You've got 8 more super chats to go, or I go to fucking bed. You pick. You pick. And Spicoli's here, so you know it's about to get good.
Can I
We
interject
can
something?
also shift topics if we
I'm
kind
fine
of
with it too.
beat a dead horse or anything. Spicoli,
Yeah.
I know you're
Here's
pretty
my
short-lived on here, so
Here's my take. First of all, I'm on Medicare because I'm over 65, so it's great. I mean, once a year I don't pay for shit. It's wonderful. You go to the doctor, you go to the hospital, everything's covered. You're treated like they roll the red carpet out. You know all the tests they don't want to give you when you don't have health insurance? It's funny when you got Medicare, they want to run every test in the book. But I'm healthy. But here's the situation. I mean, my glasses are even covered. My dental's covered. Everything. Somehow I got it. Wait, I got everything covered, man. It's great. I love it. And I want to thank everybody who's working and paying into the Medicare system and Social Security system. Thank you, Sarah. Thank you, RTP, Dragon Man. I don't know if you
Got
have
it.
to do the weekend. Thank you, folks. Keep keeping it going. Have more babies so we have replacement kids to pay for all this shit. But here's my point. It's one of the best things in the world to just be able to go to the doctor and have even my glasses. Like I get once a year, I get $300 for frames and lenses. I mean, I just got Oakley frames yesterday, Armani. It
All
doesn't
right,
matter.
flex.
Let me make it's a flex, but I busted my fucking ass and paid into the system. Now,
I'm
if you would've
envious.
done
You got more than I do.
Please, I know 10, 20 plus years ago, I would have said, even about 10 years ago plus, I was a big proponent on health care for everybody. I think everybody should have health insurance. And I think I was for, just like every European country has it, I was for that here. But I would say the last 10 years and the last 5 in particular, nah, not for it for everybody. And I'm going to explain why. Because if you go back 10, 20, 30 years ago when I was for it, the average person was within a decent weight size. The average woman did not weigh 175 pounds. She weighed 125, 130 pounds. The average male did not weigh 210. So what I'm saying is, you people are not healthy enough to insure all of you folks. If we were to put everybody on Medicare tomorrow, and I snap my fingers, the government would literally go bankrupt. I mean, it's already bankrupt. They don't have the money to pay for it anymore. We had the money when you people were in decent shape and decent weight. But when you started abusing your goddamn bodies and you people started getting fat as fuck, they threw everything off. And now what are we looking at? Why do you think health costs are going up and shit? Why do you think your health insurance is skyrocketing in the last 5, 10 years? Because people are out of shape. They're just obesity causes all these diseases and shit. We know it's true. And all we're doing is celebrating big people, fat people. It's ridiculous. So when you're in an environment where everybody's fat as fuck, do I really want to give free health care to everybody? So everybody with every fucking pain in the ass disease can run to the doctor and bankrupt the system? You know what they'll do? People just abuse themselves even more and get fatter, knowing that, the taxpayers can all this shit. So they're just,
Then,
people who can abuse their bodies.
Spicoli, can I ask you a question? Can I ask you a question? Wait, could I ask you a question about Spicoli at some point? Land it, please. Could I ask you just a question just to clarify? Spicoli.
Well, while you're asking, K2 went ahead and muted you, Spicoli, for 5 minutes, and so I'll let you answer when RTP asks a question, but otherwise you're on the mute button.
I would just say this: if that was true, then all these countries with universal health care would all be the ones with all of these problems, but they're far healthier than us. They're healthier than us because they have preventative care, because they have access to a doctor, because they have doctors who will give them diet plans, who will teach them about nutrition, who can put them on medications, who can teach them about a healthier lifestyle. If that were true, all these other countries would be more unhealthy, and we wouldn't be the ones that are seeing our life expectancy drop while theirs are raising.
I literally
Can I answer this question, please? And then I have to go. My point is, first of all, every European country, literally that's in West Europe, England, and even France and everything, the women are fat as fuck over there too. And they're just as healthy. Somehow you think when you cross the Atlantic Ocean, all of a sudden women, average woman weight drops 50 pounds and she's 125. No, go to
Yes.
England. I was in England last year, and they're fat as fuck over there. In fact, in London, they're just as fat. They're even fatter. Some of these broads, they're like cows over there. So don't tell me their healthcare system's doing any better. And another
Except for
thing,
it is, but I'm looking at the data. So I'm looking at their outcomes. I'm looking at their levels of obesity. I'm looking at their levels of heart disease. I'm looking at their quality of life. I'm looking at their life expectancy. And in all those metrics, Spicoli, your eyes, I don't care what your eyes saw. The data says it tells a different story. Listen, brother, with all due respect, I could give a fuck. I could give a fuck about your story. I can look at data, and all the data says that you're fucking wrong.
Are you sure when you were in London?
50 to 75 countries have probably national health insurance. In each case, it's different. China, people have health insurance, but by the government, they're in better shape. If I go to London or England, they've got health insurance through the government, but they're in shitty shape. So do all the fans. Go to Russia, they've got health insurance through the government. They're in good shape. So
I have insurance from
free health care to every citizen. They're in better shape. No
Well,
bullshit.
I hope that one day I have to debate. Like, I hope that one day America has to choose between universal health care, and I'm the representative to sell them on it. And I hope to God that you're on the other side making the other case, because it will be unanimous. We will win that in a landslide. Your anecdotal angry evidence is unconvincing, sir. And I know that you have a lot of feelings right now, but your evidence is unconvincing.
Dude. Another part of the situation is you're part of the gayest generation of all, under 40-year-olds, under 45. So in other words, half this.
Who cares?
Because we're paying a lot.
Who cares?
I'm sorry, brother. I'm sorry there weren't more options for you, Spicoli. I wish there were more options for you your age, but maybe go younger. I don't know if you know about like being a sugar daddy. It seems like things are going all right. If you want some younger dick, just get on Grindr and tell him you got some money. See if you can get some younger dick.
Spicoli always does this. He always talks about the fat chicks and how everybody's overweight. Guys can't find skinny girls anymore because they're all this, and then they expect us to spend money on them, but they're 170 pounds and blah 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 and yada yada yada. It's always about the big girls, Spicoli. I think you got a weird fetish. You need to fix it, young man.
It might be your personality that's causing the problem, Spicoli. That might be what's driving women away from you.
What I want to know.
Chat, and I'll give it back to you, Ditso. Chat, you got 7 minutes to send 7 super chats, or you're all going to be saying good night very quickly, and then you're going to be bored and have to go find someone else to watch. And I hate to do that to you, but my time is not free either.
Pay her.
If I may kick in real quickly, I come from a country, Costa Rica, that established universal health care last 75 years. Basically, me as an employer, I contribute 9.5% of my monthly salary into that. In total, between the employer, me, the employee, and the state, 26.70% goes into that. Of my universal health care. I'm not going to say my system is perfect. We have Evan problems, being the 3 major problems that the state is the major debtor to the contributions. It's owing billions of dollars to the Social Security Fund. We also have the problem of long waiting lists into that. And the problem of accessibility towards specialists in the treatment in that sense. But if you ask me, universal healthcare is way much better than any other solely privatized system. We have a mixed system. Here, people have the free choice to decide not only to grab a private healthcare system, or the public. Obviously, the majority of employees, if not 100% of the employees, are subjected to that 9.5% of their monthly gross salary. So even if the choice is there, the obligation for all employees is that everyone employed must contribute to the security fund. I'm going to give you a case. I had appendicitis a few years back. And the most that it cost me for getting operated and treated and everything was about $1,100. That's all I had to pay. And 80% of that was subsidized by my contributions. So at the end, I paid about $250, 300 at most.
I had a gallbladder surgery recently to remove gallstone, and I was in and out and paid $0.
Yeah, pretty much. I mean, if I get sick, when I get sick, or when my family members have gotten sick, the least thing I have to worry about is being bankrupt. I know that I'm going to get treated.
Great feeling.
It's a great feeling.
Yeah.
And sorry to say it this way, but United States has great schools of doctors, nurses, etc. Has great education in that sense. But on the system, you guys are way behind many places in the world. If the meaning of getting sick in the United States means worrying about being bankrupt, it just doesn't make sense.
Yeah.
That's all I have to say. Yes, my system has problems, but it's better than that of the United States.
I would vastly prefer long wait times and like over having to worry about whether or not a trip to the hospital bankrupts me.
A trip on an ambulance bankrupts you.
Yeah, that I've heard stories of that, and my mouth was agape for the rest of the day. I was like, "Oh, I can't believe it. That's a thing. That's so cruel."
Yeah, I just want to add one quick thing. I know we only have a few minutes left, and hopefully people will get pissed at me being here and sending a bunch of money. But I just want to say, like, for me, I don't know if we touched on this earlier. I didn't watch the whole stream, but I think I'm obviously pro Medicare for all. You could probably predict that. But I think it's not just about like healthcare. I think it's about freedom, the freedom to leave a shitty job, the freedom to start a business, the freedom to get sick without it being a death sentence. You know, I think in a world where we have billionaires getting bailouts and buyouts, I think it's fair that working people should get a goddamn doctor.
Yeah,
it's a human right.
Well,
from my perspective, and the perspective of my country, the access to health is a fundamental human right, and not applying it through the constitutional means is a clear violation of everything and every reasoning in regards of our freedoms.
Hello, doggy. Now, why is medical a fundamental human right? Let's get into that.
Ooh. I can start on that. Look, what is the definition of health? Let's start there.
Being able to, function normally in society and in your life without your body essentially betraying you.
Okay, it was a rhetorical question, but great. I prefer.
Yeah, shut the fuck up, Brian.
I prefer, and I am adscribed to the definition provided by the World Health Organization. Health is not the absence of sickness. It is everything that surrounds one being healthy. It's an economic. It's an economic. It's a political. It's a social aspect of health. So understanding health as that fundamental right, it is the driving force of all civil constitutional rights. If you're not healthy, how can you be able to express your freedom of speech?
Let's go. Is it a right or is it an overall good for society if we're a healthy nation? I think maybe you should differentiate from that. Is it a right or is it just this is an overall good?
Well, I think for something to become a right, at least in America, we have our rights installed through our Constitution. I think right now, healthcare is not exactly a human right because it's not provided to everyone. And so I think if we want it to be a human right, we have to fight for that. We have to present the case that it should be a human right. And I agree that it should be. But I think as it stands, we have to face the reality that right now in America, it is not a human right to get healthcare.
And to answer that, but from the perspective of us, Costa Rica and Latin America, The distinction of what is good to society and fundamental civil rights and human rights are not a distinct thing. From our way we practice the law and we apply law and we enforce it, our basic tenets of our way of law that is not common law, which is the least common of all laws, is only practiced in about 25 countries out of 195. But in the sense of how we practice law, there's no distinction. It's illogical to even make a distinction. Rights are what are good for society, are what keep this essence of sovereignty, freedom, and the ideas that have been ingrained for the past 200, 250 years in the Western Hemisphere. So that distinction to us is absurd. It doesn't fit.
Yeah, I don't know if I would. I don't know if I'd declare it as a right. I don't think it's necessarily a right. You know, like you don't have the right to, like, access to. Not to say that you don't deserve, right? Don't get it the wrong way. I think healthcare overall for everyone is a net positive for society. I wouldn't say it's a right, though.
I agree with Sarah.
From the international perspective, your country, by ratifying the Convention on Social and Cultural Rights back in the 90s, you have already agreed to the term that health as a universal human right. That was established through the ratification of that covenant. Or the International Pact of Social and Cultural Rights. So fundamentally, you've already agreed to that. That you do not apply it because your courts don't know how the hell to apply that covenant through the congressional or legislative or Senate ratification. That's something that your country will have to work out.
If medical was a right, we would already, like, we would just always have had access to it since the very beginning, right? Like in terms of oh,
Not
bad Gemini, I haven't seen you in forever. How have you been?
Just because it's a right doesn't mean that your government is going to implement that right, right?
No, fundamentally, in the United States, the concept of how, let's make a distinction. The civil rights that have been applied through the constitutional republics, especially the 10 main ones, have been evolved through the ratification of human rights accords and have become supra-constitutional once those accords have been ratified. The problem with the United States is that it has done its barely job into applying that. Would bring up the Pact of San Jose, which is the Inter-American Convention of Human Rights, which enable then the application of that concept of health as a human right through the international law. Now, let me just say this, and I may be someone that it's going to be controversial, but I don't give a damn fuck. The United States has no clue on how to evolve the Bill of Rights. It is stuck on ways that are 200 some odd years old. And the rest of us in the world were trying to advance beyond those concepts of 200 and 250 years old. For us, especially coming from somebody from Costa Rica that originated the Pact of San Jose, or the Inter-American Convention of Human Rights, that opened up the Inter-American Court of Human Rights, that hell, we've been accused by the Inter-American for violating our own principles. You know, at the end, the fundamentals of human rights as known through the international law are something that the United States is oblivious to, because they don't want to.
Sarah, this guy can never write my prenup. Like all my money would be given away.
It would
I wouldn't
would
know
outlast
what's
your
happening.
marriage.
I was like, what is going on? Like, he could not.
You'd get divorced before he finished writing it.
I was like,
I was starting to zone out.
everything would be gone
I
before the
was like-
marriage is over.
Like
I
over
like
here
you,
reading
Ditso, but
other
you are pretty
shit.
long-winded.
I'm
No-
like
no
gonna
offense,
start
Ditso,
opening up
but-
a book or something. Read the dictionary for an hour. Go ahead, Gemini. Kick in here.
Look, I'm trying to behave, but when I listen to a guy like this here, outside of wanting to jump off the highest bridge, when I listen to him, I understand this. Fundamentally, what we got? Ditso? That's what we call him. What you want me to call you? But I'm gonna say you that guy. You cool. I'll call you that guy.
No, just call me Ditso. I don't care about you calling me a guy or whatever. I'm gonna call you Bad Gemini, and you call me Ditso. How about that?
I love it. I love it.
Start with a little bit of respect before you throw your bullshit to me.
Oh, there it is. Let me tell you the BS that you uttered. First off, health is not a universal right, since you wanted to head there. The access to health. So you can't say they wrote in the law that, good health. That's two different things you're talking about. We're talking about access to health. You can be a slob. A slob can have access to health, is what they're saying. So that's what's universal about it. So in America, they're not going to govern what you want to eat. They're going to provide food programs. They're going to point you out to people who can help you if you're eating because you're stressed, if you're eating because of family things, whatever it may be, right? You may even be predisposed to certain things genetically. That's fine. We don't care about that in America. What they're saying is we're going to give you access because the doctors know when they're attending to somebody who's on 600-pound life that, you know what? Yes, you're probably going to have a heart attack. But the law says I should treat you and be unbiased. Even in my mind, I'm like, well, the first thing I need you to do is buy less if I'm going to be unbiased and stop eating all that damn food you're eating. But we're still going to tend to these people, Lato. So that's the only thing I wanted to point out, just to give discrepancy. You have access to it, but the health you're responsible for. We just give you access. The doctor is not going to stop you from being a slob. I think America does a great job because if you have a decent job, you should have good insurance. And if you have no job, they're still going to give you insurance. We have a lot more laws that have been written in the last 8 years compared to 40 years before. So I'm going to be a second-class citizen in America rather be a first-class citizen somewhere else and still not have as good doctors as you could have here. And that's just real.
Riddle me this one thing.
Wait,
Why-
Ditso, no, with all due respect, Ditso, no, I can't. I'll fall asleep. You got to take a break for a minute.
Yeah.
I do have a question. Like, how can you say America's doing a good job? We are the most expensive health insurance, and compare our outcomes to basically every country in Europe, and we have worse outcomes. So we pay more and we get shittier outcomes. How are we
and
doing a
have
good job?
higher salaries? See, when people want to talk, let's just make
We're
it
talking,
plain.
no, we're just talking. No, salaries have nothing to do with any of it.
It has
We're talking
everything to
about
do with it because I can afford it compared to somebody. It's the highest. Well, if we're getting paid
60
the
million
most,
Americans don't have
highest.
health insurance. 60 million Americans do not
First
have health
off,
insurance.
Let me tell you this here, and you probably got another 60 million that have it and refuse to go to the doctor.
Bro,
So
are
we're not
doing- are
even
we
going to
doing
get into
com-
all
Are
of
we
that.
doing common sense shit, or can we talk about some data? Are you just
No,
gonna
but that-
come up
but-
here and tell me about your feelings real quick, or can we talk about real
First
data?
off, if you're looking for feelings, that's not feelings.
That's
I'm
all
being,
you're giving me, bud.
I'm being
That's all you're
factual.
giving me right now. Is
How many
feelings.
people have good health care, and when you get these surveys, half of them do not go to the doctor with the health care that they paid for?
Brother, that question doesn't make any fucking sense.
That's what I'm trying to tell you. It doesn't make
No,
sense
your
that these people would
question-
continue
no, the
to pay
question
for
you
it
just
and
asked
not
me-
go there.
So the question you asked me was legitimately nonsensical. It made no sense.
Well, ask that to
You
the
have a
people.
lot
Go
of
look at the
you
studies.
have too much
There are
confidence
studies on
and
that.
too
There
little
are
information.
studies
Isn't that a good
on
thing?
half of the Americans who pay for health care do not go to a doctor.
Okay, but I
Isn't
gave
that a
you
good
a
thing?
number.
So they have it if they need it.
Wait, I just
But
want
they're
to
also
ask,
paying into the
if we
system?
are the most expensive,
But why wouldn't you get a checkup?
If we are the most expensive country to get healthcare in, and 60 million people don't have healthcare, and our outcomes are worse than everybody else's, which part of that is good?
First off, you just said outcomes are worse. That's not true because
I've cited this source early. Yeah, I've cited this.
You
earlier.
cited a source, not all of the sources.
What
First
source
off,
did
you
I
have
cite?
people with
I cited-
unclean
I had
drinking
four
water.
sources. I had four
How's
sources.
it better for how we're in a
four-
worse situation in countries where they
you're
have
not-
unclean drinking water?
Are all the fresh and fit rejects showing up today, brother? You're just all feelings. You don't know what the
I'm
fuck you're
glad
talking
that you
about.
want me to be that. I am
So-
fresh and fit to my boo, and she loves me. But you, on the other hand, you need
Yeah,
to go
but you're
ahead
not-
and,
yeah, but you
and-
don't know
and-
what the
and
fuck
put
you're
up that
talking about.
Jergens you got off camera. Since you
So
right here
you would
jerking
say
off
that-
your mouth.
Put up the Jergens. Bro, shut the fuck up. You don't know what you're talking about here. You interrupted other people. You came up insulting people. Yeah.
First off, I only talked to one
yeah,
person.
ditch
I did
those
not
long
insult
winded-
everybody.
Yeah,
Let's
but at
start there.
least-
And I shut
he
up
takes
and let
an hour to
everybody
say it.
speak. You're
He
the
takes an
only
hour
guy
to
who
say-
gets to speak.
I've been
with
quiet
your
for like 20 minutes.
Go
Shut
ahead.
up. Let me
And
finish.
I was quiet
Shut
just
up.
as much.
And I
You
let
a
you finish.
mustard colored
And you're
shirt.
the one.
Go
Yeah,
ahead.
you're the one now. You're the one now that keeps
Mayonnaise
jumping
and
in.
mustard. Go ahead. I'm listening to
Even
you.
your jokes are worse than your data. Yeah. The point
They
is,
don't
at
have
least,
to.
at least
First
he
off, look
said
at you.
something.
Your
Do
sense
you-
of humor is
you
as
are
dry
open-
as the women you've been with.
People are
So I don't
laughing-
want to hear
brother,
anything you're talking
people
about.
are laughing at me right now. Right
They
now, the
should
people
be.
in the they're laughing. Yeah. Listen, you're not killing it like you think you are.
First off,
Well,
if
what the
if
fuck
I
are your
wasn't killing
sunglasses
it,
doing on inside? What are those doing on
they
inside?
should
First
be.
of
I
all?
love
Where
shades
do
in
you
my
live?
house. I got
Yeah.
shades on my window and in my
Cool,
face.
bro. All right, let's talk
Yeah,
about
you
health.
talking about
Let's
be
talk
cool.
about
You ain't
healthcare.
smooth. Back to healthcare since you jaw
Let's
jacking
talk
this
about
guy.
it. Yeah, let's talk about it. So why are we the most expensive healthcare in the world and we have worse outcomes than every other rich country?
What do you consider worse outcomes?
Our life expectancy is lower. Our ability to treat and cure diseases is lower. Our ability to detect and prevent chronic disease is lower. By virtually every metric that you would measure the quality of health insurance, we are lower.
You said the ability to treat and cure.
Correct.
And what is our number when you talk about all the countries that operate now? Are you just saying that out of 10 countries,
No.
the world?
No, so this is about 12, like the 12 richest countries, and there's three different ways that they determine the outcomes. There's three different rating systems. I'm sure you know about the three different rating systems, right? I don't need to pull
When
those
you-
up. You've looked into
Wait,
these.
no, I'm talking about are you going to go with the body mass weight? Like which are the rating systems in general
body-
or specific? The reason I'm bringing it, I'm talking about, are we talking about specific aspects of health, or are we just looking at numbers based on the type of doctors you can get, the affordability of the doctors, or the access to the doctors? So I'm listening to you. Go ahead. I'm listening. You can laugh.
Yeah.
all you want.
Because I already answered this. I feel like what's in that drink, brother? Maybe less of it would be a good idea. You're not
No, I
following.
love drinking because when I drink, I can talk to guys like you any time of the day because all you need to say is land. And I'm waiting for you to land your essence of what you said.
I already
You're
did. I already
regurgitating.
did.
You
in
landed
this-
nothing.
No, I told you what the
disrespected
metrics
America.
were. I disrespected America. Jesus
I
Christ.
love it. I love it. You
didn't let,
disrespected America.
brother. I already gave you the metrics, and then you're like, "What do you mean by metrics? Body mass index? Do you want me to go over them again?"
I was not here
Our
for
abil-
that.
our-
So
yeah,
talk to
our
me
ability to
specifically.
treat and prevent. No, I told you this 30 seconds ago.
But I didn't agree with any of that because let me tell
What
you
did
why
I
I didn't agree
say?
with it.
What did I say?
You
first
said
of all?
that
Before
no.
you tell me
said
why you
the
disagree, you have
ability
to tell me
trait.
what I said because I don't
No.
believe you remember what I said.
Yes,
So
I
just
did. The
in good faith,
part that you
before
missed.
you
You
tell me
said
what you disagree
the
with, tell me what I said.
affordability, our ability to treat,
Yep.
right? So and so those are two of the three, right? And then the third
Our
one
ability
don't
to
have
treat
me
what? Our ability to treat what?
to cure, to treat and cure or prevent
To treat and
illness.
cure what?
Illness.
Okay,
And
illness.
and I'm giving you a
What else did I
generality.
say? Chronic disease,
Okay.
heart
But
disease.
who can treat chronic disease at a high level when it's chronic? Because once they label it chronic, they're giving you they're
doctors.
giving you expectancy. Listen to what you
Do you
said.
think- wait, do you
Once
think
they call it
means
chronic, that's
terminal?
it.
No, you're mixing up chronic and terminal. Chronic means it keeps happening, but chronic things can be cured.
So,
You're thinking of terminal.
listen to this. First
All right.
off, yes, you're correct with terminal. I
Thank
give you
you.
that. That's correct. I'm not going to argue that. But when you say chronic, the thing is, Some people are chronic for a decade plus. Like, how long does it take for this to eventually get cured? Are you going to bad doctors, is what you're saying in America? And that's why it can't get cured as fast? I'm trying to get
there's a lot of reasons for it. One is the amount of money that we allow the pharmaceutical companies to use and influence. Two, that they're in bed with the health insurance companies, so they want people addicted. There is a financial motive for people to stay chronically ill or to stay chronically prescribed. There's a financial incentive. What these other countries have done that we can't figure the fuck out in America is they've removed as many financial incentives as they can so that people are paid and they are given their positions of power based on how well they treat people, not how much money they make off of those people.
So can I ask you that? Isn't part of it how the people treat themselves when you're talking about how they treat people? If the people tend to have a better diet and a different outlook in terms of how they value food and what they want from food, then they tend to have better results by default. In America, we don't have that level of consistency, right? There are not a lot of health nuts. We see them in the video, but that's a small fraction of the population. But if I'm in a country where my daily walk is 5 miles by default for work, or I'm eating most of the vegetation, I'm not getting to meats and all that, whether it's from religious beliefs or just what's available for me to eat, then I'm going to have a better outcome. So where does that weigh in when you're talking about American?
You're talking about education, but even outside of one, it is important that we take care of our food. Why don't we have good food? Because we allow all these massive corporations to put addictive chemicals in our food. Because in America, the thing that no matter what anybody says, the thing we care about more than anything is money. And the thing we never stand in the way of is somebody and their money. So these massive corporations, we don't mind when they poison us. We don't mind when they poison our food and make it addictive. They don't mind when they make us chronically obese. We don't mind when they give us heart disease, because all these corporations are making a lot of money. There's a reason that they make the most money in America and we're the most sick, because we're the only ones that are like, yeah, just fucking do whatever. We're like but we eat what we want.
When do we own responsibility?
But other countries, they'll ban things like factory farming and they'll ban things like chemicals in drugs. It's the government's job to make
shout out
that
to Trump.
Corporations.
He's putting cane sugar back in Coca-Cola. He says we don't need all that. Shout out to Trump. He's bringing cane sugar to Coca-Cola. He says we don't need the little corn syrup. So hey, there it is.
Oh, please, a guy who's
that was a hell. I would have quit this discussion if I was you too. I would have done that.
I love it. Thank you, Sarah. That's right on time. By the way,
RTP, chronic illnesses can be cured.
Yeah, chronic conditions. No, not all chronic illness. I'm saying there are chronic illnesses that can be cured.
Okay, but he used it for the sake of the argument, but I knew what I was talking about. Go ahead.
All right, I need to say this. I looked this up. The United Nations Universal Declaration of Human Rights, Article 25. Everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, and medical care and necessary social services. And the right to security. Anyways,
I think it's a great point.
Medical care, health care.
Yeah, but this is Donald Trump's America, so fuck NATO, fuck the UN, fuck everybody else.
Yeah, basically, that's where we're at.
I have to say this real quickly. Bad Germany.
But yeah, that's
when I made my distinction, I clearly indicated that I recognize the United States does not, even if they have ratified one of the conventions that establishes this Article 25 as that. We recognize that United States and common law is very, very devolved to how we, outside internationally, we see health as a universal right. So
compared to every other developed country,
ask yourself, why does your country, who brags about Bill of Rights, has not evolved to conceptions like we are doing internationally? Hell, my country ranks higher than yours in healthcare, being the 50th country in expenditure in healthcare. While you're the first, you spend more money in healthcare, yet you're worse than us.
Why do you think that is?
I'm glad y'all protect y'all bodies. You know what we protect over there? We protect our borders. Y'all protect y'all bodies. We help we protect borders, and that's how I feel about it. And I'm not backing
Nice
out.
moving the goalpost. Nice
That
moving the
tweet- that tweet-
goalpost.
Countries-
Irrelevant bullshit.
Dude's just trying
And
out.
countries have the right to secure borders. Like
Protect our borders.
Are you right?
They can have
your,
their
your body and your border are not mutually exclusive. Countries have the right to secure borders, and people have the right to health care. These are not.
But we
mutually
do a better
exclusive.
job at protecting borders, so all these healthy people can get obliterated if it ever came to war. I'm going with the border over the body.
Conversation with RTP. RTP crushed you, and it showed that you did not know what the hell you were talking about. That you opened your mouth to say.
First off,
bullshit. I'm glad that RTP crushed.
Both of y'all talking about. I'm talking about fundamentals. If you're not,
No, you're not. You're not talking about
how much
anything.
healthcare you have.
You're not talking about anything. I know that you got a lot of confidence right now, but that's called liquid courage, my friend. When you watch this back tomorrow, you're gonna be like, "Oh goddamn, I didn't say anything." You got a lot of confidence. You're not saying a lot of smart stuff. I bet you're a smart guy, but right now, too much confidence for what's coming out your mouth.
There was one interesting thing that Jim and I said that I wanted to comment on, which was the claim about cane sugar, because I think my understanding is that all the for however you feel about Donald Trump changing like corn syrup to cane sugar, those two ingredients are chemically very, very similar. They and most evidence, as I understand it, they are digested in the body like almost identically.
Also, he didn't do it.
That's why it's called a replica. It's a replica.
Look, Coke just
that's
doing
why
it
they
and he
make
took
things
credit.
simple.
He's like, I'm
sometimes
just
replicas are better
just
than the
tweeted
original.
out that I did this, and people are like, "Yeah, I guess Trump did this."
Cane sugar pop, okay? Cane sugar pop is better than high fructose corn syrup pop, and I will stand by that. Okay.
Look, as long as he doesn't touch my Coke Zero, I don't give a shit what
pop. Yes, I will also stand by pop. Thank you very much. I will die on those hills.
Just don't drink soda at all, and drink something more natural. That's your choice.
Yeah, I mean, the problem can resolve itself if you just don't participate in drinking of the beverages that have sugar or fructose of anything, quite frankly.
That's true.
Look, sugar is my addiction, okay? So don't judge me.
I don't judge you. I just want
I
you to
like
know that.
alternative
I like you.
You're judging the shit out of him. If he had not...
somebody he liked.
Look, as a personal choice, I have 25 years without drinking one single Coca-Cola. I haven't eaten McDonald's in about 14 years.
Based?
I have not. I've quit mostly all those brandish things. When I go eat, I eat.
You quit what?
All those brandish type of things.
Big brands, he's saying. Yeah.
Okay. This is my personal choice. I decide. I cultivate my own onions, my own chile dulce. I forgot how to say it in English. I tomatoes. I have my parsley, my culantro, my so on. I have
marijuana.
This is the point of all of, but this goes back to the previous argument. You do all these things right. And if we get on a scale, I still weigh less than you. That's what I'm saying. Like all that doesn't matter.
How much you weigh? What is your height and what is your weight right
I love
now?
how confidently you said that.
Bro, what is your age? What is your height? And what is
want to know your sign too, please.
This is not first 48. I can give you one of the three. I'm not giving you all three. Goodness, man. I give you my weight. My weight is 225.
Instead of throwing at mediums towards me, and instead of just diving into,
I gave you a lot of
attack,
compliments, man. I think you're very confident at failing. That's great. Like you need that in life. Like when you do that, you become better.
Look, the
That's how you
advantage of
become
being
better.
confident and being educated is that I myself know what the fuck I'm talking about, versus being confident, drunk, and not knowing what the fuck to talk about.
That's fair.
Two of the things will always be consistent. I'll always be confident and drunk. Everything else is a bonus.
Confident and drunk.
You'll always be confident and drunk.
Thank you for admitting that, Bad Gemini. Confident and drunk.
Wait, Bad
So
Gemini,
let
I
me
have a
just
question
add,
for you.
confident, drunk, and wrong.
Bad Gemini.
And you loud and proud.
Yeah,
so
that's
it
right.
doesn't
Bad Gemini.
bear with me for just a moment. I've got another. I don't know who this person is. A red pill based. Hello.
What, everybody? What?
Yeah, I'm not doing that.
All right. No.
Yeah. Bye.
He made just as many good points as Bad Gemini, though.
At least you can understand mine. Thank you.
Bad Gemini. Bad Gemini. I have a question for you.
Dang, is this a date? What's happening? I'm confused. Carry
Yeah.
on.
Do you know what the Dunning-Kruger effect is?
Go ahead. No, I'm not going to pretend it. Let me
Competent
tell y'all,
drunk-
y'all think I'm a nerd like y'all. Like,
No,
look,
that's not what
I
he's
want-
accusing you of. Just wait for the definition.
I wanted to
No,
be a
hold on.
nerd,
Wait-
but I
wait
was
for the
never
definition.
accepted.
Wait for the
Go ahead.
definition, because I promise he's not calling you that.
The less you know, the more confident you are in your knowledge, and the more you know, the less confident you are in your knowledge.
Well,
Not a
I would
compliment.
say that the first part is true. Unfortunately, the second part is why I can't be in the dating scene, because I'll be taking a lot of old ladies from guys. So, yes, I agree with half of
What?
that. Correct.
Well, that
Did you
sentence was a
listen to me
fucking
at all?
nightmare. That
Just say there's a
sentence was
reason
nightmare.
Trump loves the uneducated. Okay.
Did
Those who understand
did you
doing,
do a
those
show
who don't
tonight, Bad Gemini, with Mr. Life?
know. Did I do what?
Did you do a show with Mr. Life tonight?
I did. So I'm on my drink early because I needed to be to deal with a person like you as well. I like how your hair is pressed out. It's very nice today, but you're very stiff, to be honest. You're not your natural you. You're all cosmetic and done differently. I like you about a year and a half ago, but shout out to Sarah the Raging Tomato.
Get it together, Sarah.
Ay, Satanás, dame paciencia con este coño de
I need to
madre.
see flaws, is all I'm
Don't-
saying. I hate that I don't see
brilliant.
any flaws in her. Yeah, your flaws are gone. That does you're not
I have a
relatable
pimple
anymore.
here. That's a flaw, right? I got a little pimple.
I have the same
Yes.
issue. Being flawless. I have the same
Right,
problem.
I was going to say the same thing, yeah.
Except the
Very
person
flawed,
who your
unfortunately.
designer needs to be flawless. Whoever
I'm on the
told you
other
to put on
side
that
of the
tank top
Dunning-Kruger
doesn't
effect.
like
I'm
you.
very flawed.
Whatever. I think it's a cute tank top, but whatever.
I think you look. I think you look lovely.
I
Ryan.
honestly,
Thank you,
Ryan, when you jump backstage, I thought you were shirtless. And I was
Yeah,
like,
I could
ooh,
probably
I
get
was-
a more contrasting color.
I
to
was
my
like,
skin
we
tone,
had
for
we
sure.
had the guys take their shirts off panel like a few weeks ago. Were you here for that one?
I was going to say you've shown the second most amount.
His
of skin
tank top
today.
is like that layer that's on the chicken, that little skin. You just gotta clean it off the little chicken breast. Yeah,
Saying
I
you want
know
to peel
that.
off my tank top?
Oh,
If that's what you're
no.
thinking about, we need to find you a new audience. But shout out to Ryan.
Well,
Definitely.
Evan Lord says, Sarah, you are one rotten tomato. Jokingly.
Evan.
This show has ruined my sleep schedule. A quick question for the panel. Why not remove forced insurance? And by the way, my sleep schedule has not even, I don't sleep. I haven't slept in a year. So fuck off, Evan. You'll be fine. And so to the panel, why not remove forced insurance?
I
thought we
don't
did.
know
I
what
thought
that
Trump
is.
did.
I don't know what that is. I mean, if he's saying
It's when the government tells you have to buy insurance to subsidize everybody else,
Yeah,
and
and
that
Trump
you're
removed that
beholden
from
to
the
that
ACA,
economic
which
insurance.
was a
What-
major
what I
funding
would
source
say-
of the ACA.
But
I
that
would
was
say
is
he's
that-
not trying to do that. That's
Obama.
what I want to happen. I want to
Look,
do forced
it
insurance.
is enforced
Right,
when
because RTP
everybody.
doesn't believe in
I
economics.
see.
Crash
Let's
the whole
look at it.
system. That way, no one can use it. I'm
Okay,
sorry.
well,
Go
we
ahead.
had
you
that
have-
for a while, and it didn't crash. So
Hold
I
on.
don't know why you're saying
If
that.
you have the taxpayer like pay for healthcare, then you don't have to worry about forcing insurance.
No, you guys
So-
are missing the whole economics on it. Ditso actually really touched on this a bit when he said we spend a lot on healthcare, but we actually don't get a lot out of it. The wrong takeaway was that because we're putting money into it, not getting out of it, it means we need to put more money into it. That's what RTP and other liberals will think.
Actually,
Fact of the
mine
matter is
less
Medicare.
expensive.
If I may. So Medicare is
Well, but I
going
didn't
bust,
say
partially
that,
because
right?
we've got Medicare Advantage plans where what's happened is instead of the government self-insuring, mind you, if a private health insurance company has a private company has 500 or more employees, what they'll do is they'll self-insure. The government on Medicare with more than 40 million insureds is paying private insurance companies full rates to do fully insured. They're not doing it the way that would be economically efficient. A 500 employee company would. Why are we doing that with 40 million? RTP, love to hear your thoughts.
I actually already laid out the economics of this. I spent about an hour talking to Sarah about it. And when you do the economics and you check the CBO study, this would be less expensive than what we currently pay. And all 60 million Americans who currently don't have insurance would have insurance. And you would have no copays, no deductibles. And by the way, all these other countries that do it the way that I'm I'm saying have better outcomes than us. We pay a lot of money in America because we let a lot of people make a lot of money off of our health. We commoditized our health, and the other countries don't do that. They don't allow the human beings to be commodities that they sell to big pharma and to health insurance companies. So if you want to look at the economic analysis, like I can send my outline to Sarah, you can go through it. But there have been multiple people who have scored this, and at best, it's a wash. But
So you're missing the fact. For 10 years, I was an insurance agent.
But with a
I
wash,
drove in. I worked for
but with
insurance
a
companies
wash.
doing the economics
Yeah,
on these
and
all
I
these
want
economics.
and
When
I
you
want
look
to-
at the
I
actual
want to
expenses
eliminate
associated with
all of
delivering the
that.
healthcare.
Yeah,
What's
I
that,
want
Glenn?
to eliminate the business that you were in because you guys are fucking shitty at it. You guys don't know what the fuck you're doing. So
There's
the
a
fact that you work
classic
for the fact
grid
that you work
building
for an
that the
insurance
liberals are so
company
good with.
when I am trying to get rid of insurance companies, it's exactly for that reason.
Insurance companies aren't even the problem. Not really. Who was it that
you
was
should
hanging
just
out
go
with
back
the
and watch
Obama
it.
ahead of the ACA getting passed? It was the pharma companies, right? When we pushed for all of that. What was Daddy Trump doing recently? Telling Americans they shouldn't have to pay the same
brother,
inflated
you don't know
rates
my
for pharmaceuticals.
You're
What's that?
arguing straw man right now. I was here, and you should just go back and watch what I said. Everything you're saying right now, I've already covered, and I don't advocate for. You're coming in here hot. You have no fucking clue what I actually came here to debate or what I'm asking for. You are arguing literal, just like straw men that you've heard before. Instead of coming in hot and start instructing, why don't you ask what I want to do? Because everything you said, I've already covered tonight.
Just real quick
So,
to build on that. Hang on, just real quick. Like, would you acknowledge? I can't see your name. The guy who just joined.
Josh.
Like, would you acknowledge that, like, what you just said, like, when you came in about like liberals wanting to just throw more money at it, like, based on what he's describing and what I agree with regarding that, like, that's absolutely not our position. Like, that's not like generally the liberal position with regards to this policy is not throw more money at it. What we're saying is that there is a policy prescription that actually saves money. So it's literally not that. Do you acknowledge that?
So to stick with what you're saying there, just real quick, the general policy prescriber, maybe RTP and you have different takes on it. The general policy prescription is we need to fund Medicaid. We need to fund these programs. We need to throw more money at health insurance companies. What that does is it pads the medical industry because all of the way that they get funded is downriver from insurance. So the more money that goes into funding insurance companies goes downriver to funding a lot of times care that's either not necessary or poorly managed. And so we're not looking at a comprehensive healthcare model. This is why I bring up the self-insured
I'm eliminating healthcare. I'm eliminating. Hold on, please. I'm eliminating health insurance companies. That's why I'm saying, like, you're arguing a straw man. What my position is that the government should be the insurance company. They should pay the bill. There's no reason I need to pay insurance companies all of this money just to pay my bill. It's a scam. It doesn't need to exist, and every other country has figured that out.
So real quick question, yes or no? Do you know what Medicare Advantage plan is?
That would go away.
Yes or no? Do you know what a Medicare Advantage plan is?
Yes, I already covered this, and that would go away under Medicare for all.
So why is the government not self-funding claims right now? If it's such a great idea, why are they not doing it right now?
Because we would have to vote it in. It would have to pass, and people are afraid of the word social. Oh, you don't think we would have to vote in Medicare for all?
Currently, Center for Medicare and Medicaid Services manages Medicaid, manages the Medicare program across the board.
Brother, you don't.
So when you're talking about the funding, what's happening is we've got major health insurance companies getting subsidies to do fully insured health care, not paying out the claims like you're talking about. You're talking about a third-party administrator program.
No, I'm not.
No.
Josh, I've been trying to explain to you what I'm talking about.
Okay, explain to me what you're trying to think.
What I'm talking about. I am talking about government-funded health insurance. All of these things that you're mentioning, those programs cease to exist.
Right. All that why Medicare Advantage came into existence.
It will no longer exist because Medicare Advantage.
I believe that, but why did it come into existence?
It's not relevant. It's not. No, you just don't want to have this discussion.
Josh,
what you're talking. Please, Ditzo, no. What you're talking about.
No, he has a point. I'm going to listen
part of my
intensely.
I'm on your side, RTP.
I know you're not. You also want universal health care, but I promise that I'm better equipped to explain Medicare for all. It gets rid of insurance companies entirely. So
there were all of the Advantage companies before Medicare Advantage.
I know,
just private government.
I know,
like you're saying.
I know, and that will go away because there's no private insurance.
Right, but there wasn't private insurance before that. Medicare was.
I didn't agree. I didn't agree. I didn't agree with the I didn't agree with that expansion. We should have done Medicare for all.
So should we have had Medicare? So should Medicare have been the one writing the checks to providers?
No.
No. Then who?
No. There should
If it's
be
not
no,
if it's not
wait,
contractors,
hold on. Listen, brother.
and it's not the government,
brother,
who?
There are no providers under my plan. There is no, Medicare can't write a check to a provider because providers don't exist because we get rid of them.
Okay, that's a new healthcare plan. No providers.
It's called it's Bernie Sanders Medicare for All. He's been touting this for years. Go read it.
And Amy Lynn jumps in to say, only because the insurance companies pushed for the supplements. I didn't take the supplement because I know it's a scam. Thank you, Amy.
What supplement?
Well, she said here before this, why is it cheaper in other countries?
She's talking about the government subsidizing insurance is what she's talking about. So they're subsidizing private industry rather than just like paying the bill. We don't want them to subsidize private industry. We want them to just pay the bill.
Mm-hmm.
Hold on. Yep. When we're talking about government paying the bill, in my case, I contribute 9.84% of my monthly salary. Okay. So this means a person with minimum salary will contribute 9.84. Somebody with $12,000 or $10,000 will contribute 9.84. Everybody contributes 9.84 across the table. The employer contributes 26.6%.
But my plan's way different than that. So that's why I was asking you to let me explain it. My numbers are very different than Costa Rica's. Yeah.
So in this sense, for example, in Costa Rica has almost 6 million people living here. Our labor force is 2.3 million, out of which disemployment is about 7.3, 7.5. Okay? So all of us contribute to that fund.
Brother, everybody knows this. All due respect, like you've already said this, and everybody knows this.
I know. What I'm asking to Judge or to anybody opposed is, why is this insistent of thinking government paying is something foreign to the actions of every citizen? At the end, everybody is dropping into the fund. And what best investment can you do if not for your health and the health of your children and the health of everybody around your country? That's the bottom line.
You bring up a great question, and I'm going to touch on something for you here that I think is going to illuminate at least where I come at on it. As soon as you give the government a bucket of money, it becomes about who can carve out money from that bucket, not making good on the mission for the money. That might be a presupposition I have, others may not. This is where I think a lot of times liberals have a lot more faith in government. Shouldn't the government X, Y, and Z? But if historically, when we put a bunch of money behind programs, it doesn't actually end up going out to help the problems that we're trying to solve, you might see why that would cause some concern.
Have a strong judicial system and a strong investigative system that will chase corruption of the public sector, and that will chase in that sense.
We've already covered this though. They're actually already more efficient. Like the government does spend money on the VA
motorsports,
and
you got 20 minutes in the back, so I'll set a timer. Go ahead, RTP.
Like we already have a comparison of private and public, and the public they're more fiscally responsible with their money. 80% of the money that you send in goes to pay the bills. It's almost completely reversed in private sector. All of these things exist in the private sector too, but they're worse, and there's no recourse for you, because what are you going to do? Call customer service and whine? There's nothing you can do. They're just gonna keep paying politicians to make it easy for them to fuck you over. They're already more efficient at it.
RTP, I've got a very specific issue I want to ask you a question on. Can we stay focused on one specific issue, my friend?
Yeah.
Okay. Dialysis. I bring up dialysis. My mother recently had a liver transplant. In the process, her kidneys crashed. She gets dialysis 3 times a week. This is a very common thing. It's a very expensive procedure. It takes a lot of time. A lot of money goes into it. My question to you here is, do you think a problem with our healthcare system might be that we've got legacy treatments that are enormously expensive, and they're standing in the way of better solutions perhaps than the current expensive dialysis machinery?
I think
because we have an entire dialysis industry that's based off of getting paid a certain amount from certain providers, and this is how these dialysis centers make a ton of cash. Do you think that's a problem? Not a problem? Thoughts?
I don't know specifically that about dialysis. I'll take your word. Like, I understand what you're saying. If that's a problem, which it probably is, our best option is to collectively bargain, put all of our bargaining power together, and negotiate against the pharmaceutical industry in general. And the best way that we can do that with the most force is by doing universal health care, because that puts all 330 Americans on the exact same program, and then our collective bargaining strength is much greater. And we have people that actually, at the very least, are supposed to listen to us, that we elect. And we're not trying to chase some CEO, some call center, and try and track them down and get them to care that they denied our coverage.
We already have too much regulatory capture in the DEA, right? And that just set up.
But that doesn't have anything. This is just insurance, so this has nothing to do with the DEA.
Right, but regulatory capture in the industry. Is that better?
Yes, thank you.
But this is just insurance. I'm not talking about the medical industry. I'm just talking about insurance.
If there's one entity responsible for negotiating on behalf of us, then that centralization opens the door for cross contamination between the private and the public sector.
What do you mean? How would you cross contaminate? There would be no public. There would be no private sector anymore. They would disappear.
I'm sorry, the medical industry and the payer, right?
There already is that with the insurance companies now, except for there's no direct representation. So you already have that problem by having health insurance. The only difference is they're motivated to maximize profit, where the government wouldn't necessarily be motivated to maximize profit and cut costs everywhere. So you already have that problem.
If it was motivated by profit, it would be more efficient. I think
it's not more efficient, because right now private healthcare is less efficient than government-run healthcare, and private healthcare. So if you look at the way that they spend money in government healthcare, about 80% of the money that comes in actually goes to take care of care. It's reversed in private healthcare. About 20% of the money, when all is said and done, winds up paying for healthcare. They're wildly inefficient, and of course they would be inefficient, because they have to pay salaries, they have to pay bonuses, they have to pay off investors.
So do government
people. No, the government doesn't pay.
Government doesn't pay their employees.
No, I said they don't pay bonuses. They don't pay a CEO $50 million. No, they don't. They for Medicare, Medicare bonuses.
You're wrong.
What Medicare bonuses? What bonuses do they pay out for Medicare?
Look, I'm telling you that staff in government-provided hospitals get bonuses. They get performance.
Those are hospitals.
Bonuses.
Those are hospitals. That's not the government.
Well, you're talking
That's the
about
government
healthcare.
paying them.
So so you're talking about just strictly the administration? You've lost me here. What
I know
are
I
you
did.
talking
I'm
about?
what are
you talking about?
I'm talking about the administration. Okay, here's how it clears.
You said 80% of the money goes to healthcare.
Correct.
If 80% of the money goes to healthcare, that's 80% to the fucking doctors. Doctors get bonuses, you quack. So please explain to me how that suddenly there are no fucking bonuses.
Okay. Well, here's the problem that you have. I'm talking about.
I have a lot of problems, but
one of them is that you're stupid, I think. The problem that we have here is I'm talking about health insurance. The government has a health insurance program called Medicare, and the private health insurance is private health insurance. So I'm comparing the use of money, and when you give money to the government that is set aside for healthcare, 80% of that money goes to the healthcare and 20% goes to administrative costs. Be quiet. Be quiet. You're almost. You gotta be quiet. This is why we're lost.
You're both going to be quiet for a moment. For just a moment, I'm going to interrupt only because Almighty Nate, the Almighty, sent in the 200 for the doggo. Yes, Nyx has to have a surgery on her knee. She blew it out. She kind of tripped on her way down the stairs, and it went all sorts of different directions. So surgery, we have another appointment coming up actually next week to hopefully get all of that situated. And once that knee is fixed, then I've been told that they get right back into the running and everything's fine. So
Until they blow the next knee, you should throw it away and get a new dog.
They actually said if she doesn't get surgery, then more than likely the other side's gonna go. But we're gonna get this all done and taken care of. And the arthritis builds up really bad from the scar tissue. Anyway, sorry, not to tangent. And while I interrupt, Tyler says with the big 5, R2P isn't emotional like a woman. Thanks, Andrew, for exposing that. Let's give Grid the floor. He's the OG. How much to boot the dirty lib? You cannot boot RTP. He is our featured guest of the evening. That's why I like to hand out featured guest positions like Ryan. He gets that as well because I know you guys like to pay to boot them. So I give them special treatment. I'm going to leave.
Speaking
this
of
one-
which, oh
Go
yeah.
ahead.
I was going to say,
leave
speaking of
this
which,
one.
if you want to boot a dirty lib, I'm right here. You can donate money to kick me off the panel, and you don't have to deal with my handsome face interrupting the flow.
It
Can I just
It
finish
is in fact.
that- Can I just
How'd you
please
know?
finish the
Art-
second part of that so we can
Art-
finish this
RTP.
comparison? No, I need to finish the rest of this
Hold
comparison.
on. I want to
so
give
we
it
get on
back to
the same page.
RTP. And
Thank
I
you.
think it
I
was
have a really
further.
quick question.
Oh, can it wait?
Well, hold on. Let RTP finish.
So on one side, you have the money going into the insurance, which in one case is the Medicaid. On the other case, it's private insurance. When you give money to Medicaid, more of it goes to care. When you give it to private insurance, a smaller percentage actually goes to care. So it's a more efficient model. More of the money that you pay in goes to care in government-run programs.
Okay, yes, I understand English. I heard you say that. I'm asking you to specifically break down when you say the money goes to healthcare, what that means.
So it's a health insurance. It's health insurance, right? Medicaid. So when you go to a doctor and a doctor bills Medicare, they send money to the doctor that pays for your medical care.
Who determines how much the doctor is allowed to charge?
They have negotiating rules. Medicare does with the doctors.
Are you sure?
Yes.
Okay.
Yeah.
So why is it? So why is it that I pay
conversation.
less when I go and pay cash for something? I pay less than if I were to, go through say Medicare or
Because they incur less administrative costs.
no. Looky there, private industry wins again.
What? They both have administrative
If
costs.
I go
What
and
the fuck,
pay,
bro? Hold on. What the fuck?
if I go pay for my health
Gotta be a
care,
crucible guy.
I do not use. If I
Were you just doing the?
Yeah,
is that
but
what
most
you-
people can't do that, Grid. Most people can't do what you're talking about.
This
I
is
know many
why
people that
the
pay
U.S.
cash
doesn't
for
have
healthcare.
universal health care
Sure.
because nobody in your country understands this shit.
It's crazy. Dude, I don't know how you just said they win again. Both of them have administrative costs. Both private and public healthcare have administrative costs. One of them uses 20% of your money. Wait, hold on. Wait for the end of it. Wait for the end of it. Wait for the end of it.
You're dodging the question.
Wait for the end of it.
Dodging the question.
Let RTP finish, and then we can kick it back to you, Grid.
If you give me $100 to do a job, and I do one of the jobs 20% of the way complete, and one of the jobs 80% complete, one of those is obviously a little bit better, right? It's a better use of your money. You got more
I
bang
enjoy
for your
straw
buck.
mans as much as anybody else.
So in
but
Medicare,
this is
8 out
the
of your
actual
$10
question, sir.
goes to pay for the
I
health care.
want to save time and have you answer the actual question. Why is it, sir, that when I go pay cash at the doctor, or I set up a payment plan where I pay cash, why is it cheaper for me to do that than when the insurance pays? And Medicare is by default
less
insurance.
Because there is less administrative work because they don't have to bill your insurance or bill Medicare and negotiate.
So it's cheaper, correct?
Yes, so it's cheaper.
Okay. So Medicare is a more expensive option than
private insurance. It's not more. Private insurance charges on average 40% more.
Yeah, technically with
Medicare negotiates better prices.
Yeah.
Do you want to apologize now? Because that fucked up your whole argument, didn't it?
I don't believe in insurance.
Be sorry and mean it, Grid.
Oh, you just don't. You argued it, and then when you were wrong, you're like, no, I don't believe in it.
I didn't
anyways.
argue for insurance. You're incapable of
No,
understanding.
you
my
said I
argument.
was wrong about which one was better, and you just had to. You just. It's clear
No, I didn't.
that one of them is more efficient.
I
and
asked
now
you
you're
specific.
Like, I don't
I asked
believe
you a
in
very
it.
specific question. You made assumptions. You shouldn't do that.
No, I answered your question both times.
No,
I
you
gave you
didn't.
the same answer twice. I said because of administrative costs both times, and the first time you said then I win, and then you asked it again,
because
and then the
I don't
second
have
time
to
you
pay for
conceded.
insurance. I don't have
but he
to
knows
pay
what
for
he's
all of
talking
that
about.
shit.
Yeah, because of administrative costs. It's
You
not
said-
that's not an argument to not replace private insurance with public insurance.
You said the private market wins because cash.
Yeah, that was stupid. That's why we're laughing. That was a dumb thing to say.
To Steelman, I
So
feel like what
you-
Grid's saying, and maybe
so
I'm
you have-
hang on real quick. I want to try to build a bridge here because maybe I'm misunderstanding because I think
No, I
Grid's
want to
making
burn
an
that bridge down.
Wait,
please.
well, you can burn it when I'm done. When I'm done fucking building it. Okay, so I feel like what Grid's saying is that he can dodge the whole insurance, all the administrative issues of insurance completely by just paying cash, right? Is that what you're saying, Grid? Am I understanding that correctly?
I'm sorry, I was reading the super chat. I apologize.
Are you saying that you can
Brian.
dodge all the issues with administrative costs of insurance by just paying cash straight up?
Yeah,
like,
yeah,
without going through insurance at all?
I can work with my doctor to pay cash, and I will actually pay less overall.
Is that what you were responding to, RTP? Because it felt like you were saying that, like, you were intuiting that Grid was saying that he could go through private insurance and just pay cash. But I think he's saying that he wouldn't even have to use insurance. Although, I think
I
most
understood
people
that.
can't
What I
do
was saying
that,
is
right?
there's the cheapest option, which is paying cash, which is not a reality that most Americans can afford, but it is the cheapest option. The next cheapest option is public-run healthcare, and the worst option, the most expensive and least efficient option, is private healthcare. And I'm arguing we should replace private healthcare. Yeah, insurance. Sorry, private insurance with public insurance. That's my argument. That's a better option.
Let me do a couple super chats and then you can chime in. Carney's Ryan says, good evening, Sarah and everyone. Reality is hard, says Medicare doesn't pay crap. You'll never find a provider who only accepts Medicare, but you'll find plenty who opt out. But I think that that's the goal, is to make it kind of
you can't opt out. It's the only option for you.
Right. But then they could opt in or out of the private supplementary insurance, correct?
Or they could go cash pay. Yeah.
Yeah. And Amy Lynn says, Andrew and his audience are so emotional. They're here crying about RTP. What is the definition of emotional, Andrew Clan?
No. Let's not start that.
Let's talk about definitions, RTP.
Let's do it.
Define.
Arthur Dye is a doctor, by the way.
I love Arthur Dye. If she wants to join, we can always get paid to boot somebody. She says,
I'm going to go to bed in a minute, so she's welcome to come up and take my place.
Come to bed with you?
Running away. Grid's running away.
Which system is going broke?
I've been online a lot today.
Which system is going broke by 2036? Not private. Now, wouldn't essentially, if we all did start paying that extra percentage into Medicare, you were saying that would?
Well, there's two things to correct here. Number one, the system's not going broke. That's the trust. So we have there's Medicare, and then there's the Medicare trust, and the trust has been rated. And if we don't raise the cap, then the Medicare trust will go. But that still leaves people with like 80% of their benefits going forward. That's totally funded. So it's not going broke, but it could lose some benefits. But again, this would all be gone basically. Medicare would be the only insurance option for everybody, unless you wanted to do like the supplemental insurance.
Okay.
And also,
which would still keep the private market alive.
What?
And then hold on, one more and last one, I promise, and then I'll hand it back to you, Josh.
To respond to that other super chat. Okay.
Oh, you can come into it in a minute. And then HHS did a study on the impact of the ACA and found it increased rates 3 to 4 times and decreased access. Kathleen Sebelius hid the result for almost 2 weeks to prevent Congress from seeing it before the vote.
Yeah, that's government subsidized healthcare, which I think is a mistake.
No, you're full of shit,
Obviously,
dude. That's
was
the
a mistake.
ACA bill that they got passed. They did a study on it ahead of it. You saw people who could afford $200 a month health insurance watch it go to $600 and $800 a month.
I'm
and
agreeing
if
with you.
Buy it, then they pay the government a fucking tax.
Brother, I'm agreeing with you. Listen to what I said again.
Thank God you
I
came
said
to the right side.
The ACA. No, I don't like the ACA. That's not universal health care. It's government subsidized private health care. It doesn't work. Obviously, we see what happens. They just keep raising their price, and then the government subsidizes it. It costs us a fortune, and it's not that successful. I think the ACA was a failure. That's why I want Medicare for all.
And Rude Mudcrab says, Grid can't quit. He's fired. That's a boot, Grid.
That's fine.
Do you accept the boot?
Have Arthur Dye come up. I'm going to go to bed. I was going to raid you, Flow State, but you quit early, you fucker.
I started early.
Quitters. Oh, yeah, he was on like way early tonight.
I've been on since like 1 o'clock today. I'm going to bed.
Good night,
Have a good night, Chris.
Grid. Have
Good
a
night.
good night.
Oh, and be nice to Kel, Sarah.
Kel. Oh, my cutie Kel. Yes. Yes. I like her.
My
That's
cutie
great.
Kel, she said predatorially.
Yes. All the ladies are mine. I
I'm
take
getting
them
out of
all.
here. You guys go do stuff.
All right. And then Kay, you said you wanted to respond to, was it this one?
What system went broke in 2008?
That's a good question.
Fair question.
It was not public. I'll
That's
give you
fair.
that hint.
I think, Sarah, when we talked about this earlier, like this is one of the problems that we have is that we are heavily indoctrinated to be very afraid of of universal health care. And I think we see that every time we talk about healthcare is that a lot of the stuff that we believe is stuff that we've heard. And a lot of the stuff we've heard just isn't true. There's a reason that no other country tries to copy our system. If it was good, other people would copy it. Nobody's doing it. Everybody's doing the exact
And people try to swim across the ocean to get here.
but not for our health insurance.
Well,
For our free health insurance.
I mean,
Really?
are you sure?
Well, you're gonna go
Yeah,
on
I'm sure.
RTP?
You're
I'm
sure?
sure.
RTP.
Yeah, I'm
It won't.
Yeah, I'm sure people aren't swimming. Like most of these places they're coming from have health insurance. Like they don't pay for health insurance.
Cuban?
Most
You
of
think
them
you think they
pay
were
for
happy with
it.
their Cuban health insurance? They just swam
No,
across.
but they're no, but when they get here and find out they can't afford health insurance here either, they won't be very happy.
Yeah, I don't think usually the reason they're leaving is like health insurance based specifically. It's other. There's a lot of other
There's, like-
economic factors.
I don't either, but
this
my
is what
point
I'm
that it's
talking
sort of
about. We're
it's sort of a
indoctrinated
silly
to
thing
just
say that it's not because of this. They're not coming here because of that. Well, there's a variety
No,
of
I
reasons.
said they're not copying it. Other countries, if there's stuff that America does that they'll copy because they'll be like, oh, America's doing something smart. Let's copy them. Nobody is copying our health insurance system. It's terrible. Everybody thinks we get made fun. Like it's when you travel, like people make fun of you. They're like, it's fucking crazy that if you don't
I
have
could
insurance,
not
your
care
doctor
less.
just says.
I couldn't care
"Okay."
less what they think about it.
I know you don't care, but they
You
make fun of
should.
it because it's.
Why would I? Why are you kidding?
No, they make fun of it because it sucks, though. That's pretty good evidence that nobody else is doing it our way, right? You'd have to admit that's pretty good evidence.
I mean, we could copy Canada and encourage more people to have assisted self-deletion.
Yeah, but I don't want to.
Oh my God, you don't.
RTP,
Look.
we found more common
gosh,
ground.
they can work
Yeah.
up again.
Canada's
You can
system's not
copy
good either.
Canada's system and just not include that.
Bingo.
That's an option.
But why would I want to copy a system that doesn't give me, the consumer, the decision in what I spend my money on?
It does.
It does.
No, it doesn't.
So why doesn't it? You have to pay.
Yeah.
You actually spend less money.
Unless you're saying like, are you
Because
saying all
You
taxes?
spend less money.
So who's paying for it?
Wait, hold on, real quick. Just do you think all taxes is theft?
I think that realistically, probably some tax is necessary. Technically, yes, all tax is theft.
Okay, well, if that's your belief, then yeah, you're gonna not agree to any of this. But I don't believe taxes.
Well, why
are
don't
theft.
we just have the
So
government
I
take
think
all of our money and provide everything for us?
Well, they do that because there's some things that the government can provide for us more efficiently than the private market.
But
and
I
there are
want them
some
to do
things-
everything. I want to be in a child my whole life.
Excuse me. You asked my question. Can I answer? There are some things the government does well, and there are some things the government doesn't do well. And the things that the government does better than private industry, the government should do, like having a military. That's better that our government does that. Like a library, because nobody's going to fund that. But paying our bills, like just writing a check every month to our doctor, is something the government is capable of. And because I know that there's not all these extra revenues going out the window for advertising, CEO pay, big buildings, private jets, I know that money is going to be used more efficiently, because I know the one thing the government can do is write checks. They're really good at writing checks.
Well, the military, though, we still have private militia, don't we?
Yeah, but our military is far more efficient than them. I'm not saying we don't have it, but what if you want to take private militia or our military? You're probably gonna take our military.
I mean, those Blackwater guys will fuck you up.
I don't know.
Well, private militia is
They're
former
trying to get hard
military
for
in
it,
most
by the way.
instances.
Yeah, most
irony.
of them are, but but they get out and then they go private and then they're contracted in.
But would you rather have a private military protecting our country, or a military that is sworn and they're like they're there, they get paid what they get paid, they're not out there like fighting for a bonus, they're not out there trying to save dollars? Do you want your
Fighting for a
military
bonus is
thinking
not a bad
about
thing.
dollars, or do you want your military thinking about like just fighting
Also,
for the person next to him. Probably you
government
are
employees get bonuses. I dropped a link.
The
back.
American military.
No, I didn't
any
say
day,
government people don't get bonuses. I was comparing the bonuses when it came to like the CEOs and the bonuses for investors, like paying out dividends.
None
Those
of this
things
stuff
get
is
those
bad.
things get. I know, but they get eliminated when the government pays your bill, so you're paying less. It makes you, the consumer, pay less.
That's also why the quality is worse. Nobody has an incentive to perform.
Unfortunately, that doesn't back up because we are the most expensive and we have worse outcomes than all these places with universal health care.
Why do you think
and
that
if
is,
you compare,
RTP?
and
Why
if
do
you
you think
compare,
that is?
hold on real quick. And if you compare in America outcomes and satisfaction, and you compare Medicare versus private insurance, Medicare has better outcomes and better satisfaction. Literally the worst possible
Well, it's
way
free.
to insurance. Yes,
Right?
but
It's
it has
pretty
better
hard to be. It's pretty hard to be
better
upset with something
outcomes,
that's
though, too.
free.
Outcomes too, though. So even cheaper, it has better outcomes.
Well,
I'm trying really hard not to
RTP.
cite your sources,
Wait.
guy, but I can't find a source for your administrative claim.
Wait,
What
for
administrative claim?
RTP, let me say this real quick, though.
20% versus 80%. When I first got here, you said that 20% goes to administrative issues with
Medicare. Yeah,
Mhm.
I can find it.
Well,
This is my question. Let me ask this question real quick from a funding perspective. From a funding perspective, I just want to know this because me as an American citizen, I can elect and have my private insurance that I pay for through whatever company I work for. But how many countries are set up where an individual is paying for their own private insurance, but the tax dollars they're paying is paying for the public insurance as well? So when I look at it,
what'd you say?
Yeah,
Sorry, I
so
didn't hear that again.
I'm paying for my private insurance through my company, but my tax dollars are paying for public insurance that I'm not participating in.
Yeah,
How
that's
many
why we'll.
countries
That's
are
why we
set
get
up like that?
That's why it's called
None.
supplementary.
None.
No,
Just us. We're the only one doing that.
So should it be an all or nothing then? Because if my tax dollars are contributing to this whole universal that I'm not partaking of, should I just be selfish and say, you know what, I'm going all privatize and I don't care about that?
That's the same as private school versus public. We all pay the taxes to pay for the public schools, but if we choose to put our children in private school, we pay the extra dime on top of it.
Yep.
Yeah, but nowhere
so
else, no
As you
other
should.
country is set up like
Wait.
that is my whole point.
No, every
wait,
other
wait,
country
wait.
they'll have like
Can I-
supplementary insurance sometimes.
Can I
Wait,
please
can I jump in? Because I've been
answer
trying to
that?
jump in here. Wait, can I jump
No,
in?
but I can answer that because like this is literally he's describing Canada right now.
Okay, go ahead, and then I'll ask.
In Canada, right? You can choose to pay for a private health insurance, or you can get it through your job or company or whatever, right? The point of this is not like completely replacing the public taxpayer funded healthcare. Even if you get that insurance, you can still go into a hospital and make use of their services for free completely because of the public healthcare.
Yeah.
The private healthcare is an option is an option that you can opt into if you want to. If you want to get like very highly specialized something or other, or if you want less wait times, stuff like that. But just because you've decided to pay for a private insurance package does not mean that you are not participating in the public healthcare. You still are, and your tax money goes to it, and you absolutely can and should make use of it whenever you have the chance.
I'd rather have free internet.
I would rather have
not
free
both.
healthcare.
So,
well, I mean, you look like you might need it more than me, so I want free internet. And
like, okay,
so why should you get your free thing and me not get my free thing?
because the internet is not a human right and healthcare is.
But it should be. They both should be.
Well, we
Internet-
talked about the human right thing. It's like right.
It's a healthcare.
Right to
It's a
access,
human
right?
right.
Somebody even clarified that, or that you have the right to access but it's still like you don't have. I don't think it's a right.
So how? Yeah,
But
how
it
do you-
is.
but
I
every
think
right
it's an
now is
overall.
explicit.
I think it is an overall societal good if we
It's an
have
explicit human right under the UN.
Yes,
Yeah,
that's
that's-
why
United States
that's
just doesn't
great.
recognize
the
it. Go ahead, Horn,
the
I'm sorry.
reason is you could access the medical care even if like you go to an emergency room, you have something wrong with you, they're not going to turn you down. You have access to it. We're not violating human rights that way. It's just all the debt that is accrued from all that would be the arguments that RTV is making at the moment. And like I guess that's the part that a lot of people fixate on. Like for me, like I've been trying to ask this question is like the incentive situation is what kind of always steers me away from universal healthcare, because when we take the incentive away from like these companies who are making large margins, don't get me wrong, I feel like they're pocketing a lot of the money, but the incentive they have to fucking outperform every other country is high. And when we look at like our science and technology, we are like outpacing like even the top contenders in the world.
You're mixing up big pharma and medical innovation with health
Well,
insurance.
there's
no
going to be
innovation. There's
Well,
no
there's gonna
innovation in health. Hold on, real quick. There's no innovation in health insurance companies. They're not pumping a bunch of money into R&D. So none of this would actually change the incentive for American pharmaceuticals and American innovation. None of this would change any of that incentive.
You would admit that Medicare negotiates for lower prices, which would drop the profit margins for them. Right.
It would drop it. So yeah, the study that I cited at the beginning of this, according to the CBO study, is on average doctors and hospitals are going to make more money, but they will see less catastrophic care. And like their per visit number, like what they're making per visit may go down, but it's going to increase the amount of people that go and see a doctor and do things.
I'm talking about
preventative
medications
care.
and stuff like that, right? We're going to see if Medicare, like we can see like how Medicare Medicaid or Medicare is capping insulin at $36. I forget which one of the two works, but it's capped insulin. That could be detrimental to a company, but it also it's like the incentivization kind of gets taken away when you have a cap like that.
But so let's
by a
let's say
national.
Let's say that I'm selling a boat and you want to buy my boat.
Yeah,
you're going to negotiate the lowest price possible, right?
For sure.
I'm going to negotiate the lowest price I'm willing to take, right?
Yeah.
Okay, so when we are all negotiating as one, because we're all on the same plan with Medicare, don't we want our government to negotiate a good price for us with the pharmaceutical companies?
For sure.
This sounds like free market capitalism to me.
I would say for sure, but there's
how do we know that boat's not gonna come without an engine and a
without
steering wheel
without cheap materials in it, right? For sure, that's what I'm trying to get at.
And that's how you negotiate, and you do your due diligence. We
And
still
the
have
seller-
oversight.
The seller is citizens in this example as well.
Yes, but the government is negotiating on behalf of us, trying to get the lowest price possible for our healthcare.
Right.
Why would you advocate that our government does not try and get us lower prices?
Because the other side of that is the ownership is a citizen as well, right? So if I own shares of this company, I don't want the government arguing against my shares.
So we should focus on the tiny majority of people that have ownership in that company.
You think it's a tiny majority of people who own shares? You don't have you don't think everyone has a 401k and IRA?
No, I would think what percentage of people do you think are going to be so negatively affected by the stock price dropping that they wouldn't want lower prices for healthcare?
Well, okay, wait.
You're talking about.
Let me answer this, because when you have lower net profits, you have less investors actually willing to partake. When you have less investors, those companies lose money. When you have less money, they have to close down certain facilities to
Why
maintain.
do they lose money if they have less investors?
Because it shrinks the industry.
Why do they have less money though?
Because when you have them negotiating for lower prices on your behalf, which is good for you, it's not good for them.
Right, but why does less?
They're not getting
less money.
They're not getting the money that they were getting before, which is showing high investment qualities. Why people invest into these big pharma companies is because they have they have high margins.
Hey, Sarah, I have your whole panel out here fighting for big pharma right now. You want to talk to them? They're all fighting for big pharma instead of the American people. I'm very concerned about big pharma. They said I don't want big pharma.
You want big government.
The American people. Somebody might lose some stocks.
RTP. So this is where the define harm becomes important. Break it down. get it down to the nitty gritty of harm and the definition thereof, and then you rewind and apply it upwards. And then you have your answer back to them of why protecting big pharma would do more harm than good versus the other way around.
Yeah, we could do that. We could also just like talk like humans. We don't have to.
Wait, RTP, you're telling me the government is going to negotiate
structure. We could do
Mike,
both of those
You
things.
logically break it down to the root,
Why do you guys have
and then
rules on
apply.
how to talk? Why don't you guys
I'm
just talk like humans?
It's
I
called
think it's
logic.
crazy.
It's how you break it down. If you break
Well-
it down, then you could take every single word that they say and throw it right back against them. That's what Andrew does. And that's what I'm telling you.
That's why people don't want to
This
talk
is
to
where
Andrew
you
because
learn
it's
this
annoying.
part.
No, I don't want to debate like him. He's
That's what makes Andrew
Well,
insufferable.
it's a
to be
silly
honest.
way to
The thing is,
debate.
the
It's like
thing
it's
is, I'm not even
This is
arguing
like a
for.
dating coach.
I'm not even
Sarah
arguing
should
for
be an RTP's dating coach
Personally,
right now.
I think of it by way of it's the same way I look at math, right? You break it down to the smallest numbers that you could possibly get. And then once you have that smaller number, you can apply it across the board anyway, and it makes it much easier. You go
Well,
back up the same way.
Sure,
you
we
go.
have the number here. There's 330 million Americans that we would be negotiating lower prices for. And you're saying like, well, we have to worry about the investors and the stockholders of the pharmaceutical company.
Not just them.
So,
not just
the
them.
number one biggest
No,
problem.
because
So
when
like
I
in the-
brought up, wait,
He was asking me, but you go ahead then,
Wait.
Doug.
When I brought up the topic, I talked about the science and technology advancement that we have over the world. When we lose that incentivization, we lose innovation. That's what I'm talking about. I'm not arguing for stockholders or anything like that. I'm just saying when these companies make less money, they're less incentivized, which leads to less innovations in these fields, which leads to worse outcomes overall.
Yeah, I think that is a guess. I think
That is
you're
not a
doing
guess.
It is a guess.
We are, the way we have structured it, we are outpacing Switzerland, the top margins. You can look this up. It's on the here. Like if you look up the World Index of Health Innovations, we are number 1 for science and technology. We outpace almost everyone.
Hornet, don't let them stop you.
Yeah, we do.
Don't let RTP stop you, Hornet.
And, this,
You're
and we're
sounding
like number
the
2 in
MLK of
R&D.
healthcare. I love
R&D,
it.
like
I know, but
expenditure
how
per
is their
capita.
how is their stock price dropping going to change that?
Because they're less incentivized. Because the reason
because the way you have to remember the way that they spend on R&D is based off of revenue. They spend a percentage of revenue, right?
We're number 2 in that part.
They could be more profitable without investors. In fact, you could argue that a lot of times if they dropped the investors, they would have more profit because they're not paying out dividends.
You understand
They're
if they
not paying
dropped
out
the
bonuses.
investors, they wouldn't have a company at all.
Yes, they would. Their
No.
stock price would go down.
No, the investors own that shit. If you can't get a
and if-
return on your money, you're not going to buy medical equipment to
and
get a
if
return.
they
off of.
and then the stock price will drop. But these are profitable companies. They're not profitable because they have investors.
Yes, they are. They
No,
only
they're
exist-
not. They're
they only
profitable because
exist-
they are profitable because
What
they
do
bring in more
investors
money
do?
than
What
they
is an
spend.
investor's role in the company?
Mostly to raise the stock price.
The investor provides the capital that the company uses to generate a profit.
Not all. No,
Always,
That's true
always,
sometimes.
always.
Okay, so when
always.
if I put in $10,000 into Google tonight, they're going to take that $10,000 and they're going to invest in the company.
That's how that works.
That's how it works. They take my
RTP,
$10,000.
listen.
That is not how it works.
They're
You
gonna
know what
operate
they're
at
gonna do with that
Hold on, what do
investment?
you think happens to the $10,000?
They can kind of do what they want with the $10,000, but I
That's
can tell you
the
what
point.
they don't do with it is throw it into R&D. The best pharmaceutical companies take 20 to 30% of their revenue and do R&D, like the best ones. And a lot of
And-
their R&D is
And the
government funded
percentage is
anyway.
based, the
So I
percentage
would
is based
say
off
if
of
we
a
wa-
specific return, right?
Yes,
That's
yes,
why
that's
people
what I
invest
was
in it.
gonna say.
So the way let me explain how investors work. A company exists, right? There's shares
Yeah.
of stock. If I buy stock from you, you take the money because that capital's already in the company. But without investors, you have no capital, you have no company.
Wait, there's lots of companies that don't have investors. What the fuck are you talking about?
They have sole proprietors, they have owners. Investors
Yeah.
are owners. Investors are owners.
Yeah, well, that's what I just said, though. You said that all the money, when you put money in, that it goes to develop the
No.
to do R&D. If I
No,
put
I
in
did not say
10,000
that. That's what you
where's
want me
my
to say. That's what you
$10,000?
want me to say. That's a
So
straw
what-
man. That's not what I
so-
said.
Wait, so my answer of it could go a lot of places, and they can kind of choose
I
where they
didn't
send
say
it.
that.
is
You're
correct,
fighting
right?
a straw man. You're fighting a straw man.
No, I'm saying that I'm telling you what my answer was. My answer of they can choose where that money goes, but it doesn't always go to R&D. That was a correct answer, wasn't it?
I wasn't talking about R&D. I was talking about the company.
I know, so
If
that's
you
what I'm
remo-
saying.
If you
That's what I'm
remove
saying. So my
investors from a
answer,
company,
so my answer was correct, wasn't it?
no, your answer is wrong because you're not addressing
So it
what
all
I
goes to
said.
R&D.
It has nothing to do with R&D. Ignore
Oh,
R&D.
it doesn't go to no R&D. No
Ignore
money goes to
R&D. R&D is not important.
Well, some of the money goes to
The
R&D.
company existing. I'm right because I said the company needs investors or it doesn't exist. You're like,
But companies
no, it
exist
will
without
still exist.
investors.
You said the company would be more profitable without investors.
I said no. I said it could be more profitable without investors if you
And
are
I'm
paying.
telling you
If
that
you are
it
paying out
cannot.
investors, and by limiting those dividends, you become more profitable and more streamlined, and you could even make
If you
less
don't have
revenue,
investors,
but
you
have
don't have a
more
company.
profit.
The investors own the
that's so
company.
fucking stupid. There are lots of businesses that exist without investors.
Name one.
My company.
You're the
I have
investor.
zero investors.
You're the investor.
I didn't invest any money.
But even
I
at
don't
that,
know what
Does most of the Fortune
you're not
500 companies have
We're
investors?
talking about,
is
but
the
obviously we're
answer.
talking about investors that are coming in by buying.
What is okay?
stock,
What is your
right?
business that you
I'm
invest
talking-
$0
I'm talking-
in?
But obviously we're talking about people buying stock, right?
Most
'Cause
of
that's
the
what this
Fortune
conversation
500
is about.
companies
This
have
wasn't, about
pharmaceutical company.
this wasn't about venture capital or
Stock,
startup or seed money.
stock is a
This was
portion
about
of
stock.
the company.
That's what we were talking about, bud. We were talking about stock.
These aren't different things. It's still ownership of the company.
I know, but see, the thing is,
Do you know? I don't think you know.
I don't think you have a clue what we're talking about right now, to be honest.
I absolutely understand
Okay,
business.
what are we
better than you.
talking about?
I promise you.
The fact that you just said I know business better than you is a clear answer that you don't know what the fuck we're talking about. Because we're talking about universal health care. What the fuck are you
I know.
talking
I know.
about?
You want to drag it
I
back
know
because you made
business
a
better
because
because
you made a
my dick.
stupid
It's
statement.
long.
You made a stupid statement about investors. That's obviously wrong. So take it back.
Hey.
My statement was
ARTP,
investor
ARTP,
cash is that investor
RTP,
cash
Dunning
doesn't go
Kruger.
straight to seriously. my comment about investor cash is it doesn't go to R&D. We were talking about Hornet said they have to use that money to develop new drugs.
I was
And
addressing
said-
the comment you made that
and I
said without
said-
investors
and I
we'd be
said-
better off.
And I said yes, but not all of that money. Like a lot of this money is going in to prop up the stock price. A lot of it goes to doing things to make the stock price better, which
That's
doesn't
not what I was. That's not what I was responding to.
which doesn't benefit the investor.
No.
So there are, or I mean,
it makes the CEO richer, it makes the company richer. Like, yeah, for sure, I'll agree to that much. But what I'm saying is the incentivization process of that. The reason they have so much power in that is because they're like, oh, I can make so much money from advancing this. If that money suddenly disappears, do you think a CEO is really going to walk away and be like, you know what, I'm willing to earn less for the sake of humanity? No, that's not going to happen because the world doesn't operate on kindness. It operates
But
through
those
some
companies-
sort of monetary.
Well, the insurance companies would cease to exist, and the pharmaceutical companies have to negotiate against us. This is a very fair process. I don't know why I don't know why we think that saying the American
I'm
people
saying-
negotiating against the insurance or the pharmaceutical companies somehow is a raw fucking deal for anybody. That's
I'm
not even
saying-
government.
I'm
They have
saying the
it, though.
incentivization
They have
drops.
something that we need. And we want to negotiate a fair price. How is that a solution that's not
Because the incentive, because I'm saying the incentivization for these products, for the like scientific advancements, the discoveries, the R&D procedures that we do, all this drops dramatically when we start negotiating for lower prices.
Yeah, but that's what I'm saying. So you're saying that us negotiating lower prices, we can't do it.
We
Because
can,
then-
but
because then we won't innovate?
there's a limitation to it. That's what I'm saying. I don't think that universal healthcare is necessarily the answer. I do want some form
How
of
do we
that.
negotiate as one then?
I like that. That's what I'm saying.
We can't. There's no reason to believe. If we
Unless
look, if we look at public and private industries, I know that you're quoting things that you haven't supported. I'll just let it go. But if we look at government, if we look at government efficiency versus private sector efficiency, private sector is clearly far superior at negotiating prices down. That's why Walmart has everything cheap as shit. But every contractor on earth knows that if you get a government contract, that's where the money is.
What's the
Walmart has everything
Hold on,
cheap
real
as
quick.
shit because it's practically a monopoly and it gets to just dictate prices.
Hold on. Let's just stay with
And a
healthcare.
government is literally a monopoly.
Let's just stay with
and you
healthcare.
want it to be a monopoly and
Let's just
dictate
stay-
prices.
let's just
You're
stay with
arguing for
healthcare.
more monopolies.
Let's just stay with healthcare here. What is the cap on insulin in private healthcare?
I don't have any idea. What's the cap?
$35.
There is no cap. What is it with Medicare?
I don't have any idea. What's the cap?
$35. Who negotiated
So
better
That's
than
not
private?
just the
private or
That's not
public?
just. That's
Yes,
not
it is.
just
It's
with
just for
Medicare.
Medicare. It is just for Medicare.
I pay for insulin. It's not just for Medicare.
The
cap.
This guy knows everything.
I pay $35 per bottle.
The cap is just.
You're wrong. You
for
didn't experience your
Medicare.
life. He knows things that you don't.
Brother, shut the fuck up. You just said the private insurance
Sir,
had
you
no
need more
cap,
sugar
and
in
you
your life if you're
negotiated a
taking
better
all that
deal.
insulin.
You turn your hat back around the right
I
way.
didn't say anything about private
Yes,
insurance.
you said that. No, you said the.
I said the private
better at
industry.
negotiating.
Man, you just bring those
private
goalposts back here.
industry
You got
is
your
better at
goalposts on
negotiating.
wheels, man.
Did you not say that? Did you not say
I
that
said
the private industry
listen to
is
me.
always
I'll
better
say
at
it again.
negotiating?
Listen to me.
I'm glad I could spice
They
this
need
up.
some little private time.
The private sector across the board. I don't know a lot about the healthcare specifically, but I do know that government negotiation is way inefficient compared to private sector negotiation.
Not in
That is
healthcare,
why.
though, but not in healthcare.
Why
In
would
healthcare,
that? Why would that be unique?
Because healthcare has collective bargaining. They have the power of collective bargaining. They get to negotiate together,
Collective
and
bargaining.
that gives leverage.
But that's not unique to medical field. There's no reason that same phenomenon wouldn't apply to every industry.
Correct. Everywhere where you collectively bargain in greater numbers, the consumer winds up with a better deal.
Only if the bargainer has a proper incentive to negotiate the best prices.
Which
Government
the pharmaceutical companies did. They want to
Yes.
make money, and
Right.
the government
They
wants
have
the lowest
incentive.
possible price. So in the private sector, there's no cap on insulin, but where we collectively bargained, the cap is $35. That's way better.
Do you
There
understand that
is
this is
a fucking cap on insulin.
you know that this is really a bigger topic than just healthcare, right? We're talking about
No, I don't know if you saw the title of the video today, and why I'm here today is because we're talking about
the
universal
concerns.
healthcare.
The concerns about universal healthcare reflect a bigger concern base than just healthcare. We're talking about governments negotiating against citizens, for citizens. We're talking about taking entire industries and privatizing them. It's a bigger discussion. I know you want to leave it on healthcare because you've got all your stats memorized.
No, it's not because I have my stats memorized. The problem is I'm not an ideologue. I see when the government.
Yes, you are.
I'm not, because I see when the government is better at something, I want the government to do that. And when private industry is better at something, I want the private industry to do that. Because I'm not a dipshit ideologue that uses a
You
slippery
are.
slope. No, because
Yes,
what's
you
my ideology then?
Your ideology is Medicaid or Medicare.
That's
obviously.
not an ideology. That's an insurance program.
I don't know you. I just showed up, but you
Yeah,
definitely,
so
you
you're sure that
definitely
I'm an
have,
ideologue, but you can't identify what my ideology is.
you are a screeching liberal. I can see that much.
Yeah, and you're a dumb fucking Republican.
I'm
You're
not.
like, if we're doing
I
stereotypes.
don't even vote. I don't even
No,
vote.
Well, whatever. Well, then you're just dumb because you're up here arguing with no basis. You can't. And by the way, Sarah, private insurance companies can cap insulin, but it's not mandated. It's mandated through Medicare. Just so we're
Did
clear
you
on
just
that.
chat GPT that?
No, I know this. I already said it in my opening statement. That's this is you projecting when you don't know shit.
I just asked a question. I don't know. Maybe you didn't.
And then
I'm
you
not
pretend
projecting
you
anything.
knew it.
I'm just asking you a question.
I know this is you projecting, but the
No,
problem
I'm
here
asking
right
you the
now
question.
is you are making a silly argument that government bad, private industry good.
Government
It's
is
it's
more
over-
inefficient
Yeah,
than
that's,
private sector.
that's a stupid argument when we're talking about healthcare, where the government is more efficient.
You're saying that healthcare is this special unicorn. I'm saying there's no reason to believe that.
Who is more efficient in running schools, private schools or public schools?
Private schools. That's
Wrong.
why they
Public
do
schools.
better.
Public
No,
schools are far
absolutely
more-
not. Private schools spend less per student and they deliver a better product.
No. If you talk about efficiency, right? Because we're talking about how the government
They
spends our
spend
money.
less per student and deliver a better product.
Well, I live in Arizona. That's not true. In Arizona, they pay less per student. So I don't know what state you're in.
No, not for the parents, because the parents double pay. But if
No,
you look at
pay
the dollars
less
spent
per
on each student,
I
yeah,
said pay
private.
less. They don't in Arizona.
I bet you they do.
They get less government funding per student. But it's
I
actually
can
more expensive
almost
to go-
guarantee that everywhere, even
How
in
would schools-
Arizona,
how
you're
would
wrong about
schools
that.
how would schools that are more expensive pay less per or
They have
less
to
per
operate
student?
more efficiently to survive. Tax
No, they
dollars
don't.
are easy to come by.
They get tax dollars in Arizona. We have
Not to the
school
same
choice in
degree.
Arizona. No, to the same. We have school choice in Arizona. They get to
Okay.
take 70% of the money out. Yeah, private industry actually fucked up all of Arizona's education. We're 50th in the country, 50th,
And
we have
that's
more
and that's
we have
because
more
people have the
charter
option.
schools-
So you
we
think
have
that
more
people should
charter
not have the
schools-
option to go to private school?
Well, no, you shouldn't take public money and put it in the private sector. That's the problem.
I
Private
wouldn't even
schools-
disagree with that.
private- Well, that's the problem that we have here. We mixed them, right?
The problem is that we got too much public. You insist on public money funding things.
I know you guys insist on public money funding private education. I'm against that.
I want as little public money funding anything as possible.
Great, then you should advocate for them not giving money to charter schools.
I'm not in Arizona, but yeah, no.
Do you advocate for that?
I don't advocate at all for that. No.
Like we shouldn't give money to charter schools.
I don't advocate for that at all. I don't have either way. That's that's not my burden.
Yeah. But the point is here with insurance, and I sent it over. It was 20%, 20 to 25%. I can go back of
backstage
of administrative costs through private insurance. It's about 2% when it comes to Medicare. That's a substantial.
Where did you send that? Is it? Did you?
I thought it was 80%. Let me go back to. Hold on one second. I searched a couple things after that.
And whose dad? Dusty is. I wish I could be an anarchist. Unfortunately, I'm kind of a realist a little bit, just enough to let me know that nature abhors a vacuum, and that includes a vacuum in power.
Okay. NHE fact check.
What you shaking your head down there for? Action figures.
Action figures.
She is
Sarah.
libertarian brain rot, basically.
What's up, Hornet?
Basically.
I was like, I can't shake my head. I can't do that. My head's stuck.
No, he's talking to me.
But Sarah, I linked why you have a cap in Maryland. Your state law.
Yeah, I was gonna.
Those are state laws. Yeah, I looked it up. Like 28 states have caps on them.
Yeah.
Yeah, but it's not. It's not a federal cap. There is a federal cap for Medicare and insulin, but not not federal for insulin in general.
W Blue State.
It says affordable insulin now act capped cost sharing for month supply of insulin, $35 for private insurance plans in Medicare. Some states also have their own copay caps for insulin. So it sounds like there's still an overall. It just depends on how your state applies it.
Yeah, right. I post a link back there where it like shows like the 28 individual states, and some of them are up to $100 cap, some of them are down to 30, 25. Yeah, it just depends.
But in all 50 states, there's a cap if you're on Medicare, so they're better at negotiating.
Yes. So that cap isn't universal, is the point, Sarah?
Yeah.
No, it says there is a cap. It just depends on how the state applies it. Whether they do, it says it's whether they're doing.
Well, only 28 states have applied a cap.
Yeah, it's whether they do a cap 35 or 25% of the plan's negotiated price. That there's still a cap. It's just whether they do like a discounted version or but there's still a cap.
There's not a cap.
The bill, which includes provisions for both private insurance and Medicare, cap cost sharing for a month's supply of insulin at $35 or 25% of the plan's negotiated price, whichever is less.
Yeah, that's what they're saying. There's a cap. And 28 states have applied it, but if you have Medicare, you're guaranteed a cap at $35.
And it also says many states have implemented their own laws to cap insulin costs for those
Yeah,
with state
I put a list in there so you can see like each state what they have there.
I hear what you're saying. There's still a cap. It's just how the state chooses to apply it.
Well, but what we're saying is some states it's going to be over 35, so there's not like actually a cap, right?
Well, she's saying there's still it's a 25% cap. Can you link what you're reading, Sarah? I'm just curious.
I think I'm reading the same thing. Was it from NBC News?
The cap might not result in a 35, but whatever number that
It'll
is,
be
it's still a cap.
25% of the plan's negotiated price or $35, whichever is less.
Mm-hmm.
Let me see if I can pull it up from the ADA.
So if it's not $35, the cap is the percentage, is all that's being said.
Yeah.
This
Now,
that's math, right? So it's like, yeah, you would like it to be 35 for everybody, but the point is some states are more expensive and the cap then becomes the percentage. Now, RTP, when you were talking earlier, I don't disagree with you about the bargaining aspect of the government because I enjoy my state benefits through my wifey. Or when you can have a surgery where if I can leave that day, it's considered a regular doctor's visit, and it's an inpatient surgery. Normally for other people, right, it may be 25,000, but the fact that you can leave day of, they're like, oh, we treat it like a regular visit. So you pay your copay. That's what you pay. And if you do happen to stay, 200 is what you pay. That is a great deal, because you're saying I can have a gallbladder removed, and because I can walk home that day and pay $50 a copay because it's an outpatient, I don't think private enterprise is giving that. So that's one benefit I do have when you talk about the state aspect from her. Now, the flip side is I now have to trust the government doing a better job than me. No, doing a better job than me. We can't always assume the government is a better negotiator than the citizen.
Well, I think like on
it's like a house. We can't always assume that.
I think on a one-to-one basis, you're right. Like, I'm not saying that they're super talented and they're good at negotiating. What I'm saying is they have leverage that you and I could never have. They have the leverage of 330 million consumers. So that leverage alone, basically they can go to any pharmaceutical company, and if they say, here's our price, and the pharmaceutical company says no, they go, okay, now what do we do? Because that pharmaceutical company needs us more than we need them. We can probably replace them, and we shouldn't. So we're gonna be incentivized to find a deal that works with the pharmaceutical companies. We are incentivized.
And agree with it.
And we have to give them
that.
a price that's enough that they can still do R&D, that they can still innovate, and they have to give us a price that we can accept, where we say, okay, you're going to innovate with this money, but we're going to have the lowest possible price. This is the most sensible way to do it.
That's a monopoly.
Yeah, for sure. That's what I was trying to get at. That like it's trying to balance those two things out, because for me, like the innovation process that America does is like the access to our medical care is probably the worst in the world, but the medical technology that we have is the highest in the world. So there's like a way to lower that bar so that people can access it, but also not lower it to the point that we are being like we're falling behind, or medical science falls to a point where it's not even competing in the US.
Yeah, we don't want to handicap ourselves, you know what I mean? Because we still have, like, a lot of these pharmaceutical companies, they still take their profits and they turn around and then they invest in new medications. Now, whether that's always the best is, I don't, it's, you could debate that, but, they, in turn, with the money they're making, they do turn around and say, how else can we make money? Let's innovate something else. So there is still a benefit to their profits, but is it the most beneficial to the American society? And that's where you define harm, RDP.
I would still ask the same question that now that there's new people. If our system is good compared to everybody else's, why doesn't anybody copy it? Why is everybody else doing universal health care?
I'm gonna tell you why they don't copy it. It's a quick answer. They don't have the capitalistic society we have. That's my answer. I
don't know where Joe and I was going with that, but like the reason they wouldn't copy us is because when we have like high innovation in the US, they can buy off of us and then sell it and then use the supplies that they have and now introduce it into their universal healthcare, right? So they're taking the advantage of the US innovation and also using universal healthcare on top of that. So the question becomes, if we get rid of the U.S. innovation, like what happens there with those universal healthcare systems? Do they not have the same? Do they not have the same advantages anymore because now they don't have access to the medical science that you would have been entitled to at a certain point because they could buy off the U.S.?
I mean, just mathematically, from an efficiency standpoint, they're already spending 20 to 25% on their administrative costs. Medicare is 2%. I'm guessing that could go up to 4 or 5%. But you have all that extra money laying around now.
The receipt you drop backstage doesn't show that either, by the way.
Yes, it does. It's highlighted.
No, it's not.
Okay, I can pull it back. It's It's under administrative costs for payers. It says within the U.S. system, the share of expenditures that are attributable to administrative costs varies greatly by payer. The BIR costs for traditional Medicare and Medicaid hover around 2% to 5%, while those for private insurance is about 17%. Oh, I said 20%.
NHE fact sheet.
What's that?
The NHE fact sheet. Is that what you're looking at?
No, it's in the Americans for Progress. It's in. You can see the headline: administrative costs for payers.
So, well, there's a quick lull there. I'm probably about to bounce, but I have a little like a paragraph to read, if you don't mind. And then I'm addressing some of the things we just talked about in here too. So.
Hey, y'all make me want to go to. I need to go get this PhD. It's a lot of dissertations popping off right now. Let me take another shot. Dang,
I got a bachelor's in computer science. That's where my facts and logic comes from. So, but yeah, healthcare is not a right in America. But
Shall we all break out our measuring sticks, gentlemen?
That's right. So healthcare is not a right in America, but I think it should be. I think KO Dave brought up a great point about how Article 25 of the Universal Declaration of Human Rights includes medical care as part of a basic standard of living, and most developed countries treat it that way. We do not. Under proposals like Bernie's, which RTP I believe has been advocating for tonight, we would cover everyone, but while actually spending less overall than we do now. Some people worry that cutting those profits could slow medical innovation. That is a fair concern to talk about, but I think most breakthrough research already comes from public funding, not from big pharma's marketing budgets. Other countries regulate prices and they still innovate. If there's a strong case, which I think there is, that this could save money and fulfill a basic human right in the United States that has long been ignored, I think maybe it's time that we stop treating this like a radical idea. And I don't mean radical in the cool way there. And we should maybe consider it more as a moral obligation. But always a pleasure. I appreciate you having me on, Sarah. RTP, you kick ass, man. Good job tonight. KO Dave, it was nice hearing from you as well. Everyone else, good talking to you. Take it easy.
Shout out salmon color tank top. Do your thing. Yeah.
Hell yeah, brother.
Yeah.
Oh, where'd Flo go?
I'm here.
Thanks,
He's
Sarah.
up the
This
top.
look,
Oh.
this is my final thoughts.
I didn't even realize.
Look, I'm gonna give my final thoughts. I know this is not that time of the show, but I need to duck out too. Look, Sarah's been a minute, and every time I patronize and I'm doing all this stuff, they say I simp for you, but I love simping for women with red faces. Like, I'm always tickled by your rosacea. It allows me to understand that although you flawed, the redness that comes from you, it just look. RTP wants nothing to do with that. He goes off cam. Yeah, because he's like,
he loves our degenerate horse videos.
Yes, he does. Look, and you know, I love you too.
I just hit the vape too
Gentlemen.
hard. That's all that happened.
I'm not worried about RTP. Look, he has some good points. I'm the people's champ. I'm not going to come with facts like that. If I wanted to really be debating with y'all, I would be researching. I stopped doing that when I became a parent. I study my kids. Like, if anything I'm going to study, it's going to be the stinking kids, see what they doing. Y'all are grown. Y'all too advanced for me, but I do have valid points. And I don't need you to tell me that because I know I do because I have common sense. Common sense helps out in a lot of debates. So that's my final thought. When y'all don't have your research, you do have common sense. If you ain't got common sense, then yes, you are degenerate and you're an idiot. And then RTP will crush you every time, and Sarah will have somebody silence you for $10. But if you're decent like me, you'll be all right in life because I'm the people's champ. Until next time, hey, y'all have a great time.
What a fucking go out. Well done. Well
Bye,
done.
Gemini.
Yeah,
We
Gemini.
love
Walked
you.
it off.
See you later, bro.
Mhm.
All right.
I'm about done. I probably maybe got 10 more minutes.
That's fair. I'm actually getting to that point too. So, the chat still hasn't made up for not hitting the goal earlier. You guys have still disappointed me. I'm very upset.
Why don't you have me debate
On
that Crucible senior citizen guy that came up earlier that was angry? I'll take on the senior
Grid?
roles.
You want to take on Grid?
Grid?
Is that who that was?
Grid 1.
He reminds me of all my angry scout leaders.
He'll debate economics.
Sure, we'll have to figure something out.
You
We'll
seem
talk.
to be a economics kind of guy. You like
I
numbers.
I like economics. Yeah. It's
Yeah.
hard I don't always find like disagreement with your side. I'm a little more in the middle. Like I find myself people feel like I'm a fence sitter economically, so they don't like
I know Econo Boy. He's been looking for a debate, and Grid would probably pick up on that too. So I guess we would just we'll maybe try to find a prompt that would actually work. So
Go debate on Live and Learn.
Live and learn.
Live
What is
and
that?
Learn.
Live and learn. I
It's
don't know what that is.
the podcast that Econo Boy is part of,
Oh, okay.
alongside Josiah, Pisco, and Hutch.
Okay,
Mhm.
I'll check them out.
Oh, Pisco. Have you met Pisco, RTP?
I don't know. Have I? I have the worst memory with who I've met. It's
you
terrible.
You would remember Pisco.
You would
Okay.
remember Pisco.
Was that the Macho Man Randy Savage or the guy with the handlebar mustache?
No.
Okay.
No.
That guy was funny. I liked that guy. He was funny. Then I saw him on Tim Pool, and I
American
thought
Nacho. You're thinking of American Nacho. He was fun too. That was the first time he came to his panel. You dragged out a lot of new people. I like it. But no, Pisco is very left leaning. He's I believe he's a lawyer too.
Yeah.
But
Yes, he
he's
is.
very high energy. Like you actually remind me of him, the way you interact and engage. But he's very high energy, and you two would probably just sit there and just keep yelling at each other.
yeah, it's perfect.
Pisco comes in hot, even if he's not pissed off, because he's just always animated.
Yeah.
Yes, I saw that the first and only time he's made it to this for a debate here. He was like sweating. And he was like talking so fast, so loud, so crazy. And like, I even had to get to a point where I'm like, you're not letting anyone else talk. But he was like sweating. And I'm like, what did you have? Like, are you
Lawyer's
taking
the
energy
best
drinks or
cocaine, I think.
Lawyer cocaine is the best
He
cocaine.
was like, and I'm like, Jesus Christ, Lord have mercy.
It takes a very special kind of person to pass the bar exam. That's my guess.
Yeah. He was taking a rail exam.
Anyways, well, I'll let you guys.
Was it a hot rail exam?
I'll let you guys finish your playtime, and then we'll shut down.
All right, sounds good. Yeah, like that's all I really wanted to comment on, because I feel like that's the hard part for me accepting universal healthcare. The loss of this science and technology there doesn't seem like something that would be beneficial to the U.S. in the long run. I could see the benefits behind having each individual, and yes, the consumer should probably take a hand there, but it's also like, okay, do we really want to fall behind in these situations where like we can talk about like the Moderna situation or any of these other situations, right, where we're advancing these fields at a rapid rate with the amount of money that's being like funneled into these pharmaceutical and biotech companies. So like I feel like that's my one like thing that keeps me off universal healthcare. For me, like the thing, it would be like lowering the poverty line to a certain degree, where like, let's say like, I think the average is about 60,000 for Americans. Put it at like the 50 to 55,000 mark, where most Americans that need healthcare get that, and then the rest of Americans who are probably out earning everyone else already have like a private sector that they can pull from.
The only problem with that is it lowers your ability to collectively bargain, but it also like anything, you need people paying into this an insurance that aren't using it. Like that's why health insurance companies forever had pre-existing condition rules, is because they need a lot of healthy bodies paying in. That's why they want as many customers as possible. So anything we do to limit our customer base makes it that more expensive, makes it less cost effective, and so we want as many people as we want on the same insurance program. So I understand what you're saying. Like it makes sense because you're like, the people that really need it are the people that are making like $55,000 and under. But if everybody's on the same plan, then that's subsidized, spreads the cost around more evenly.
Yeah, yeah, for sure. And I think that's still like that'd be the one thing that I'm trying to like do the balancing act in my head of trying to figure out for like giving everyone the thing versus like because I do understand that like I disagreed with you guys earlier when you guys said that we focus on the top. I feel like we focus on the very top and the very bottom, right? Those are the two people that get protected very much. And then the rest of us are kind of all like struggling to figure out what the fuck's going on. So I feel like that's where we need to rein in a bit. Like, and that'd be why I would advocate for something like increasing the poverty line to give access to this welfare program, which would increase our taxes to a certain degree, but not necessarily move us off the incentivization for these companies to actually lose all that money.
Yeah.
Do you have any concern about government setting prices with private industry?
I would have a problem if it's like I don't like price controls in general, but in this case, I don't think it's as much price controls as much as it is a negotiation. I don't have problems
How
with
would it be?
negotiation.
I mean, how would it be a different? Because if you've got one, if the government is the only customer, that's basically a reverse monopoly, right?
Sure, it makes them the monopoly when it comes to health insurance. Sure.
So if they're the only possible customer, then that is government setting prices. It may just go by a different name.
Well, yeah, but so when I say I don't like price controls, I don't like them because they are broad and they often don't adjust for economic figures. When you're negotiating these prices with these pharmaceutical companies, they have to make money, right? And they have to pay their bills too. So they're going to come with a number of like, here's the percentage of profit we're going to have, and they may have a target of 50%. Maybe the government says 20, and they negotiate, and it's up to that pharmaceutical company to pick a number where they can operate within, and it's up to our government to pick a number they can operate within. But I mean, that happens already. We already do that but it's just private companies.
Do you consider yourself a fascist?
No.
Do you know that that's fascism, literally exactly what you're advocating for with price?
There's not a single policy that is fascist in nature. Fascism is a collective of like thoughts and ideologies. There's not a single
fascism is
there's not a single policy
the marriage
that is
of
fascist.
State and private industry. So if you've got the state telling private companies what they are selling and at what prices, that is fascism.
That's not fascism. Yeah, that's not fascism though.
Okay. It actually, yes, it is.
There's like there's two kind of wildly accepted definitions of fascism. One's the 7 tenets and one's the 14. And you would have to convince me that falls into all 7 or all 14 tenets of fascism. I don't think you'd be able to do that. It's also going to require like an authoritarian leader. It's going to require there's other.
We're not talking about the leadership aspect, right? We're only dealing with one little section of it, which is
one thing. But that's why it's not fascism.
With the economic interface between the government and private industry, and what you're proposing is specifically exactly a fascist interface between those two entities.
It's not.
How can it not?
That's not how fascism works.
Yeah, policies aren't fascism. Like a single policy can't be fascism.
I'm not saying that is fascism in its entirety. I'm saying that the way that you want this
without its entirety, it is not fascism.
Yeah, in order for something to be fascism, it has to be in its entirety.
Well, I think both states arguing
that's why even though
this goes through, then you have other fascist qualities arise from that situation as well. Like you would have authoritarian leaders and stuff like that arise.
Well, what's the difference?
I don't necessarily agree with,
but what's the difference between two private parties negotiating against each other for a fair price and the government negotiating with the private party for a fair price? What's the difference fundamentally?
Coercion, monopoly, and violence.
Okay, but what? So what about if you just had like, what if a whole city just collectively, without the government, gets together and they say we're going to negotiate prices?
That would be a free market transaction. That would be fine.
See, I think the principle, but I think the principle still works the same. I don't care by definition. The principle is still the same. These are the people negotiating on behalf of the people against a company.
Is that one is voluntary and the other is not.
Yeah, what's the competition then?
There is no competition for health insurance.
Well, but then what's really the incentive to
negotiate the lowest possible price for your consumer?
Right, but
that's their incentive.
I mean, they could just turn into something else at that, or turn into just supplement. Then maybe all of the private insurance companies will just say, you know what, fuck it, then we'll just turn into supplemental only. Screw your Medicare shit.
No, they will all go away with Medicare for all. There won't be private insurance unless it's supplemental. There will be no private insurance companies.
They would just transition over to supplemental, which would be a smaller market for sure.
Much smaller. Yeah.
If this works for healthcare, why wouldn't it work for everything? Can we just do the same with grocery prices, with rent, with vehicles?
I asked the same question.
You can try a planned economy, but historically those have failed utterly.
I think I agree. I agree, and so I don't know why this I can't see anything that would make healthcare be exempt from the same patterns.
Every other developed country.
Hold on. This is the problem with when I say like I'm not an ideologue, because ideologically I actually agree with you. The principle is the same, but not all principles operate.
Okay, I retract the claim. You're not an ideologue. I don't actually know you.
So in this case, I'm looking at universal health care not because I have some principle that the government does things better than private industry. It's because I've done the research, and on this specific instance, when it comes to healthcare, they are more efficient. When it comes to grocery stores, I'm not sure that they would be more efficient, except for in places where there's like food deserts, like what Mom Donnie's asking for, because in those places, the private sector doesn't want to bring in a grocery store. There's not enough money for them. So there are these food deserts. And so the government steps in and says, we'll run it, nonprofit, and that works for the people. But that's a government solution because the market isn't functioning there. So I'll look at specific instances, and if the government needs to step in because the market isn't functioning correctly, I'm cool with it. But I don't have this idea that the government should run all things or that they're better at running all things, because clearly there's a lot of things that I wouldn't want the government to run.
Right. And I'll admit that I don't have specific healthcare industry knowledge nearly enough to go on the specifics against that, but I can say I understand economics pretty well, and I can't think of a single example where government actually ends up being more efficient. Now I can think of tons of examples where they claim to be more efficient.
What about the military? Do you think they're more efficient than private militaries?
I think that it depends on what you're trying to do with your military. I think that we do too much with ours.
Okay, so let's say in terms of
no, the military is not efficient at all. It's always a hurry up and wait, knee-jerk reaction. Nobody knows who has the pencil and who has the paper and who needs to fucking write something and where's it gotta go. What are we writing? Where's it coming from? Who are we sending it to?
Oops, we left all of our equipment in Afghanistan.
This is a great answer. So then why don't we privatize our military?
It's probably cheaper to keep her. I mean,
can I offer something that I think that is maybe the answer? I think the answer to why we don't privatize our military is accountability, because we don't trust that the privatized military would be accountable to the people, but we do trust, at least in some aspect, that the people that are serving the military, maybe not the leaders, maybe not the politicians, that they are doing it because they're doing it out of loyalty to the country and it's not about profit.
Well, also, if your military is for hire, who's to say somebody else can't pay a higher price?
Right.
That too. And also, if this has happened many times in history to states that have used private militaries, if the conditions on the ground change to the point where the profit is to be found by controlling the government that you're working for, you suddenly find yourself in a military coup.
Or another government that wants to interject and put a higher bid on your army can. You know, there's a lot of reasons to not.
Is that why you guys don't have a military in Canada? Did somebody come buy it? What happened?
We do have a military.
I'm just kidding. I know. I'm just kidding. It's all right,
buddy.
That's why you guys have horses up there. They took your car.
U.S. Canada 1v1 in the Arctic. Canada wins.
That's probably true. Yeah, I'm not going up there.
Listen, we don't have to actually go there. We just send all our drones and then be like, fuck it.
Good luck finding us hiding under the snow.
All right, gentlemen. Oh, go ahead, Hornet.
Yeah, so I just had a question about because from my understanding is that the U.S. spends per capita more than most countries do, but it's also because of the public spending and the privatized spending, right? I think from what I read, it was like 13,500 per person, and then like half of that, like 7,000 of that is in public spending, right? So I could agree to you that's not sustainable over time, right? That's why I would agree in that aspect. But I think there's a healthier way of doing it than just going full universal healthcare, where we don't lose the per capita spending, because the per capita spending is nice to have in the privatized sectors where we have all that innovation. So that's kind of
I think if you got with the numbers and you looked at especially the efficiency with how the government operates, you can see that a lot of these pharmaceutical companies, by not dealing with private health insurance, they may be able to increase their margins. I don't know. I haven't done the math, but I'm just looking at like the difference in administrative costs, and I think that there's some wiggle room there that they could build in to continue to be innovative. And also charge less, because there's going to be less red tape. They're going to have to deal with less insurance companies. It'll be one customer essentially that they're dealing with, and so the regulatory burden will be significantly lowered.
Yeah.
Well, why can't we just kind of force the hand on the private insurance and like bargain holistically to begin with, and say, hey, look, like if you're going to be here, in our state or in our country or whatever selling this shit, you need to sell it reasonably. Like, why can't we? You're gonna boot them out anyways with maybe the threat thereof of overall Medicare for everyone would do that job.
Because
right?
what's the point? Like we're just prolonging a system that's worse. There is a better solution. That's like I do think that a better solution than what we're doing now would be to reform, but reform is still a step that's not as good as universal health care. So I'd rather just do universal health care. It seems like we tried that with the ACA. We tried mixing the private sector and the government, and when they mix together, the private sector wins, and we just increase prices anyways. That profit motive is a real problem when we're talking about human lives. When they're always going to put profit above human lives, and we need
that's
more
a capitalist
incentive.
system, right? Like we're always going to have.
Humans are going to prioritize their own rewards, right?
Mhm.
That's just human nature. That's a
Yeah.
function of human nature.
But don't you think that incentivizes our government? Because now the government's job is to make sure that we have the health care that we want. They're now accountable to us, where the private insurance is driven by the dollar. But in this case,
governments are less accountable than private companies, because you have to a private company has to convince you to. It's absolutely true. A private company has to convince you to buy from them. A government does not. You have to buy from them.
But
Also,
Medicare and Social Security are paid for.
Well, even
they're
at that, you're still buying through your company, who is then being bought by the insurance, right? Because you get insurance.
Also,
the
Who
government
has to compete
healthcare
against other companies as well.
government healthcare has never gone bankrupt or had to take
It can't go bankrupt. It's run by the government. They can print their way out of it.
Hold on. But the thing is Medicare is paid for, and this Medicare for all plan with Bernie Sanders, it is paid for. It is revenue neutral. It is not new spending.
How
It
is
is spending that is paid for.
So
So
I know. I'm sure you've already explained this probably a couple times, but
do you want me to drop? I could just drop the his link. You can go. He has like a shorter version that would.
I'll look at it. But
I could drop
my
it.
point is that
If you
that
drop
by
the links again,
nature
that'd
of
be
government running it and also running money, it can't go bankrupt. It can inflate the shit out of the currency. It can be an economic detriment, but it can't go bankrupt.
But I think you're misunderstanding what Medicare is. It is paid for. The money comes in and into an account and it goes out. This isn't like we're not spending money that we don't have for Medicare. We have the money. So Medicare, Social Security, that's why those are not
I'm very suspicious of that claim, but I don't know for sure that it's wrong. So
it's congressionally mandated that it is paid for.
I am still concerned for that factor that we're, the bracket system and stuff, and like, where is the incentive to make more money, right? I would not feel as incentivized to do better in life if I could pay a little bit for a little house or even welfare, whatever pays for me. But then also on top of that, now I don't have to do better to be able to afford better health insurance. Everything is just done for me. I have no incentive to do better. And now I am just simply
what is it?
The average American right now pays $13,000 a year for health insurance. Bernie Sanders, Medicare for All, with all the new taxes, would be somewhere between $8,000 and $10,000 a year. The average American is going to save money. Poor people are not going to pay more. Middle class people, it's going to free up some money for you. The people that are going to pay more are the really wealthy people in Wall Street, and it's not significant. We're talking about 2%. We're talking about 2% adjust on the income. No, but
what I'm saying is if I only make $30,000 a year and I get a lot of shit paid for me by the government, I literally have no incentive to do any better. Like, it's just being fed. There's just no, I just feel like
if we're giving everything out,
you're saying that, like, if you're making $30,000 a year, the job you work for, you don't have insurance anyway. So you're saying that if the government gives you access to a doctor, you won't want to work hard anymore?
If it's only 2% of my income, right? And I pay the same amount.
30,000 it wouldn't be. You probably would be paying nothing.
Even better. I have no incentive to hit the next tax bracket.
Actually, you've got an incentive to stay there.
Yeah.
Until a certain threshold.
Yeah, hold on. This makes you economically more free. The stress of knowing, like, when
it
you
makes them economically more free.
Sarah, if you make let me explain what I mean. Let me explain what I mean by that. If you make $30,000 a year and you don't have insurance and you break your leg, you are fucked.
No, I'm not.
You're going to hit medical debt. You're going to have medical bankruptcy. You can't pay for it. You cannot pay for a
As
broken
long as
leg
you got a
on
butthole,
30
you're
grand
never
a year.
broke.
Well, she's saying if you're on the universal health care, if you break your leg at $30,000, you don't really have that worry of
Right.
like,
I'm saying right now, if you don't have universal health care,
Yeah, that's
and
great.
you're telling
I hear you. What
that's
I'm
not
saying
incentive?
is what I'm no. Listen, I make $30,000 a year. I have insurance through your free Medicare system. Okay, that's great. I only pay, or you said next to nothing probably. If I make more money, then I actually have to pay more money out. I don't want to pay more money out. I'm going to stay right there at that 30,000 because I'm paying nothing and getting everything.
Okay, let's
right?
just say that that's true. Let's say I grant that to you, that there's enough people making $30,000 a year that they're comfortable at 30. Somehow they're paying their bills with that, and this health insurance is making them so they don't want to make money. That is still a net benefit because that person at $30,000 is still going to go and get preventative screenings. They're still going to be able to catch diseases early, and that prevents that person from becoming early disabled for some condition that could have been preventable. Just having preventative care saves us in the long run. So even if there was like a lot of
hear
people
all
like
that.
you, it's
What
still a net
if
positive.
what if everyone says, fuck it, I'll just make $30,000 a year. I have no incentive.
That is
This does not happen.
Not a real hypothetical.
This
That
does
would
not
never
happen.
Okay,
in any
I'll
other
put it
countries
this
with
way.
universal healthcare.
I'll put it this way. Well, but we're America. We're capitalists, right?
Almost every other developed country that has universal healthcare is also capitalist.
Sarah, if you made $30,000 right now,
Canada is capitalist,
and you got free healthcare, would you just stop working? You'd stop streaming if your job paid you 30 grand.
It's not just healthcare. It's the basket of.
I know, but I'm asking
everything.
specifically about
It's
healthcare here.
Right.
I'm talking specifically about healthcare.
Right, but I'm putting it in a more than likely if somebody's making $30,000 a year or less, and I think what the average
Let's say you
person
have food
makes.
stamps too.
Right.
I just want to know
stamps,
what you in this scenario you would
food
quit.
stamps, paid rent, free healthcare insurance, like.
Bro,
I'm
I've
sitting-
done that.
I'm
I've turned down
sitting-
what was it? After I got out of jail, I turned down a job that was paying $28 an hour or something for this exact reason. When I accepted it, and then I did the math, and I was like, oh no, I'm not going to take this job. I make more under the table.
Sounds like you have a bad work ethic.
I need to.
No,
I
I
need to
just
shoot
I
this
have
down
an
immediately.
intelligent
But
work
what
ethic.
I'm saying is, if
why would I
everyone,
do something that is worse off for my family?
Canada is not.
Well, you said you had an
socialist.
opportunity to make more money, right?
I had an opportunity to make more money above board, but once I did the math and factored in the fact that I would lose the benefits I was receiving from the government, I was making more money working under the table and reporting zero income.
Okay, so therefore we should not do universal health care and we should stay with our shitty system
What we're
because some
saying
people
is-
might not want to
but
get off
what
government
if
assistance.
everyone starts to
Then it
do
would
it?
then it would fail.
Can you guys hear me okay? Just out
If
of curiosity.
Then
Yeah,
it
we
would
can
fail.
hear
But
you, Justin.
that hasn't happened in any of these other countries. That's
I haven't met a person on the planet who has said to themselves, "I'm good. I have enough money." The idea that someone's going to be like, "Oh, I've got everything covered. I don't need any more. I'm just going to stay right here."
Have you
is
seen
kinda
the
ridiculous.
inner cities? Have you seen?
Yeah, there are people that abuse.
So what's that lady
that's
that
not
like has
arguable.
like 6 kids or something,
The
and
al-
she's mad because they're
And
there will
the
always
alternative, look, the alternative is not nothing.
I do just
right?
want to
We're not
point out
choosing
real
between
quick,
nothing and
Sarah,
making more. We're choosing between under the
we
table.
just point out that red states and rural red communities, rural very white communities, are far more likely to
I thought
be
you weren't
on
ideologue.
to be. No, I'm just saying when we were saying inner cities, like you're more likely to be a white rural person on government subsidies than an inner city person.
Correct.
Was just being
Also,
being fair
just so
there.
everyone knows, I'm also Canadian and I love my healthcare system.
We could tell.
It's the greatest thing on the planet.
We
hold on, more than one.
And the
more
fact that
than
I
one
don't
person
have
in
to.
Canada can
Hold
use the
on,
internet
hold
at
on.
once?
I'm new here. Let me have 2 seconds.
Sorry, I was
Hang
being
on.
an asshole.
The fact that I don't have to pay for health insurance and co-pays and all this other nonsense lets me put more money back into my economy. I can take vacations in my country. I can go to the casino on weekends if I want to. I can even travel to the States. I mean, I used to be able to travel to the States, But now that's not a thing that I do anymore.
You say that you don't pay for the things, but somebody's paying for them, right? So you just aren't consciously paying. You aren't aware that you're paying for them, but I assume that you are paying for them indirectly.
I am paying for them through taxes, and my taxes are about the same as your taxes.
But that's how private and health insurance is too. Like you're paying for it there too. It's just who you're paying it to.
If you choose to buy it.
Yeah, but then you get injured,
Most
and then
of
you
all
have to go to the
countries use our
right
technology,
hospital.
so
you have to
they're
pay a
already
copay.
benefiting off our system as well.
You say I'm benefiting off your system?
Hold up. I'm about, please, Sarah.
You say I'm benefiting off your system?
Hold on.
I'm about
What
to
is
lose my
that
mind.
example where it's like, a teacher says to the classroom, I'm going to give you a test, study for it, do well, and then I will give out whatever the highest grade on one test is will apply to. It's not a curve. Whatever a curve is where that's where you shift everything. This is whoever has the highest grade on the test. I will then just give that same grade to everyone else. It's not a curve. It's a handout. Okay. So whoever gets the highest grade, I will just give that same grade to everybody. So everybody goes home like, well, I mean, I don't have to study. Somebody else will get an A, right? Somebody else will do it. Somebody else will get an A. Somebody else will get an A. Everybody shows up on test day and they all flunked the freaking test. And now everybody's failed because everybody said somebody else will do it. And that's the whole handout
in practice
scenario.
that never happens. There's no evidence that countries who give out more social services have more people leeching off the system. In fact, if you look at I think it's Switzerland, their taxes are around 50%, and they have more money left over at the end of the month than we do. Listen, Dusty, let me just tell you, point to one of these countries where they have higher social services, where they have a higher dependency rate. When they've added social services, that the dependency rate has gone up.
Yeah, I'm not familiar with all other countries, but what I can tell you is that
that's what my claim was.
Hold on. Your claim is that there's no evidence that people will mooch off of free shit more.
No. I said that more people will join these social programs. There isn't.
If they're bigger than necessary.
This is a total virtue signal, RTP. You don't give
no
a fuck.
mooching
That's
when
the bottom line,
everybody's.
dude.
I don't give a fuck. I've been here for 4 hours advocating for universal health care. I laid out my plan for an hour.
How much is Bernie paying
for
you?
3? Then I've debated for 3 hours, and I chose this subject. It's literally the one thing I care about most in politics. If I could do one thing in politics, it would be to get this passed. It is literally one of the only fucking things I care about.
But essentially, though, if everyone is below, like, let's say that 30,000 number, and the higher numbers start coming down and down and down, because now you're taxing extra on anybody that makes over 30,000, then you're taxing extra on anybody that makes over, let's say, 90,000. You tax extra, so everybody else has to carry the weight of everybody below. Eventually, this is where we lose the middle class, right? Because the middle class
You're making
That's
an
not
argument.
anything that
You're
happens.
Real quick, Sarah, you're making an argument that we have data on this. That hasn't happened to any country. So what you're doing is you're creating this hysterical hypothetical now so that we scare people out of a good system and stick with our fucking shitty system.
Are you saying that government taking control of too much of the economy has never?
Well, that's also.
Of course, that's not what I'm saying.
I mean, you said something. What are you saying has never happened before?
I'm saying that all of these other countries have done universal health care. And what didn't happen is they didn't all say, fuck it, I'll make less money now and I'll sit around and do nothing because now I have universal health care. In fact, most of them became more productive.
In the middle class,
yeah,
60,000 a year, and I just got a tax break.
Who got a tax increase to offset it?
Yeah, right.
Nobody, because it's
Somebody
just not
did.
that big a deal.
That's how math works. Somebody had to increase their taxes to afford for you to decrease them.
How'd we pay for these billionaire tax cuts?
Someone got screwed.
That's
Middle
what
class
aboutism.
got
That's
it.
what
Middle
that's what
class got
aboutism.
it.
It's always
Middle
the middle
class
class.
got it.
This is what aboutism. My point is that you
No,
don't. There's
we're
no
on the
such
same
thing.
page.
There's no such thing as free shit. I don't think the bank bailouts should happen. I don't think anybody deserves free shit.
Brother,
That
nobody's
includes you,
saying
poor
free.
sick
You're the
people.
only one saying free. I explained how it is paid for with taxes.
No, you just
clearly
said it
not
was
free.
paid
There's
for.
also
You said
lots
it
of
was.
other ways
No,
to
I
get
just
money
explained-
for healthcare.
Wait, hold on.
For
I
example,
explained how it gets paid for.
you've
with
been at it for
taxes.
4 hours. Just let me have.
You
a
may have
moment.
done it before I got here.
I know. I
Let me have a
was
second.
talking and you jumped in there. Just let me finish my sentence. That's all I was saying.
All right.
Yeah. I'm just saying, like, I've laid this out. No, I'm not saying it's free. The only thing that's free about it is when you go and you use it, you don't pay the charge because they charge the government for money that you've already paid. Just like regular health insurance, you prepay that money.
But those people who
There's
aren't
other-
working or are already on all of the other free handout shit, you know, or are like barely make $30,000 a year, they're not paying anything into it, and now we're paying to carry that weight.
A lot of those people are already on.
That's okay because
Medicaid and
when you're
Medicare.
65 and 70 years old and you get cancer, you're also going to get covered. So it's not
Hopefully,
people
I mean,
mooching off a system.
bold
Everybody
That's a long ways away.
gets a piece of it. And there's also other ways to get
my
money
God.
for it. For example, tobacco is probably one of the biggest like avoidable killers in both of our countries, but a pack of cigarettes in Canada costs $21.
That sounds like a bad trade-off. I pass.
Yeah, I don't want that.
No thanks.
Hey man, keeps our healthcare costs down.
Yeah, no, I'll pass. I'm good on that. That shit sounds stupid. I don't want.
Every fast food place in Canada, they have
That might
to
be the
serve
problem.
light mayonnaise and light cheese.
That's. Why don't you just become a child? Why don't you just get a binky and have your mommy and daddy take care of you for the rest of your life? That's absurd to think.
Right. So
I love
in-
that
Canada
I
is
love
not
that
a
American
nanny-state,
acceptance
Hold
has
on, and
become
you were
poisoning
asking
ourselves.
RTP. You were asking why are all these other countries doing it, and they're doing just fine with it, right? But essentially, here in America, we say, "Hey, you make your money, give us our little cut, and then you do what you get to decide what you want to do with it after that." You know, and from there, people can choose to not have health insurance. They can choose like a cheaper plan. They can choose to, you know, shop the market and do whatever they want.
And they
Now,
can choose to do universal health care too.
Yeah.
And I'm arguing that it's a much better system. So why would
then
anybody
then
choose
they're
to
double
stick
pay,
with our
now they're
system?
double paying again. Now they're getting taxed for something they're not even using, and then they have to go buy their own private.
We've already
anyways.
covered. No, they would use it still. Why would they
Well,
not use it?
just to talk about the competition aspect, because I do agree with Sarah, competition, but I think of it in a different way, like these pharmaceutical and biotechnology companies would basically have a monopoly on these like drugs and everything that they're setting prices to, because smaller companies would no longer be able to compete because they
They
can't set
already
up.
do that. That already.
Well,
exists.
Again,
that already exists.
federal
but
tax
they
rates in
can't
Canada
actually-
are about the same as American. Just saying.
I think that you would likely have more competition because of the rules that are already in place when it comes to bidding government contracts. They have to, or they're supposed to do. They're supposed to bid. They're supposed to bid that out. But there's no. There's with private companies. There's no requirement to do that. So they can they can just jack each other off and raise prices together.
Can I ask you a direct question?
That's
And I'm
price fixing, they can't do that legally.
I'm almost sure this didn't come up in the debate. Sorry, I didn't get to see it.
Sure.
So, but you know, what place? So if you're an advocate for universal healthcare, and I actually tend to be more on your side, personally, my own beliefs. So in your position for universal healthcare, what role do you give like Rand Paul or Ron Paul, or, you know, these are libertarians, but they're also physicians who advocated for a more ethical version of private healthcare during their career. So do you think that Americans would still be able to be represented by people like Rand and Ron Paul? Again, doctors, senators, people who go out and try and drum up funds for people who can't afford surgeries or healthcare. You know, is this politically irrelevant in your view, or try to like put me somewhere closer to where you are?
Let me see if it make sure. Are you saying like what would their role be, or are you saying like you think people like Rand Paul who practice medicine differently would not have a place anymore? I'm not sure exactly what your question is.
Yeah, so people that say that, look, you know, we need to be able to include opinions of healthcare professionals, irregardless of whether or not they're liberal or libertarian. And so, you know, those two come to mind because they both spent 20 years in medicine. They had roles on medical boards. And so I'm not saying they can tell Americans who can't afford healthcare what healthcare must be like, right? But I'm also asking you to kind of clarify, if I'm a libertarian, am I totally wrong for believing, you know, elected representatives who are doctors have a horse in the race?
Well, so with Medicare for All, they're replacing the insurance company, and so they are not instructing doctors how to practice. What they are saying is that the insurance will like when you go and you see a doctor, that they will bill the federal government. So yeah, you're going to have to negotiate things. And I think Rand Paul's going to be
how they practice.
and I think that Rand Paul would be an important person to discuss that. But really what we're talking about is reimbursement. So we're talking about services reimbursed. I would imagine that most objections to reimbursements are going to come from the conservative right when it comes to abortions or things like gender affirming care. I don't think you're going to see a lot of like opposition to certain treatment coming from the left. So I think Rand Paul would actually probably have like an outsized voice because he's representing a viewpoint that really in Congress, he's one of the only people that represents that, despite the fact that there's a lot of people in the country that share that opinion.
So just to challenge you one more time on this, and this is my main thing I wanted to come up and say, because it actually came up on my live stream tonight, but the reason I think you're proving my point, even if it's not my political belief or worldview, because to me, you're pointing me to the fact that look, payer systems and decisions made by healthcare systems are complex. They're technical at this point. And so it is actually people who say, we need to have transparency in all government conversations about healthcare. We also need to have the most robust, honest, transparent conversation possible. That you cannot remove that basic stepping stone and still do what you want to do. And so you telling me that let's just move to a single payer system is moving out all of the details that many taxpayers, not all, but many taxpayers actually care about.
I'm confused. What's the stepping stone that I'm removing here?
Not sure either.
So Rand Paul is an example of someone who might know if they see 200 different actual codes for health treatments, and they're thinking about this evolving healthcare system that keeps people healthy. It's a very fundamental need, but it's also a very complicated system.
Are you talking about like billing codes, or what kind of codes are you talking about?
Yeah, you could say, billing codes or whatever you want in like an electronic medical record system or whatever.
Okay.
And so when we're talking about deploying a single payer system, that's actually what it's going into, right? The big fish chases the little fish and the little fish gets away or doesn't, those types of things. So so you telling me that, well, all you said to me was, oh, don't worry about your opinion. We'll go to a single payer system. It'll be simpler. And my opinion was in the first place. Why is that true? Why can't Rand Paul tell us about healthcare?
He can. I think maybe we're talking past each other. I think of course he can tell us about healthcare. I think he would have more of a voice because he represents like there's more people that agree with Rand Paul than are represented in government. And as they negotiate these deals, and they'll be going through billing, and they'll be going through what is and isn't going to be covered, and that will be negotiated by Congress. But the transparency that we gain here is that these negotiations are public, they're recorded, we can watch them. We have no transparency when it comes to the private healthcare companies and their negotiations and how they determine what they're going to pay and how they determine what they're going to pay out.
But that's not our negotiation.
So there is more transparency in the negotiations of what they're going to pay out. I think it increases transparency and voices. I think it lends more voices to the conversation.
The reason that we need transparency for government transactions is because they're mandatory. I don't care what an insurance company and a hospital negotiate between them, because my negotiation is the price point.
I care a lot. I want to know when they negotiated that price, how they got to that price. I want to know how much of the CEO pay was factored in there. I want to know how much of the marketing budget was factored.
If we're talking about,
I know, which is why
we're talking about purchasing products,
which is why I want a more transparent system when it comes to where my dollars are going, and the government would be more efficient than the private industry here. So in this case,
I know Bernie Sanders promises that it will be, but if we look throughout human history, the history of the 20th century, we can see that that's not actually played out that way at all.
Massachusetts has been doing this for 20 plus years. It is funded. They have a budget surplus most years. This has been done at a state level. It's revenue neutral.
Nobody has a budget surplus.
Yes, most states have balanced budgets. Almost all states have balanced budgets. And it's been tried all over Europe. And it's completely paid for. When you look at how Bernie Sanders funds it, this is revenue neutral. We are not going in
How
debt with
does
it.
he fund it? You keep saying that it's funded, but how?
I sent it to you, but it's through a series of taxes. I can pull up.
Okay, so there you go. Right.
I've said that from the start that and it's going to be less expensive. The average American pays $13,000 a year right now. So you take all the medical costs and split it up. The average American family, $13,000 a year. This plan would be between $8,000 and $12,000 a year. It's a little bit cheaper, and everybody gets insurance.
You understand that politicians put forward, like, he's marketing. This is a sales piece, right?
Although you haven't read it, I don't think you should have an opinion on this yet.
No. My opinion is this is for all politicians. He's trying to sell an idea.
He's done the math. He lays out the math.
I'm not
here.
saying that it's necessarily all wrong. I'm just saying that this is a marketing piece. Inherently.
No, I'm telling you about the math. You're telling me it's a marketing piece. I've done the math.
You know you can market with correct math.
I know, but you can, but marketing is not.
I'm just curious why you have a position right now when you haven't done the math. Go do the math and then let's talk about it. It's weird to have a position before you do the math.
I can understand. I understand incentive structures without having to know the specifics of the math.
But if you
Bernie Sanders,
no, you can't understand. You don't know what the incentive structure. What's he incentivized for?
He's incentivized to promote this plan. He wants to pitch it.
What does he get out of it?
I don't know, but he obviously does.
Oh my God!
He's campaigned on it for 50 years.
Socialism.
So hold on. What do you think he gets out of it?
I think so.
Because this has been.
What does Bernie Sanders get out of this?
He gets to go down in history as an American hero.
Sure. He's been fighting for this for like 40 years.
It's altruism. You're going to look me in the eyes and you're going to tell me politicians are fighting altruistic.
Brother, if you can't look at Bernie Sanders' life and say that is a person who didn't fight his entire life for what he believed and didn't benefit very much from his position. This is a guy who's lived a very meager life most of his life. Really? Bernie Sanders, whatever you want to say. Yeah. Look at his actual net worth. His net worth is entirely like his house and then some money he made like 5 years ago from writing a book. This is not a man who's gotten super wealthy. Bernie Sanders is one of the few like men of the people.
Maybe we should consider that as a bad thing.
Oh,
is he bad with math? Like, is he bad with money?
No, he's not driven by money. He had plenty to live. There's a lot of people. I know that this isn't a popular opinion on the right, but there's a lot of people, myself included, and I did the corporate America stuff. Not everybody is motivated by being rich. A lot of us literally just want to make enough to pay our bills and put a little away and then live life. If I could work 20 hours a week, I would. I can't work 20 hours a week. I have to work like 60.
Okay.
But if I could do 20, I would.
Let's say Bernie Sanders is actually saying he's altruistic. That still leaves him wanting more money because that allows him to spread his altruism further.
I don't care. I've done the math, and the math works out.
I don't care.
No, listen. Like, I don't really care about anybody. If Donald Trump,
you're not looking critically at the incentive behind it.
If Donald Trump wrote this, and I think he's a horrific douchebag scumbag, I would look at the math, and I wouldn't give a flying fuck what he feels. This is based on math. I'm not like a fanboy of Bernie Sanders.
I think starting with math is your.
Even with the math, there's countries all over the planet.
Shut the fuck up. Shut up.
I think that the math is a good place to start. It's the applicability, the people that abuse things, systems that don't work. Like all of these other things have to still be considered taken into consideration on a holistic level. Math is great. We can math all day long, but we still have to look at the big picture. And I think there are some scary pieces built in.
The problem is, Sarah, is you can't quantify the things that you're saying. So like what you're saying, like the person that makes $30,000, you can't quantify how many people that is. That might be one person. It might be 50. It might be 3,000. It might be 50,000. And so all I can look at is the math. I'm not going to factor in things where I can't quantify them. It's impossible. And I think that that's one of the biggest problems in like American debate spaces is there's a lot of people talking about hypothetical shit that we can't ever quantify. If we just broke it down to brass tacks, this is paid for. It's revenue neutral. I don't care what the ideology is behind it. Better outcomes, and it's revenue neutral.
Approximately.
I also don't know how you take advantage of a universal healthcare system. Like, are you suggesting people jumping off their roofs or something because they don't give a shit?
I mean, I see people taking advantage of welfare, taking advantage of food stamps, taking advantage. I mean, people loop the system all day. It's literally a thing.
Yeah, but this system, he has to specify.
But how do you take advantage of healthcare?
People,
They double bill, and
well,
there's
not only
actually
that,
That's the providers, not the person
example.
using it.
I gave the example before. I go to the doctor. Oh, my back hurts. I think I need some pain medications or something. Doctor prescribes because it doesn't matter because he's getting paid. I'm getting the pills. Whatever. I take it home. I go turn around, sell it. Done. I've just taken money from the American.
Who are you going to
citizen.
sell it to? The drugs cost $3.
Everybody gets free drugs.
Who are you going to sell it to?
I
and
don't
you
know.
can't double bill.
Well, but
Okay, it's not a thing.
But
Listen,
they would have to go and have it prescribed to them, and if they're found to be a pill popper or something, then that could play an effect too. They don't have a chronic issues of any sort.
These things do happen occasionally, not very often at all, in Canada, right? But like, just because these things happen is not a good reason to not adopt universal health care so that everyone can benefit from it.
Can I illustrate something here out of this Bernie Sanders link you dropped? The very bottom, the last sentence on the whole document says, in 2020, 69% of the American people supported providing Medicare to every American. If you follow that link through to the Hill, which shows the poll, at the very bottom we find out that this poll was conducted online from April 19th to 20th among 958 registered voters.
You skipped over all the math that I said I based my opinion on, and then
I'm
you went to a poll.
I'm pointing out one thing. You're claiming these statistics as these numbers as if they're.
I have not made any claim about that 69% number.
I'm just using it to illustrate one point. I followed one number back to the source, and it was less than 1,000 people.
The only number that doesn't fucking matter. Why didn't you look at the math? Why are you looking at a poll?
For expediency.
It's not relevant to this conversation.
Because they're making yes, it is. They're making claims about numbers.
This is what you're doing. Let's just be honest about what you just did. Let's just be honest. Let's just be honest about what you just did.
You have Bernie Sanders. You have Bernie Sanders. You have Bernie Sanders who is making a claim about all American people based off less than 1,000 people.
I'm not. I am making the claim based on the math. You're avoiding the math. Dude, this is the dumbest, this is the most meat brain. You are desperate to find a way to find something wrong. So you went to a link about
They didn't ask 1,000 people what 2 plus 2 is to hope for the right answer.
I never once cited that fucking poll. The reason
to.
I sent you this link for the math.
I'm not addressing your point.
Oh, I'm not going to
address your source.
Okay, I found the numbers of how many people.
I'm addressing your source, not your
point.
Here's
the math.
That's not the source of my math.
Hold on. Over 20 million households make less than $25,000 a year. 20 million. All of the other household incomes don't come near that. Everybody else is 16 million or below. When you get to 25 to 29, it's 4.5, 30 to 34, it's 4 point something, 35. And then it's not until you hit $50,000 where it shoots up to 8 million.
Damn, they must be getting free healthcare or something. That's why they're staying that low.
What I'm saying is that number, though, if you were basing it on a tax bracket, that they would pay the least amount, but they're the heaviest burden.
Correct. And preventative care and access to care makes that community more healthy, which means that makes people more likely to work. That community is already a massive drain on us financially. They were already mostly paying for that community when it comes to healthcare. So now we subsidize it with healthy people. It's a brilliant strategy.
But whereas I pay $30 every 2 weeks or 45, I don't know, it's 30
you
to $40.
Pay, but your company pays a lot too.
Yeah, my company bears that burden, but I work for that company.
But maybe they'd pay you more if they didn't have to carry that burden.
But I'm still getting.
There would still be private insurance. I still have private insurance.
Well, we would do it a little differently than you guys. I don't love your model, but.
But I'm still paying.
Canada's going to become the 54th state. I don't know what we're talking about.
Welcome, Canada. Not with open arms.
It's just no.
Sarah, can I
Please,
say
no.
one thing? Do you mind if I ask a question?
Yeah.
So just one thing I got from it was I think a good exchange, but RTP. The one thing I sort of picked up is that when you say it's all about the math, baby, and even if I accept your moral stance that okay, objective healthcare, universal, better, it's good for everyone, whatever. I still don't know the person who's making this argument. Then, like, that's kind of the context that I lose. I don't know if that makes sense. That it almost seems like when you're trying to contextualize it, then in the broader political process, the hiding behind what you say is math and what you say is model and what you say is an outcome doesn't clarify for me if I'm center left or something like that. It doesn't clarify for me who actually in the Democratic Party and Republican Party are going to be critical and useful in making something like universal healthcare successful. Right? It seems like a the caricature of Bernie Sanders is always in front of the mic and stuff like that. I believe Bernie Sanders. I think he's a great guy, but I also think Bernie Sanders does represent a political view 100% of the time, even when it's not right.
He might.
We're not right now.
I just don't care. Like, this plan works.
Only if
the math checks
only,
out here.
The math only works if the numbers you're inputting into the formula work. And
well, you haven't even looked at the numbers, so it's weird that you keep trying to argue it.
One number. I'm looking at another number right now. All these numbers are shoddy.
And what's shoddy about the numbers?
You don't. What do you think is shoddy about the first one? I pointed out what's shoddy about it.
That's not any of the. I didn't cite that number. I didn't cite that.
I don't know what math you cited. I don't.
Well, the math, certainly the price of healthcare would not have included a fucking poll about who likes it. Certainly, I wouldn't have included that in a financial equation.
What I'm saying is that you are using Bernie Sanders.
You're not saying
talking
anything.
Points and numbers.
No, I'm not. I'm using his numbers. I'm using his numbers.
You're using his numbers, right?
No, you guys are making the same claim. You guys both want me.
Bernie Sanders. Look,
I think one of
Bernie
the
Sanders, Bernie Sanders flexes the numbers in one spot. Do you think that he won't do it in other spots?
Could I answer, please? Thank you. I've done the math on this, and you haven't. So until you've done the math, let's.
I'm doing the math right now.
Okay,
I'm
well, when
in
you're
real
done,
time, and it's not
well,
checking
why
out.
Don't you haven't. Okay, what math did you do? What was the equation? What were the variables that you included?
The equation is y equals mx plus b. Fuck yourself.
Yeah, you didn't do the math. You're full of shit. Fuck you. No, don't see her.
Why would I do the math? Why would I do
you
math
just
with
said you did the math.
numbers?
Why'd you say you did the math? I did the math.
I'm doing it right now. I'm looking at this right now.
This is again Dunning-Kruger. Like fucking so much confidence. You haven't done any math. To answer your question, sorry, your name's cut off. Hold on, I'm not talking to you. I'm talking to the guy that asked me.
You have bad variables.
All right,
if you
Scott.
have bad variables.
Your question, Scott. I'm
if
talking
you
to
have
Scott.
bad variables.
Talking to Scott, please.
Like a quack quack duck.
Duck. Sorry, I'm talking
to you.
I know.
If
Duck
you
asked
have
me a
bad
question.
variables, what good is your formula?
I'm trying to be. You haven't read the fucking formula. Shut the fuck
you
up.
take me
and go
Taylor can talk. You guys
together.
quiet
Let's
for a
go
second.
together.
Taylor can speak for like anyone on the panel. He's a beautiful soul.
To
I
answer
don't
your
even want to
question,
do
like-
that anymore.
Jeez,
Let's go through one of your numbers.
No part of my plan relies
Let's do it
on
together.
an individual that I think is going to lead. I don't know if is that the question you're asking, Doug?
Let's do our math together.
Dude, I'm
Let's-
talking to Doug. We can do
Yeah,
it.
yeah.
I know
So
that
okay,
you wanna
so
talk to Doug.
okay, yeah.
'Cause he asked
let
me a question and
give
you
me 1
interrupted,
second. I can
dipshit.
answer this. Okay, so I love Nancy Pelosi. Everyone in
Ooh.
chat, don't boot me for saying this. I love Nancy Pelosi, but Nancy Pelosi is also hard as nails when there are political issues on the line. She's always been one of the first people out. Same with Elizabeth Warren. These are some of the most honest people in Washington.
Elizabeth Warren.
They're honest in their strategy. They're honest in their politics. And so when someone says universal health care, and the message I get isn't that we're doing this for dignity, we're doing it to simplify what it means to take a career in healthcare and that the United States can support this. The only thing that I'm getting back from this is that, well, I'm actually just trying to do a version of cultural Marxism. So now we get universal healthcare. I'm only trying to silence people like whoever it is, like Tim Pool or Dave Smith. Those guys are kind of like, they're morons in my opinion. But they're morons that I still want talking about politics. And so that is what I don't believe you. I don't believe you when you say math, that we're actually talking about those that have carried the banner of progressive politics. And I believe that you're trying to silence people, not elevate their voices. That's what I mean.
That was fucking stupid.
Yeah, that one.
That's not what I'm trying to do. So cool.
Can we go through the math that you did?
How universal health care does it doesn't do anything for for or against people speaking their minds, except perhaps if someone like breaks their jaw, it fixes their jaw. Like,
yeah, I mean, the math is pretty simple, right?
I don't understand. Well, I don't understand the logic here because there is no logic here.
America is the only wealthy country on the planet that doesn't have a universal healthcare system. The population of America is arguably the least healthy people on the planet. On top of that, seems to me like you guys are stuck in a loop of being pawns in your own game, right? The medical industry over there is keeping you guys fat and plump and diabetic and cashing in on all of your insurances.
Canadians aren't fat.
Co-pays.
Pretty much.
Well, also
I didn't
Canadians
say there were no fat Canadians. There's a lot less of us than Americans.
Canadians are cashing in on the same equipment that we're using. Like all the innovations that we have, you guys have. That's the only reason you have it, because we decided this is the system we like.
Universal healthcare in the United States is not.
That's not true.
That is
That's
true.
a
We
lie.
are leading the world. Even Switzerland can't compare.
You're
to
not.
us. Yes,
You're
we
so
are.
not.
By every
The only
metric.
way you
By
lead it
every
is
metric.
if it
Look
makes
up.
you money.
It's not hard to Google something. It's not hard to look this up.
Google who invented
Isn't
insulin.
Canada one of the
and
worst
Google
at
how much
socialised
Canada
healthcare?
made off of it.
Yes, they are.
Which are the best countries with socialized healthcare?
Denmark, Sweden. I mean, literally
Don't
every.
they pay like 66% in taxes though?
We're dead last in healthcare, except for with waiting times, except for Canada. Canada's the only one that has longer wait times than us.
Where does Australia sit on that list? How is Australia?
I actually
Yeah,
have.
we've got wait time issues here in Canada. We're not perfect. We have our own issues, but like, my God, the
Nobody
ability-
died in a waiting room though.
I cannot tell you how amazing it feels to just walk into a hospital. Fucking, they can do anything. I got knocked out and my gallbladder was cut open and stuff was removed and I was sewn back up and I was out of there that day and I didn't have to worry about a single cent.
Same thing. I got my gallbladder removed and I'm still mad about the $6 I paid for parking.
You're paying for
No,
it either way.
no. Oh my God.
You're paying for it either way.
That is such a close-minded and selfish way to
Some
view
things we should be
universal
close-minded
healthcare.
to.
That's a selfish
math.
way to view. Like
have
you ever heard the saying
I'm trying to get you to take me through your math. You won't do it. You keep wanting to talk to Duck and shit.
A rising tide lifts all boats.
Yeah.
A rising tide lifts all boats. Universal healthcare works that way.
No, it
We
doesn't.
all benefit from it. We all benefit from it. Even if I spent my entire life never needing to access the healthcare system.
There are
which is
some
like-
people that do not benefit from it, right?
No.
No,
There's very little chance anyone lives their whole
everybody in
life
Canada
and never
benefits
see it.
You don't
in
think
some
people
way.
with higher taxes are losing under that system? You don't think the people who
No,
are
they're not
shareholders of
losing.
companies are losing?
They're not
You don't
losing.
think
These
people,
aren't hired.
people who are employed
They're not lo-
by
in
the
the long
private
run-
healthcare industry, do they lose?
In the final calculus of their life, they are not losing.
In that
That's a
system,
claim
can you
that you're
opt out
making
of
that you
paying
can't
into it?
possibly know. You cannot
It is
possibly
not
know.
this.
This
Can
is
you
why
opt
we
out
need
of
to
paying into that?
define
This
harm.
system is not a net. It's not a zero-sum game.
You're making statements based off faith.
Brother, that's your whole fucking night. Shit, you don't be casting aspersions. You're talking about numbers you haven't done math on. Shut the fuck up about other people.
I'm trying to get you to
be
RTP, you don't have to be rude. Yeah, you don't have to be rude, douchebag.
Duck, you can shut the fuck up.
You're gonna act like a prick. Shut the fuck up, bitch.
Oh, now
You're gonna be
oh,
rude to
no,
people.
you don't
I know
need to
we're
be
on
rude.
hour
Hold on,
5, dude. Wake up.
This
Wake
guy's
up.
been
buddy.
yelling at me.
Don't let him crash out.
Wake up, buddy.
He doesn't want to do math. Don't let him
This
crash
guy's
out.
been yelling at me for an hour. Shut the fuck
All
up.
right, come on. All right, come on, buddy. Let's do some math.
Hey, what math?
This message is sponsored in part by
Dealer's choice. Let's walk through whatever math you want to show me. Just choose one number and the formula.
Can we not do math?
I know that you would love to not do math, but he keeps relying on the claim that he's.
Guess
he
what?
keeps
Guess
falling
what?
back.
Guess
This
what?
is his
Guess
sport.
what, Dusty?
He says
Guess what,
I did the math. I know better.
Dusty,
So we're going to
guess
do
what?
it
Guess
together.
what, Dusty? Dusty, guess what?
Math
is
I got some
boring.
great math. No,
Math
I got
is
some
boring.
great math.
It's
I
his
got some
trump
great
card.
math.
If he
How
keeps
many
using it to
Canadians
validate
are
other
currently
claims,
in debt
let's
from
do it
medical
together.
bills?
Hey, there's a good
I
question.
I appreciate Dusty,
Zero.
that you said earlier you did the math, and now you're trying to like flip this. But everybody here knows that you lied earlier and said you did the math. Do it on your own,
That's fine.
bud. It's not my job to
No.
do your fucking homework. Go
It-
read it. You
Well,
haven't
then,
read
if
it
you're
yet.
not gonna if you're
Go
not
do
gonna
your-
show us
go
the
do-
math,
go
you
do
don't
your
get to
homework.
claim that as you winning. Then I
show-
did the math too.
I
did the
wasn't
math.
I wasn't debating you, and I covered the math
Look,
earlier.
I did
You're
the math.
You're here to talk to
I've
me.
done the math. You
I was
haven't
here.
done the math.
I was here to lay out my argument earlier and do the math, and you haven't done your homework yet.
You were
and
up here
can come-
yapping while
and you
I
can
was
come-
doing the
and you can
math.
come see me. Well, what's the math? What math did you do?
Oh no, I don't have to show you.
Oh, what did you pull? What did you choose for the?
Trust me, no. I
was
did the
the
math.
rate? What was the
Stop,
on the
stop.
income tax? what
Only
was the
one of us.
percentage-
No.
What was the
Oh,
percentage
now you
on
want,
the income
now
tax?
you want to do the math.
I asked you to do
Oh
the
my
math
God.
earlier. What was the percent on the
I
income
told
tax
you I've
used?
already done the math.
Yeah, you're too.
It's not my
you didn't
job
do
to
it.
teach you.
Nobody
It's not my
here.
job to
Nobody
teach
here
you.
think. Nobody here is buying your bullshit right
Dusty,
now.
you
Bud.
know what
Everybody
you are
watched.
right now?
Everybody watched you lie about doing the math 20
No,
minutes ago. Nobody
you're
has
lying about
forgotten
doing the
that.
math. I
Nobody
clearly
has
did the
forgotten
math.
that. I was here earlier. I did the math earlier. Everybody
No,
knows
I
you're
did the
lying.
math earlier. You were yapping with Sarah.
No, you are.
You were yapping with Sarah and flirting
you
with
are
Sarah while I was doing
overconfident,
math.
Lazy.
I was
dummy.
in
I think
hospitals
this is who Sarah was
ladling
talking
soup
about.
in the
They're just
children's
gonna-
mouths
they're
while they
just gonna
died of
take
cancer.
advantage of our
What were
system.
you doing?
Lazy people like Powder Dusty are going to take advantage of our system if we give them health care.
I'm just saying, if you're going to make a claim, let me see the support.
He
I did.
would.
I did already.
Flow State would. Flow State would take advantage.
That is your
Absolutely.
loophole advantage, least path of least resistance, motherfucker, right there.
I do a daily show. You can come visit me when you do the math. We'll talk about it. I'll give you all the time in the world.
But not tonight.
Well, could you tell me what the income tax rate is that you did the math
I could, but that's not my responsibility. That's your responsibility to know the math.
Look,
So
just out of good
only
faith.
one of us did
Just
it.
to be
I'll do the
fair,
math
hold
with-
on.
I'll do the math if you give
He
me the
was.
number.
I will say RTP was walking me through all of those, like the 2.2%,
you're
so
a
on and so
girl.
forth earlier.
She's smarter than you.
She's not. She's smarter than
She's
you.
clearly
can't do
smarter than
math.
you. So what was the
am
percentage? If we're going to be
smarter.
good faith, I'll walk through it with you. What was the percentage of income tax increase?
Oh, you agreed to walk through it with me. I didn't agree to walk through it with you.
Yeah, that's what I
It's
thought.
not my
You're
job to
full of
teach
shit.
you.
Nobody believes you, bud.
Will you
Nobody-
stop being so lazy and have a little intellectual integrity?
Nobody here thinks that you did that, bud.
You don't speak for everybody here.
Does anybody think that he did the math? Speak up
Everybody
if you
thinks
think
I
he did the
do.
math.
I've done
so
the
my
math.
Yeah, I think Dusty did the math, and I think he
Thank you.
also needs to hear retards like Rude Mud Crab. Sorry for the R slur, but like even really stupid
You
people
can
on
say
Sarah's
rude mud
panels.
crab all you want.
Yeah, thank you, sir. Kind sir. Even stupid people need to be heard, and you're trying to silence them. Dusty's good at math. Dusty's good at lots of stuff.
He didn't
So
do
are
the
lots
math.
of people up here.
He didn't do the math. I haven't tried to
What
silence
are
Bro,
you
him.
I've been doing math for years.
What was the percentage of income tax?
You can't cheat off me. Just because you didn't do the math doesn't mean you can copy my answers.
If you go watch it, I've stated the math publicly. It's on record. You're the only one that hasn't here.
Oh no, I stated it publicly. It's on my channel.
Yeah, you're a bitch.
It's on my channel.
Yeah,
Yeah,
sure
look
it
at, look at my old live streams. I do math all the time.
You didn't do this math. You're lying.
I'm not
Everybody
lying.
knows it. Everybody knows.
Can you prove it?
In my tax
Gentlemen, do
bracket
you
in
need
Canada,
rulers for all this dick
1%
measuring you got
more
going on?
federally than an American does in the same tax bracket.
Hey, Canadians, can you guys opt out of paying for social healthcare?
No.
Nope. It's taxes.
Like in Australia, it's you have a socialized healthcare system, but that gets taken out of your tax if you're paying over a certain tax bracket. If you opt in to do privatized healthcare, then you don't have to pay that tax.
Isn't there a provision? I think Sarah said it earlier, like 95,000. You guys have to like have subsidized in Australia, or do you have to like subsidize your health insurance if you make over 95,000? Is that what we
Yeah,
looked
it's
at?
the
there was
Medicare
a-
Medicare
yeah,
levy.
somebody
If
sent a
you
super
earn over a
chat.
certain, if you're
Mud
over a
crab?
certain tax bracket, then you have to pay the Medicare levy, unless you're paying for private healthcare. Then you
So
can claim
what does that
back.
mean for
Yes,
someone
that's
who
fun.
is unemployed or
Australia's-
on disability in Australia?
Australia's
get
Medicare
universal healthcare?
system has a levy of 2% for incomes above 30K single, and once your income goes above 90K, there's a surcharge if you don't have private health insurance.
I did that math already.
But out of curiosity, in Australia, if you don't work at all, like you've got
Yeah,
disability
if you
or
don't
something
work,
like
you're not
that,
paying anything. If you're not paying tax, you can't. Like if you're not earning an income,
healthcare.
yeah, you get free healthcare.
You do get it. Okay.
See, That's the part
I
that
was saying, can you opt out of it if you're buying private health cover?
Why would you? Aren't you compassionate? Don't you care about sick people?
Here's another bad argument.
Yeah, I wouldn't
Are
opt
you-
out of it even if I was
Dusty, are you about to go diagonally down a chessboard? Because if you're not, get that hat off.
I'm about to bless you, son.
Hooligan.
Can you guys bless me with some-
Harry spent $5 to put you backstage for 5 minutes. Hang tight back there.
I'm gonna head out. I gotta still prep my show for the morning. It was an absolute pleasure.
You should do some math while you're out.
Yeah, good one, dude.
Stop it.
Fucking hilarious.
Any final thoughts you'd like to send out into the world, RTP?
No, everybody, stay cute and cool and have a great summer.
Thanks, RTP. It was good having you on again. I'll get you set up with Rob here in probably not like 3 weekends then.
Perfect. All right. We'll see you.
All right. Bye. All right, boys. I'm giving you 10 more minutes and then I'm going the fuck to bed.
Can I sit by Hornet so that we have cool hats next to each other?
Sure.
Hornet's wearing a helmet, not a hat. You didn't calculate that very well either.
Okay.
Don't play semantics with me. You haven't read the dictionary.
Can I please make it very, very clear? Because I've seen this in chat way too much, and it's been implied during this panel too. Canada is not socialist. Okay? We do not have a socialist economy. Okay? We are capitalist. All right? We're like this close to the level of capitalism as the United States of America. Like we're like the same. We just have stronger. We have stronger social safety nets. We have stronger social safety nets.
You can't be that close if you've got social safety net.
The U.S. has social safety nets too. It's just they're not as good. But so
heard that Canada's
we're not this
close.
close. We're like this
Our
close.
bar is really low. That's why when RTP was talking, I was just like I understand universal healthcare, and I like Elizabeth Warren's plan for that.
She's that nice Indian lady.
But the issue that I find with it is that, again, like I've been saying over and over again, that when we do that, we are automatically breeding out some of the competition that we have with pharmaceutical companies because they have to negotiate for lower prices. And that's the part that I don't necessarily want to happen, especially with like medical innovation. Like that's something that I don't want to see drop off because, again, making the discoveries that we do, like to bring up Moderna again, like that was amazing what we did as Americans, and we had the rest of the world helping us for sure. But we can't say that America wasn't like a big factor in that, right? So for me, the issue is like a solution that I would have would be raising the poverty line below, because I think it's set to 34,000 at the moment. If you raise that to about 55,000, you're covering most Americans, and any American that's earning above that is earning above the average. So they probably have some private medical insurance, so you still have the benefits from the private sector as well, feeding into these pharmaceutical and biotech companies.
Sarah, I think that you could make a show just based on Americans' misconceptions of Canada alone.
Oh, but nobody would watch it because nobody cares about Canada.
Listen, you're just American waiting to happen.
We have a lot of Canadians that watch. So
we have like the whole northern border of states.
Yeah, I mean, even Rachel's ghost, like I don't think she's very. I could be wrong, but I think my understanding is that she hates their system up there.
She loves Trump.
Yeah, full Trump all the way. Neve, I don't remember if she's made complaints about it or not. I know it's expensive.
She hates Trump.
No. The Canadian system.
She's a big Canadian advocate. She will never shut up about that.
Yeah.
They've got an inferiority complex.
Is that because they're above us?
No, it's because they're smaller and weaker and colder and.
Spock wants to live up there. I would not.
Stop talking shit. In all reality, Canada does have more economic mobility than the U.S., which a lot of people will be surprised to know.
Well, like I posted something in the back that shows like the innovation skill that they use. and like America's at 7 while Canada's at 18, right? Like there are aspects of Canada that are really good, right? Like the quality of care is higher than America, but then on like most other metrics, you guys are lower than we are, except for financial stability.
We only have like 40 something million people here. Like we're not a economic juggernaut like
Yeah, but choice. This also includes choice, science and technology, and financial stability in those stats. So it's not just like the amount of people, right? Americans have higher choice because of the privatized sector, but they also have lower quality of care, but not by much. Our inpatient care seems to be pretty high comparatively. I think we rank number 6 in the world. So
for those who
doesn't
are able to access it, yes.
Yeah,
I would imagine Canada has much higher rating in terms of accessibility of healthcare.
that's the fiscal sustainability aspect of it.
Yeah.
Like we rank super low on that, right? Like that is the one aspect of America that is like the problem that I would want to address. But it's also addressing that while not losing some of the benefits that we have from funneling all that money into like the public and private sector.
Yeah. So one of the interesting things too, though, is that you can compare the United States and Canada. We're both very wealthy, liberal nations. But if you look at the story of U.S. healthcare, I mean, it's also been exported and built alongside Latin American, Caribbean healthcare systems. This is a really old story, and so you see that in one sense you see this like strict competition between private healthcare and whatever else there is, and in another story you see it as this almost like essential political thing that you just have to have. You just have to have it. You have to have it to be truly democratic, or you build it yourself like Cuba. And so it sort of inverts that story that you guys are telling.
I've always loved Cuba.
A little bit.
Now that I'm back, I want to see if I can trigger some more super chats to get me thrown off the stage. I wonder how triggered everyone would get to find out that Canada has on the table for next year universal income.
I think it already happened. I think you already got kicked off.
Yeah, we don't care about Canada though. That's the thing.
Yeah, universal income. That's even like now we're really
So
just.
at what point does this turn into just like you're a slave, right? Because slaves get all these benefits too.
What?
What?
They get
same rations, same
that
room to
patent?
sleep.
You mean
same
absolute
bed,
freedom?
Same amount of clothes. Same
Is
amount
it
of
absolute
time
freedom?
off.
Because they get everything provided for them. They don't get to make any of those decisions themselves. And
no one's mailing people clothes and food. They're going to get money so that they can spend it however they want.
Right. So
Like
it's a slightly different system.
housing
You're actually
or
getting
vacations.
good handed to you. You get.
If I get UBI, I'm saving that money. I'm saving it up.
How they're
Qualify
going
for
to
it, but I'm
ensure
happy to
that
pay for
they
it.
no, because then the prices around you are going to form fit exactly to the amount that you make, just so perfectly to where you can't afford to save it. And as they increase prices around you, and you still are only getting the same amount of income,
Next thing you know, you're in a gulag.
We still have competition.
Frozen rocks.
Wasn't it Amazon that was trying to build its own little community?
Mm-hmm.
Yeah,
I think so. Amazon, as well as the billionaires.
Just a comment on. Wait,
it was
just a comment on
Andreessen
that.
Horowitz.
Chuck, let me comment on that.
A16Z. Well, I'm just before you, real quick. Like it wasn't just Amazon. All of the major venture accelerators and billionaire investors are trying to build these little sustainable, all-in-one sort of living solutions arrangements. So that's it.
Yeah, but like let's say like everyone followed that method, like everyone starts saving that money. Then you have a deflation happen to your currency, and then your economy crashes. So now everyone can save all that money. It has to enter circulation at some point. Otherwise, you're going to have an issue that way as well. So UBI is not a solution to any problem. Like it just will lead to more problems down the road.
UBI has worked when it's been tried.
Where?
Before.
There are countries that currently have UBI.
Where has it worked out? Give me some place that's been tried for a while.
I think Austin, Texas tried it for a short while. If I remember correctly.
They tried it for
Austin,
a short while,
Texas
so they
also
stopped.
had private. They also had private exchanges off of the. They had.
There is no
They
place
had.
where UBI has worked for any
Austin's done a lot of
sustainable
crazy
duration of
stuff.
time.
The universal income would only work if the entire country was just completely in shit show. Like nobody was doing well.
It's a
That's the only.
Wally situation. That's what it is.
BB sends a big 5. Tomato epic effort. Men, you lost smallest twang contest to Australia. Always will.
Fair
What's
enough.
a twang contest?
It means we got bigger wieners than they do.
No, definitely not. You better Google that. You'll find out you're wrong.
There's an extra T on there. It's yeah. You guys win the smallest wang contest.
And Hooligan, I'm going to go ahead and let you give your final thoughts since you got booted, and we'll be shutting down before you make it back up.
I love my country's healthcare system. I don't pay that much more taxes than any American does in my same tax bracket. If there was one change I would make to my healthcare system, is I shouldn't have to pay $6 for parking when I go.
Oh my God.
Oh.
Was that serious, or are you being cheeky?
No, I swear to God, I fucking hate paying for parking when I go. I purposely drive my mom to her appointments so she won't pay for parking.
Fair enough.
I'm not going to tell him that you want to be a parking magnate.
Thanks, Tomato.
All right, you Hooligan. We'll see you next round, okay? Bye.
I would charge him $10.
I'm going to start charging you to sit on panels.
Why?
Just because.
Then you wouldn't get the free blessings.
Gonna get. Gonna start making a cover charge to get on panel.
Go to your chessboard already.
I wonder if that would work. $10 cover charge at the door.
It might.
I
mean, in all reality, like if the panel's full, I pay $10 cover charge. To get my
yeah, that's true. Okay, so technically there's a cover charge if it's a full house. You're right. That's fair. Okay.
Yeah, you got to fight back there if there's like 10 people up here already.
Yeah, that line gets hefty sometimes.
Yeah.
I mean, I'm not complaining. It's great. I'm glad I kind of bought those extra backstage seats, but there's nights where it'll just go beep 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 as soon as I drop the link and they're all popping up backstage. I'm like, oh shit. It's crazy. All right, gentlemen. I think it's time for us all to go to bed and say our good nights.
It's almost 4
together. That's weird.
Why not? We can all snuggle up and
I don't like this ratio.
I'll sleep on the couch. You guys can have the bed. It's fine. Don't worry.
That's a better ratio.
Does that fix the ratio for you, Flo?
2 sets of tits, but there's too many penises.
I mean, in all fairness, I haven't seen Rude Mud Crab, so.
Hey, you don't need to. I got enough of you guys in my DMs.
But he doesn't sound hot.
Yeah. All right, Hornet, would you like to kick off? Thank you, Yehooligan. Yehooligan. Hornet, why don't you kick off with your final thoughts of the evening?
Yeah, so I think the universal healthcare or Medicare for all can be achieved at a certain point. I don't think we're at a stance where we can just plow into that. Again, I think the best approach would probably be increasing the poverty line to a reasonable amount. And then from there, we can work into incorporating more and more people. But until that point, I don't think that just jumping straight into it would be fiscally responsible. And also, I can't wait for Canada to finally join the USA so they can shut up about their free healthcare.
Fair enough. Thank you, Hornet. Flow to you.
I don't have any final thoughts. On the whole, I'm very disappointed that dude didn't do his math. And I do appreciate Canada's maple syrup. I'm really a big fan of maple syrup.
Hell yeah.
I swear to God, we have a Sam's Club membership only for maple syrup because it's not close to our house. but the savings is enough that like that's how much maple syrup. Anyways, I'll stop fanboying about that. Thanks for having me up. Salute to the panel. Salute to the chat. I put a link backstage. If anybody is not subscribed to me, you should be. And see ya.
Thank you, Dusty. Krabby, to you.
Yeah, I only came up to say that socialized healthcare isn't all it's cracked up to be. It's hard for me to find a doctor in Australia that's not Indian or Asian, and realistically to judge it based on satisfaction of healthcare. That's hard to do. Because if this is all you know, then how can you know if anything's any fucking better? It's a bit silly. Anyway, thank you.
Thank you, Krabby. Dragon Rage.
So I'm just going to kind of say this part is ultimately trusting the government to be able to run it as it is right now. Medicare and Medicaid can't be run solely by the government. They have to outsource it. Every state has to outsource to private insurance companies to be able to run the services. And then, in terms of it, I really don't want to trust the federal government 100% to determine what is allowable, what's covered, what's not. And then the part is, ultimately, with the Medicare rates, they don't negotiate. They tell the providers, here's what you're going to get paid. That's it, whether or not it hurts your bottom line. So a lot of Medicare providers working in the healthcare industry, they flat out say that if it wasn't for them having self-insured people coming in, they wouldn't have their business. Their offices would end up closing. So it's one of those situations. Ultimately, I think it's something that could work years upon years down the road if we had more safeguards put into place. But then we start looking like Canada. No offense to you, Kay, there. I'm just pointing out the fact that there's a lot of people that I've worked with that have been in Canada, and they flat out in the terms will not stay there for long-term care. Accidents like breaking an arm, 100%. They say, go to Canada, you'll get covered. Walk in, they'll cover you, no cost. But anything that's long-term, like MS, cancer, muscular, I can't speak it. MD, see a few other ones. You basically wait forever before you get anywhere. If I was in Canada, ultimately I would be almost dang near paralyzed because of my MS. For just waiting. I got seen within weeks from having one issue to being fully taken care of to moving forward. So ultimately, I want to appreciate and thank Sarah for letting this happen. Kind of was a little slow to start off there. Was able to have a little fun, but today was just a horrible day for my head. So appreciate everyone. Love the conversation. That's about it.
Thank you, Dragon. KO Dave, to you.
Yeah, I'd say that universal health care is pretty much based. I think that you Americans might actually be pleasantly surprised at how well it can go, especially in a country as rich as yours. And finally, again, Canada is not socialist. If you think it is, you don't know what socialism is. A. Thanks for the fun, Sarah. This was great.
Absolutely. You're always welcome, Kay. Duck, to you, sir.
I obviously could say a lot more, but if I'm not banned from the Discord, I don't know. I just signed up. It's kind of like the Wild West. I'd recommend anyone in the audience who doesn't mind blood sport or getting a little rough, wants to be introduced to topics, join Sarah's Discord.
Left, Duck. You left the
I
Discord
did leave.
the last time you got pissy.
Yeah, I'm also locked in the dirt patch waiting room right now.
Yeah, I know. I think I'm going to put you on probationary. How's that
I'll be on
sound?
my I swear to God, I'll be on my best. I will learn everything I can, Sarah. But yeah, I all I would say is I generally agreed with RTP's points and his position. I also think it's really dangerous when you're trying to talk over someone and when you don't appreciate that the political dialogue and political process in the first place is necessary for good politics to happen. And so that's just what I would encourage people to do. Drop out of that weird Marxist MAGA sort of mindset and actually think what you want to achieve in your own life and how you can help other people, and don't be a cuck bitch. That's it.
Don't be a cuck bitch. Wise words right here. Yeah, I think we have to be careful how we just give shit out and who's paying for what. Quite frankly, I get tired of paying for everybody else to have free shit. I work 2 jobs to make sure that me, myself, and I and my 2 children and dogs are all tended to, taken care of, well nourished, had roof over our heads, food in our bellies, and water to bathe in. I pay health insurance, I pay co-pays and all of those things. And I think we just have to be careful with, kind of how we do stuff. Not everybody wants it, not everybody needs it, and not everybody's willing to pay for it either. So I'm all up for getting a system in which everybody has healthcare. It's just a matter of how we run the numbers in order to make that work. Don't forget, tomorrow we have Jim Bob coming back for the Mormon debates. It's a one-on-one with Ruben. He's quite an interesting character. I'm kind of excited to see these two go at it. I think we're gonna be in for a treat, to say the least. It's gonna be a fun one. And then, of course, Sunday night we have Misfit Patriot and Alex from Playing with Fire debating over the Big Beautiful Bill, I believe. So that should be another good one. Outside of that, I really had a good time. Thank you. Shout out again to Almighty Nate for the big 200 for the dog surgery. I appreciate you very kindly. And for everybody here showing up, rocking out, and everybody that hit the like button, I appreciate it. Otherwise, fuck off.
I needed a birth control that could keep up with my lifestyle. Because I could deal with cramps, but not something cramping my style. That's why we chose Nuva Bling. The discreet yet diamond-encrusted ring that inserts neatly into the vagina. It's pizzazz that slides right up into my choach.
Plus, you can customize Nuva Bling by adding your own fierce and glamorous charms. And instead of throwing Nuva Bling away each month, you can reuse it as jewelry.
So wow up that womb,
Glam up that clam.
and shine up that shine.
With Nuva Bling! Say goodbye to the same old birth control with Nuva Bling.